So, good morning, everybody. It's it's nice to see you all. We're all going to get ready for the meeting. Rebecca, are you all set? Chris, all set? All right. So we have a group of people here who are deaf or hard of hearing, and we have some interpreters in the audience and in the front. Just so you know, I'm assuming some of my other colleagues are going to come in at some point. But I often talk with my hands, but I don't use sign language. So if I talk with my hands, I don't want to offend anybody, so I have tucked my hands down today. And we're going to get right into it. We have a lot of people to testify today, over 330. And if each person talks, whether with their hands or their mouth, that will last until 4 o'clock tomorrow morning. So we're going to get right to it. And first up is Jennifer White Jackson. And you guys are going to be the quietest people that we've had here. Yes.
Good morning, Senator Austin. And Representative Gilchrist. My name is Jennifer White Jackson. I am a Black deaf woman. And I am here to testify as the director of the Communication Advocacy Network, which is abbreviated CAN. Thank you for allowing me to be here today. And thank you for the approval of the funding that you have given so far. This has come to be through a contract with the Bureau of Education Services for the Blind and Services to Deaf Elderly via Title 111, the Older Americans Act. Historically, neither of these funding services were satisfactory to pay for a CAN director or a full-time assistant, scheduler, or the cost of operating administration. If we don't have those roles, we are unable to serve those that we are authorized to serve. If we were able to hire those roles, we would be much more efficient and be more capable of providing the services that are needed by the deafblind community. CAN was established in 2012, and we have been providing services to the community well for deaf, deafblind, and deaf elderly folks. If CAN were not available, then those people would be left in isolation. This is their safety net. These are service providers who are fluent in American Sign Language and able to provide access to the community. Without the services of CAN, then people would be in assisted living or in skilled nursing care. It is very important for deaf deafblind people to have access to the community. Now, since 2012, the cost of living has increased tremendously. And I know there are a number of contracts and funding that has been frozen since then. Our funding has not increased. And so we are asking, we have been approved for a $100,000 increase. I very much appreciate that. I'm asking for additional funding of $100,000 in order to serve those folks that I've just described and to have those additional roles of a scheduler and an assistant administrator. There are a wide variety of tasks that those people would be able to cover in order to meet the needs. And we thank you very much for the funding that you've provided for CAN up until now. I appreciate your time and I yield.
Thank you. Up next is Lisa Flaherty.
Please allow me a moment to get myself ready.
Of course. Rebecca, make sure that we're not starting the timer until the people actually start testifying as they're getting set up.
Hello. This is having to do with Bill number 6864. Thank you very much for allowing me to be here and share my testimony. My name is Lisa Flaherty Vaughn. I am from Enfield. I am a deafblind person, and I heartily support, I am frequently an advocate within the community for deafblind people. As a deafblind person, I face many challenges on a daily basis, and that affects the quality of my life. I have been unemployed, and the reason being that it is hard to get folks who are in hiring positions to understand the accommodations that could be available in order to make it effective for me to offer employment. Most people don't understand deafblind culture, which is the common experience that deafblind people have. I deeply appreciate CAN for increased services, and that allows me to take care of my business confidently. Their services are well suited for deafblind people. The communication is accessible, and it allows us to be in the community and retain our agency. I am asking for your consideration in Bill 6864 for the funding of the staff and expanded roles within the Community Access Network. The Communication Advocacy Network. The funding increase would meet the needs for expanding services for more deafblind people to be able to retain agency and make sure that they can take care of their own business, go to medical appointments, do their own shopping, etc. This is vitally important in their lives for mental health and their ability to take care of their own choices. If we did not have CAN, it would deeply impact the deafblind community. We cannot afford to lose the services that CAN has been providing. And that service, what is it? Do you want me to tell her that time's up? Okay.
Let her finish.
So I appreciate your considering our request for this support. Thank you for listening today.
Thank you. Up next is Cherry Burns.
Oh, she's got it. Hello, and thank you for the opportunity to speak with you today. I am Cherry Burns. I am the mother of 2 children and have lived in Manchester, Connecticut for most of my adult life. I graduated from the American School for the Deaf, and I also worked at the ASD as a residential counselor for a few years and attended Northwestern Connecticut Community College in Winstead. I have been deaf since birth and began losing my vision as a teenager. Now my vision loss has become much worse, and that limits my ability to get around the community. I receive critical services from the Communication Advocacy Network, CAN. I don't know where I would be without CAN services for transportation, communication facilitation, and other needs that they meet. While my family does help me, taking 3 to 4 hours to help with a medical appointment or grocery shopping is not always possible for them. CAN fills those needs as well as other social inclusion needs. Being deafblind can be very isolating. We deafblind people need opportunities to interact with other deafblind people. It's very important to our mental health. CAN helps us by making those opportunities available to us. We are resilient and we appreciate CAN. However, increased support is needed. As you know, CAN needs funding for 2026 and 2027 in order to provide these services that are absolutely critical to us. Connection with the community allows for human connection, and shopping for basic needs, retaining my agency within medical appointments, and the like are very important. Thank you again for your time and attention and the care that you put into your work. I appreciate it, Senator Austin.
Thank you. Up next is Maria Daddario.
Hello and good morning. This is about the proposed bill 6864. Good morning, co-chairs Senator Kathy Austin and Representative Bobby Gibson and Appropriations Committee members. My name is Maria Daddario. I am deafblind. My hometown is East Haven. I have some hearing loss and low vision, and I have been using CAN services since 2019. I love it because I have communication accessibility. Before, I had used other transportations and they did not work well for me because of so much misunderstanding. People did not understand my hearing or vision loss, and it was a great struggle for me. Once I got CAN service and started using it, I felt so happy because I did not lose so much time in frustration and struggle. When I work with an SSP, that is someone who provides transportation and communication, they would let me know if there is something there that I need to read or notice. I can ask them also to be a sight guide for me because I don't see very well, especially at night or if in dark places. So that keeps me safe. I know that CAN wants to keep its service running and expand to more people to keep that service strong. So that CAN will celebrate 20 years of service. Thank you very much for listening to my perspective.
Thank you. Up next is Martin Greenberg. Not here?
Is someone going to read for him? Jennifer would like to read his testimony on his behalf.
Yes.
So this is being read on behalf of Martin Greenberg. He says, I was born deaf in New York City. I attended an oral school at the Lexington School for the Deaf and graduated from there in 1971. I also attended Denver Community College in Colorado, where I learned ASL, and I communicated with everyone using ASL. Later, I studied at Long Island University in New York City and used both oral and sign language to communicate. I came to realize in my 20s that I was becoming a deafblind person. That was about age 26 because of retinitis pigmentosa when I was out in California. I moved to San Francisco and attended Olone College for a year and got a job as an accounting technician for the Department of Veterans Administration for over 15 years. But over that time, my eyesight got worse slowly. So I left my job and received disability income. I moved back to New York City to take care of my aging mother for many years. With my vision getting worse, I struggled to take care of my mother. So in 2002 and 2003, I was a student at the Helen Keller National Center to learn mobility skills, independent living skills, technology and internet supports, vocational skills, Braille, and communication. I lived there in New York City until 2020, just before the pandemic happened in March, and there were no support service providers or SSP in New York City. It was scary for me because no one would help me to go shopping or go to the doctors or even cross a busy avenue because we were told to stay at least 6 feet apart from everyone. I decided to go up north to Hartford and stay with my partner for a few weeks. I was hoping the pandemic would be over soon. My partner assisted me with everything necessary, and I felt much safer than I did in New York City. I requested of the Communication Access Network, CAN, to support me temporarily with a communication facilitator for meetings on or workshops on Zoom since I was unable to see well enough to use the screen. 9 months later, I decided to move here to Hartford because I love CAN services and their ability to provide SSPs to allow me to do my own food shopping, take care of my appointments with doctors, go out for walks, and go to the bank. Plus, a communication facilitator could interpret for me at home or other public places if Zoom access. It feels so much safer here in Connecticut. With Besby and CAN, they have been very helpful in supporting me for 4 years since 2021. Without their support, I would not have been here by now. I request more grant money to support CAN and Besby, as well as the assistant director and scheduler. Those additional hours of staffing will allow more services to deafblind consumers. The rate of pay for SSPs needs to increase in order to cover their gas and hourly wages. Thank you.
Thank you. Up next is Patty Wilson. Yep. Are these aren't deaf though, right? These two. Oh, okay.
Good morning. Senator Austin, so good to see you again. And Representative Bobby Gibson and Appropriations Committee members. My name is Patricia Wilson. I have lived in Wethersfield for the last 3 years. I am a former employee and part-time coordinator of CAN from 2013 and 2014. There were 5 deaf-blind consumers who we were providing services for, and the funding was showing a lack of need. for that service. Today, there is a vast increase to 26 people who are deafblind. Since September of 2024, I have been working as a per diem driver under CAN contract, and we are in need of more SSPs due to the number of requests from deafblind consumers. Please do support Bill 6864 for an increase in the funding from 100,000 to 200,000 to help CAN increase their office staff services, for example, an assistant director and bookkeeper, to keep their administration running. And I just want to tell you a short story. When I was young, about 10, I looked at my father communicating with a hard of hearing and deaf man via a stoma. So this procedure, he would put a thumb on his lips and next to his mouth in order to understand him. He was using an oral method with tactile. The man was asking my father for permission to take me out for ice cream. It was just a couple blocks away, but it would be across a couple of streets. Now, as a 10-year-old, I didn't know anything about safety and keeping adults safe from that. But we held hands and I communicated with him with sign language. Just last year in New Hampshire, there was a conference of deaf people, and I bumped into him. And so the director of the Bureau of the Deaf and Blind, I asked, what was that word for that approach that he used in order to understand what someone was speaking to him? I ran to meet him just before he got into the meeting. Sarah Jean Morrison answered the question for me. She says, do you remember the movie called The Braille Worker, the Miracle Worker, Helen Keller's teacher? And they were putting hands on mouth, trying to understand what people were speaking to them. But over the years, they found a more efficient means of understanding the movements of the face in order to gain that communication. I learned that many, many years ago, that method is no longer popular, and instead, people are using a code called protactile. That deaf blind people who had used an oral method rather than ASL are less familiar with this. And so there's a need for interpreters and people who have the skill of protactile communication that are still used today. So these trainings and these skills are part of our advocacy network. I just wanted to give you that information. Thank you for listening to me today.
Thank you. Up next is Louisa Sobolski. Is Louisa here?
Good morning, Kathy. Good morning, Matt, Bobby. It's so good to see you. And good morning, all Appropriations Committee members. I am Louisa Glasgow Sobolewski, and I'm here on behalf of the Communication Advocacy Network, CAN. I am also here to speak as the president of the Connecticut Association of the Deaf in support of CAN's request for the $200,000 funding in each fiscal year 26 and 27. As a deaf advocate in the state of Connecticut, I am seeing the need that deafblind people and deaf elderly people have for support. This organization has been covering a wide range of service gaps that the state support services do not cover. As the years go by, we see the growth and need for training deafblind people, transportation support, and other needs of deafblind and elderly people. CAN can provide communication service for the deaf, deaf elderly, deafblind, and hard of hearing blind citizens. The services have increased over the years, but the funding to provide those services has not increased. CAN needs additional funding to expand their services, such as hiring an assistant director and a bookkeeper. This would be considered administration fees, as well as continuing to provide those services to deafblind, hard of hearing blind, and elderly consumers. If they were to continue getting the same level of funding, they would be unable to provide the services that the community is in need of. The deafblind and elderly members are often left out of our community, and many of them live in isolation without communication access. CAN sponsors peer-to-peer communication, offering companions, support, scheduling transportation to medical appointments, food shopping, and other basic needs, and community participation. The deafblind services that they provide are support service providers. That's an SSP. They are always fluent in sign language and trained to provide tactile or visual communication. Communication facilitators, or CFs. They are available on site for meetings or workshops. Deafblind consumer support groups meet on a monthly basis, covering a wide range of information and other topics related to their needs. CAN is a wonderful referral and direct service provider for those people who are deafblind, hard of hearing, and blind and elderly. Without that, those folks would not effectively be served. Today, you have heard from a number of clients and service providers who have shared their daily experiences as deaf, deafblind, and hard of hearing consumers. I look forward to working together to improve the services to our deaf, deafblind, and hard of hearing citizens in the wonderful state of Connecticut. Thank you so much for hearing me out.
Thank you. Thank you all for coming. So I just want to say that my cousin Sean went to the American School for the Deaf and graduated from there. And his mom, Agnes Kelly, brought inclusion of the deaf community into our very Irish Catholic family to include sign language at Mass. So I want to thank you for continuing to fight for your services. Please continue. And we're going to go on next to Sherry O'Day, who is online.
Hello, thank you for having me speak today. Thank you for the opportunity to share my story with you and how the Connection Supportive Housing for Families program gave me the opportunity to help change my life in a way that I never believed was possible. I had my first child right out of high school in 2011. I was an honor roll student at a technical high school, captain of a cheer squad, and graduated with my hairdressing license. I had a great relationship with my family, and I thought I had the world at my fingertips. Postpartum depression hit me like a train, though, and what I now know as bipolar disorder had started presenting itself in me. This was the beginning of a decade of darkness. I turned to drugs until I was asked to leave my parents' home. I was separated from my son, homeless, doing anything and everything possible to not feel the way that I felt, which meant finding the next fix no matter what the cost. I suffered a lot of traumas, much of which were the consequences of my own bad choices. These bad choices led to the end of my marriage, and I ended up pregnant. I felt like I had no right to bring another child into this world when I was unable to take care of the one I already had and unable to care for myself. But it was at this point in time that something in my mind switched, and I no longer wanted to live the way that I was living. I wanted to be a good mom. I wanted my family back. I wanted my life back. After spending 6 months in Coley House, the Connections Women and Children's Program, I was admitted to supportive housing for Families in July of 2023. With the help of my family support specialist, Jean Johnson, she helped me find an apartment 2 blocks from my daughter's daycare, and I moved in on September 12th, 2023. I took great care decorating and great care keeping it clean and homey. I felt on top of the world. Since then, I have found full-time employment working as a human services associate / job coach for adults with disabilities. My relationship with my family is the best that it has ever been. Obviously, everything has not been rainbows and butterflies, but during the visits with Jean, she would sit and just let me go on about anything that was bothering me, and she would listen. I've had to go to Jean multiple times for help in the 1.5 years we've known each other, and if it's within her power, she's always helps me, and if it's not, she advocates for me. The Supportive Housing for Families program has something very different than other programs I've been to in the past, and that's the staff. Jean genuinely cares, and she has my best interests in mind always. I've never really had that anywhere else, and it made a big difference knowing I have someone I can go to. I write this today, 31 months clean tomorrow, and almost at the end of my time with the program. Single mothers, especially single mothers in recovery, need more resources. Supportive housing for families absolutely gave me a second chance at life that I would not have had otherwise. And it is the main goal of my life to pay it forward and help others the way that Jean helped me. I plan on working my way up to being a case manager myself in the future so I can provide support the way I was supported. Words cannot express my gratitude for Jean and Supportive Housing for Families with the connection. I hope my story helps show everyone why this program is so important and how much I very much appreciate all that they have provided to me and my family. Thank you for your time.
Thank you. Up next is Layla Kazmini online. Layla, number 9.
Hello.
Hi, go ahead.
Hi. The first, I'm going to say hello to everyone. Thank you for giving me time for that beautiful, important time. And I want to say that place is not just for helping us. They give us like to continue for life, to live in. And that's very important because outside in that place, people see us like as not normal, as illness, ignore us. That place not just give you life, they keep you safe. They give me safe life and help me for anything to have some house like safe place. I'm here today not just speaking for me, speaking for other people, for everyone. They like human being, they deserve have a life to continue. So I'm asking if you think we deserve to be live and continue with life like other normal people. I'm asking to help them give that money, $1 million to people have life, better life. Like that place, not like give us life, give like save us for everything, like help us everything. I was very bad situation, bad moment, like in 2004 now. They teach me how continue with the life. They keep me safe. They outside in that place, we just get ignored. Why? Because they say you people are not normal. If you think like as a human being, we deserve to have that life. We deserve to like live like other people. I'm asking not for myself. I'm speaking today for right for all disability, for all human being to be have a life. Some even not perfect lives, but normal life like other people, like you, like other people, you know.
Thank you.
Good morning, Appropriations Committee. My name is Rick Famiglietti. I work here at the Center for Disability Rights, and I'm here with Leela Kazameni. Leela is a consumer of the Center for Disability Rights, one of the 5 centers for independent living in the state of Connecticut. And what Leela is trying to say is, please increase the center's funding to $1 million for all 5 centers. That's what her ask is. She's trying to say that when she goes and gets help from somewhere, people push her away or sometimes ignore her because of her language barrier, her post-traumatic stress, and her anxiety. People have a hard time understanding her or don't have the patience to help her. Her most recent issue was with a housing authority who, for some reason, can't give anything to her in her own language And without the support of the Center for Disability Rights, she would still be looking for safe housing where she can feel safe. Do you want to close out?
Please respect for us as a human being and give that chance to we're gonna have a life like we live. Please, we need that money, $1 million to be continued. There is too many issues with the other people, other disabled. I'm
Thank-
asking for the government, don't forget the people, they're waiting for your help, for continue, for living, to have some hope, another day.
Thank you.
Thank you so much. Thank you so much, government, for time. You all have a
We
good
have
day.
his
God
name.
be with you. Thank you.
Thank you.
We just
Thank
need
you.
his name, the speaker that was with.
What is your name, sir?
My name is Richard Famiglietti,
Spell it.
F as in Frank, Amiglietti.
Because nobody cared about us.
Yep, we're gonna care. Thank you.
Thank you very
Thank you,
much.
government. Thank you. You
All
all,
right,
God
so-
be with you all. God be
Thank
with
you.
you all. Thank you.
Thank you. Up next, first I have some housekeeping just to make sure everybody understands where we are. We had a number of people testify first that had significant issues either with communication or needed some additional help. So we're going to go into the regular part of the meeting now. We have 330 some people to testify today. That means this meeting will potentially go until 3 or 4 tomorrow morning. So if you're signed up to testify, you must accept the invitation to be promoted to panelist. When prompted, please do so immediately upon the first request, if you get that first request. So that's for the online people. If you miss your turn to speak, you forfeit your spot and will be moved to the end of the list. That means if you miss your spot today, you're going to go to the end of the list, which is 330 people long. So if you know somebody's up next, call each other, make sure you're all here to testify so we can continue to move smoothly along. If you anticipate an issue with your turn, please notify the administrator. You all have the ability to email. Without prior communication, we cannot guarantee your place in that order. Speaker numbers are assigned and may not be swapped. So don't speak for somebody else. You got to have the person that's signed up to speak. Only registered individuals may testify. Unregistered testimony will not be allowed. Panels must be prearranged. Spontaneous formation of panels will not be permitted. So again, we have 330 people to testify. So here we go. Christine Martinez online. The floor is yours, ma'am.
Buenos días. Gracias por darnos esta oportunidad para hablar aquí con ustedes. Estimados miembros del Comité de Servicios Humanos de la Asamblea General de Connecticut, mi nombre es Christine Martínez Colón. Soy de New Haven y estudio en Wilbur Cross. Soy miembro de City Student for a Dream, una organización que lucha por los derechos de jóvenes indocumentados y sus familias. Yo he sido testigo en este tiempo que he estado aquí de cómo se les trata a los inmigrantes y las dificultades o retos para conseguir servicios básicos para poder vivir. Gracias por esta oportunidad de testificar sobre HB 6864, una ley relativa al presupuesto del Estado para el bienio que termina el 30 de junio del 2027. Pido al Comité de Apropiaciones financiar la elegibilidad Husky para todos los residentes de Connecticut, con ingresos elegibles independientemente de su estatus migratorio, hasta los 26 años. También apoyo el aumento de las tasas de reembolso del Medicaid para que los actuales beneficiarios de Husky puedan tener un mejor acceso a la atención. No soy una persona indocumentada, pero el tiempo que llevo viviendo en Estados Unidos desde que llegué a este país, uno de los mayores desafíos que ha enfrentado mis conocidos es acceder a un servicio de salud. Sin un seguro médico, cualquier visita al doctor se convierte en una carga financiera insostenible para muchos. Recuerdo una vez que mi mejor amigo se enfermó gravemente y su familia tuvo que elegir entre pagar la renta o llevarlo al hospital. Fue una decisión desgarradora. Afortunadamente descubrí una clínica comunitaria que ofrece servicios de salud a personas en mi situación. Aunque el acceso a estas clínicas es limitado y a veces hay larga espera, ha sido un gran alivio saber que hay lugares donde puedo recibir atención médica básica sin tener que preocuparme por costos exorbitantes. Sin embargo, sigo soñando con un sistema de salud más inclusivo que brinde seguro médico accesible para todos. Sin importar su estatus migratorio, la salud es un derecho humano y todos deberíamos tener la oportunidad de recibir atención médica cuando la necesitamos. Espero en el futuro haya más políticas que apoyen a las personas indocumentadas y nos permitan vivir con menos miedo y más dignidad. A mi comunidad le servirá porque lo más que hay aquí son madres o padres solteros con sus hijos. Yo apoyo a Husky for Immigrants y le pido al comité que apoye y apruebe esta legislación de cara al futuro. Le pido al comité que trabaje para abrir el acceso a todos los inmigrantes independientemente de su edad. Gracias por su tiempo.
Thank you. Camila Ballister, can you translate for us? Did you get that?
Yes, ma'am. Thank you so much for having me today. Dear chairs and members of the Appropriations Committee, my name is Christine Martinez Colon. I'm from New Haven. I study at Wilbur Cross, and I'm a member of CT Students for a Dream, an organization that fights for the rights of undocumented youth and their families. I have witnessed in this time that I have been here how immigrants are treated and the difficulties or challenges in obtaining basic services to be able to live. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. I'm Christine Martinez. I'm 17 years old, and I am not an undocumented person, but I have been living in the United States for some time. Since I've arrived in this country, one of the biggest challenges that those I know have faced is accessing health services. Without health insurance, any visit to the doctor becomes an unsustainable financial burden for many. I remember one time my best friend got seriously ill, and his family had to choose between paying the rent and taking him to the hospital. It was a heartbreaking decision. Fortunately, I discovered a community clinic that offers health services to people in my situation. Although access to these clinics is limited, then there are sometimes long waits. It has been a great relief to know that there are places where I can receive basic medical care without having to worry about exorbitant costs. However, I continue to dream of a more inclusive healthcare system that provides affordable health insurance to everyone, regardless of their immigration status. Health is a human right, and we should all have the opportunity to receive medical care when we need it. I hope that in the future, there will be more policies that support undocumented people and allow us to live with less fear and more dignity. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 26 this year, and create a plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 26. Thank you for your time.
Thank you. Up next is Juan Fonseca Tapia and Megan Shara. Is Megan here also? Oh, okay. Thank you. Good morning. The floor is yours.
Hello, chairs and members of the Appropriations Committee. My name is Megan Scherer, and I'm a resident of Hartford. I am also the Policy Advocacy Manager at the Hispanic Health Council, and we are a member of the Husky for Immigrants Coalition. Thank you for the opportunity to testify on HB 6864. I am here in support of increasing funding for Husky. It is critically important to keep what has been gained for children up to age 15 and pregnant individuals. And I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. I am also here in strong support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. The Hispanic Health Council is the largest Latino service provider in the state of Connecticut. Our mission is to promote equity and address health disparities for Hispanics, Latinos, and other vulnerable communities through research, advocacy, and culturally resonant services. Our goal is to ensure that the community can reach their highest level of health. At the Hispanic Health Council, our providers are working hard every single day to ensure vulnerable communities can reach their highest level of health. But it is impossible when policies are not put into place to protect them. Our service providers go above and beyond to ensure the community has access to healthcare, but there are limits on what they can do when having health insurance is key in receiving timely and affordable care. Our service providers will refer them to the clinics that take uninsured clients, but they are put on a wait list and will not be seen for months. During this time period, their conditions worsen and their case is more complicated when they are seen. Often this leads to more referrals, which leads to more bills our clients cannot pay, only putting them further in debt and driving up healthcare costs. The current policy changes for Husky Medicaid for undocumented immigrants are already having a positive impact on our state. Health coverage means access to preventative care, leading to a healthier state, lower uncompensated care costs for hospitals, and lower healthcare costs overall for our state. Now we must ensure that more individuals have access to the Husky program. And I cannot stress enough how important preventative care is. It saves lives and it drives costs down for our state. So I urge, on behalf of the council, to expand Husky for undocumented immigrants up to age 26, and we can continue to grow this program. I will now pass it to my friend and colleague, Juan.
My name is Juan Fonseca Tapia, and I am an immigrant from Mexico. I have served in the United States Air Force as a medic and a public health technician for 9 years. In 2020, I saw firsthand how the lack of access to healthcare can make public health infrastructures crumble, creating chaos resulting in the deaths of thousands. I was also a member of the occupational health group, and I work with local and state health technicians as a public health group. And I also witnessed how our statewide public health preparedness and contingency planning efforts when our population doesn't have access to preventative and emergency medical care. Over the past few weeks, I met with cities around the state like Denver and Stanford, express the same concern. Not expanding access to healthcare hinders public health preparation and local initiatives to have healthy population. The director of public health and the district superintendent from Denver shared that the lack of access is fueling the mental health epidemic undocumented high school students are facing. The lack of access to healthcare also complicates and delays the enrollment of new students. The Denver school superintendent shared these concerns in her written testimony, which is submitted to this committee. As an immigrant from mixed family status, I have 2 questions for you, and I would like in the face when you answer them. How documented brother who pays over and does not get anything in return? He has a 21 and an 18-year-old, and back in October, we had a conversation about voting. And my brother asked me, why should they vote for Democrats when we have a Democratic governor, a House and a Senate, and I don't have any rights? I paid state taxes for the past 25 years, and I can't even go to the dentist because I know I'll get a $5,000 bill. The Pew Research Institute published a report highlighting how more and more young people are attracted to far-right politics.
Juan, you
And
gotta
this-
wrap it up. I'm sorry.
And this past election, I will. And this past election showed that. My second question is, how much is a life worth to this committee? My niece died by suicide when she was 15 because she didn't have access to the mental health care she needed. Please tell me, how do I tell my family that you have the power to fund access to life-saving care for children like my niece, but you are choosing not to because this committee doesn't see our full humanity? Jesus said, whoever shuts their ears to the cry of the poor will also cry and not be answered. And if you believe in a God, I pray you can tell God that you did right by the people and the poor and the needy. I ask you to use your moral compass to expand the access to Husky to the age of 26 and adults over 65.
They keep shutting off your mic because you went over the time. That's what's going on.
Thank you.
Thank you. Up next is Javed Sadiqui, and I did not say your last name correctly, and I apologize. but there's somebody else later on in the program that has the same last name. So if you could tell me how to say it, that would be really good.
Siddiq.
Siddiq, thank you. The floor is yours, sir.
Senator Asin, honorable members of the Appropriation Committee. Good morning. I'm Javed Siddiqui. I'm the Director of Refugee and Resettlement Services with Jewish Family Services of Greenwich. Thank you for the opportunity to testify on HB 6864, the governor's budget. I'm here to advocate for the full $3.05 million in state funding provided to the 3 resettlement agencies in fiscal year 25 to adjust the fiscal guardrails to provide in fiscal year 26 and fiscal year 27. JFS of Greenwich laid off 11 staff members with the first stop work order, effectively closing our reception and placement program with no warning. We will live to serve 34 newly arriving refugees with private funds, as they were quite literally abandoned by the government. The clients we serve through these funds are entered through legal pathways. They are refugees and humanitarian parolees that are already here in the state of Connecticut. Their ability to achieve self-sufficiency and adjust to life in the United States is in your hands. JFS of Greenwich, along with Siri and Iris, these are the 2 other resettlement agencies working in Connecticut, have assisted thousands of Connecticut residents this year, for which the public system simply does not have the resources available. Without state funding, refugees and immigrants in the state of Connecticut will face unemployment, food insecurity, and homelessness. Federal funding cuts have been devastating, and a further loss of state funding would close programs that directly serve vulnerable refugees and immigrant clients, including school support, specialized language programs, employment services, housing support, and general case management. Every service provided by resettlement agencies saves the already overburdened public system that is ill-equipped to manage the nuance of refugee support services. Please provide the entire $3.05 million that will sustain essential services for the refugees and immigrants that are already legally living in our communities and working to contribute with the supportive guidance of agencies like JFS of Greenwich and other partners. Thank you very much.
Thank you. Up next is Jason O'Connor.
Good morning, Senator Lesser, Representative Gilchrist, Senator Austin, and members of the Human Services Subcommittee. My name is Jason O'Connor, and I'm the Executive Director of the New Milford Youth Agency and Vice President of the Connecticut Youth Services Association, or CYSA. CYSA's mission is to lead, strengthen, support, and advocate on behalf of the Unified Network of Youth Service Bureaus, or YSBs, and is bound by CGS Section 10-19M. I'm here today to express my deep appreciation for the governor's continued commitment to YSBs and to highlight the critical role they play in supporting the well-being of our youth and families. YSBs are the backbone of youth development and intervention efforts and serve as a hub for prevention, diversion, mental health services, and youth empowerment. They operate in 135 communities and support over 300,000 youth and young people annually. As the ED of New Milford Youth Agency, I can speak directly to the importance of YSBs. Last year alone, we served over 2,000 youth and families through 25 different programs. Additionally, our YSB diverted 73 out of 78 youth from the court system. We provided 216 free clinical counseling hours to youth. And our childcare served 145 children daily throughout their school year. But the YA is not alone in its influence with local youth and families, as all YSBs offer important and personalized programming for their communities. The demand for these services continues to grow, and we are grateful for the state's continued financial support and investment. By keeping youth out of the juvenile justice system, addressing mental health concerns early, and providing positive developmental opportunities, we save the state significant costs in the long term, and most importantly, we change lives. CYSA continues to expand its support for YSBs, equipping them with the resources needed to operate effectively within their towns and communities. In partnership with DCF and Dillinger Rad, CYSA has developed an online system that streamlines data sharing and analysis through automation. This initiative is evolving to incorporate additional meaningful data points and providing deeper insights into youth outcomes, program effectiveness, and the completion of the ACU functions. Additionally, in recognizing the need for ongoing professional development, CYSA is also addressing the statewide training gaps by expanding in-person and virtual training opportunities. These efforts will strengthen YSB staff, equipping them with the knowledge and skills necessary to meet the complex and unique needs of the communities that they serve. I urge you to continue to prioritize the funding of youth service bureaus in this budget and to recognize the central role they play in keeping our young people healthy, safe, and prepared for a successful future. Thank you for your time, your support, and your commitment to Connecticut's youth.
Thank you. Up next is Erica Bromley.
Good morning, Senator Lesser, Representative Gilchrist, Senator Austin, and members of the Human Services Subcommittee. My name is Erica Bromley, and I'm the Youth Justice Consultant for the Connecticut Youth Services Association. I would first like to thank the committee for its continued support of the Youth Service Bureau system and the Juvenile Review Board process. Today, I would like to speak specifically on the funding for diversion and JRBs. The governor's proposed funding schedule includes both a continuation of previous diversion funding, a diversion reduction for next fiscal year for additional funds, and then a return of the additional funding appropriated in the last budget cycle. The renewed funding in the second year of the budget has been proposed to create full access to diversion for all youth despite their community. CYSA fully supports ensuring all youth have access to diversion programs. However, the entire JRB framework needs to be fully funded to support both the current and expanded diversion efforts. JRBs have been in existence for 55 years, and today there are 90 JRBs serving 137 towns. Currently, approximately half of our JRBs receive limited funding through DCF, while the rest operate without any state financial support for their services. As proposed, the renewed funding would be allocated only to communities without existing diversion programs, overlooking the JRBs that currently do not receive any or adequate state funding. CYSA urges that all JRBs, regardless of location, receive adequate and equitable funding to sustain a fair and effective diversion system statewide. JRBs are widely recognized as a key factor in reducing juvenile court caseloads over the past decade. However, the funding structure has not shifted to support these efforts. Research has proven time and time again that youth should be diverted whenever possible, as contact with the justice system increases the likelihood of future involvement in the system. Recent juvenile justice reforms, and potentially more to come, have created opportunities for youth to remain in their communities and receive diversion services through JRBs and YSBs rather than entering the court system. While this shift is a positive step forward, JRBs are increasingly stretched thin. Their capacity is declining as they struggle with staffing shortages, making it difficult to provide the necessary support for the growing number of cases. With this rise in cases for both JRBs and YSBs, there is an urgent need to expand capacity, including increased resources. The state's juvenile justice reform efforts have placed significant responsibility on the JRB process for diversion and the YSB system as a whole, yet this has not been met with necessary financial support. To sustain these efforts, investment must follow, ensuring that youth receive adequate community-based services to keep them out of the justice system. Just yesterday, at a press conference in this building, the importance of diversion was highlighted. If Connecticut is committed to prioritizing diversion and community-based support for youth, securing dedicated funding for JRBs is essential. Thank you.
Thank you. Up next is Audra King. You got to turn your mic on. The button right there. Right in front of you is a button. There you go.
There you go. Sorry. Well, I teach college. I don't do microphones. Okay. Good morning, members of the Appropriation Committee. My name is Audra King. I'm an associate professor at CCSU and a proud member of Connecticut for All. I'm here today to urge you to prioritize funding for group homes and nursing homes and the workers who care for our elderly, our disabled, and our most vulnerable. Let me start with a simple truth. We will all need care at some point in our lives. Whether it's our parents, our siblings, our children, or ourselves, we will rely on the compassion and skill of care workers. These workers provide essential support to elderly residents and individuals with physical and intellectual disabilities. They help with daily tasks, provide emotional support, and create safe, nurturing environments. But how can we expect them to provide dignified care without proper funding and when they themselves are often struggling to survive? Imagine what it's like to be a caregiver in Connecticut today. You wake up before dawn, often after working a second job just to make ends meet. You spend your day lifting residents, assisting with meals, helping individuals with disabilities participate in daily life. You do this with love and dedication, knowing how much your work matters. But at the end of the day, you go home to a paycheck that barely covers rent, groceries, and childcare. Many caregivers are forced to rely on public assistance to survive. This is not just an injustice to them, it's an injustice to the people they care for. Low wages and poorly funded facilities mean constant turnover in care facilities. It means exhausted, overworked caregivers spread too thin to provide quality of care that they want to give. We know what happens when care workers are underpaid and facilities are underfunded. Residents wait longer for basic needs. People with disabilities struggle to build meaningful, trusting relationships with caregivers who come and go. Nursing home residents experience isolation because there simply aren't enough hands to help. Yet, despite this, Governor Lamont's proposed budget does not provide adequate funding to truly address these issues. While it does allocate an additional $157 million over 2 years for nonprofit service providers, this increase does not fully replace the loss of federal pandemic relief funds, meaning that providers will actually have fewer resources than before. This is a cut disguised as an increase. A budget is a reflection of our values. We can invest in care workers and facilities and ensure that they have the support they need to provide high quality care. Our elderly and disabled sorry, my mouth is so dry, I'm trying to speak. We can build a Connecticut where residents in nursing homes and group homes receive dignified, stable, compassionate care, not from workers stretched beyond their limits, but from caregivers who are empowered to do their jobs well. This is about justice, this is about human dignity, and it is about recognizing that care work makes all other work possible. The people who care for our most vulnerable deserve better, and the people they care for do too. Thank you.
Thank you. Up next is Tanisha Signor. Tanisha? Tanisha? You are muted.
Hi, I'm sorry. I'm
Go
here.
ahead.
Thank you. Hi, my name is Tanisha Signor. I'm the policy director at She Leads Justice, a statewide nonprofit that uses a justice and equity lens to advocate for under-resourced and marginalized girls and women in the state of Connecticut. Hello, Senator Austin, Representative Walker, and esteemed members of the Appropriations Committee. I'm testifying today regarding HB 6864 and concerning the state budget for the biennium ending in June 13, 2027. With respect to human service agencies, specifically the Department of Social Services, which administers Husky. As part of our work, we proudly stand with our Husky for Immigrants and Connecticut for All coalitions and advocating for expanded access to healthcare. Over the last 4 years, the Husky program has been extended to undocumented children up to the age of 15 and pregnant and postpartum individuals in Connecticut. These policy changes have had positive impacts in our state. When people have access to preventative care, it means fewer emergency visits, lower uncompensated costs for hospitals and providers, and an overall healthier state. This is why we are asking the committee to fund Husky eligibility for all income eligible residents in Connecticut up to the age of 26, regardless of their immigration status. Being able to access healthcare is a human right, and all individuals deserve access to quality, affordable healthcare, no matter their circumstances in life. Secondly, we urge the committee to fund an increase in Medicaid reimbursement rates in our state. While we appreciate the governor's proposed budget increase to Husky rates, the more robust plan put forward by the House and the Senate leadership would bring all providers up to at least 75 to 80% of Medicare rates in the multi-year plan. This plan would also increase funding to community health centers, a critical provider for so many individuals in Connecticut. Low reimbursement rates for providers disproportionately impact low-income people of color, under and uninsured individuals, young people, women, and LGBTQIA individuals. Additionally, we stand with Planned Parenthood and Reproductive Equity Now in their fight for all people to have access to a full spectrum of quality, affordable healthcare, including reproductive healthcare. We urge the committee to increase funding in Medicaid reimbursement rates for family planning clinics, as well as rates for abortion services, which have not been adjusted since 2008. Healthcare providers in our state need to be compensated wholly for the services they provide to residents in our state. Raising Medicare reimbursement rates is essential to creating an ecosystem of health equity in Connecticut. Thank you for your time today, and I hope you will consider the powerful and emotional testimonies from all of those who testified today and the individuals that they represent.
Up next is Jordy Navarez. Up next is Christopher. Is Jordy Navarez here in person? Up next is Christopher Zurcher, Center for Disability Rights. Christopher? Can you speak, sir, so we can hear you? You're unmuted, so you got to talk. Can you hear us? No, you're gonna have to, Rebecca, let him come in and out because his mic is not done. Could you sign out? Try again, speak. You're gonna have to sign out and then sign back in, and we'll let you speak when you get back in. Okay? All right? We can't hear you. Cannot hear you. You're going to have to sign out and sign back in. Your computer is not acting. You're going to have to mute him and then get in touch with him. I'm not going to go back and forth on this. Up next is Elizabeth Maldonado, Kristen Perez, Aurelis Guzman, and Yorceli Marin. I think you're all here. You guys got to come up and we got to get this focused and speaking. So all four of you are supposed to be up here. Get up here now because you're not getting called again. So that's what they've been doing, is they're going to shut you off. There's only two of you. Which two are here? Are the other two not speaking? Are the other two not speaking? Who is speaking?
Annalise and Kristen
Oral-
are speaking, and the other two people are not here.
Okay, go ahead. Floor is yours.
Buenos días, estimados presidentes y miembros del Comité de Apropiación de la Asamblea General de Connecticut. Mi nombre es Aurelis Guzmán. Somos miembros del colectivo de defensa y somos residentes de Hartford, junto a 400 familias inmigrantes y vecinos aliados en la zona de Hartford. Estoy aquí con mis compañeras del colectivo. Gracias por la oportunidad de testificar sobre HB 6864 para el presupuesto de servicios humanos. Estamos a favor de aumentar la financiación de Husky para nuestra comunidad inmigrante y pedimos al comité que financie la cobertura hasta los 26 años, independientemente del estatus migratorio. También es importante mantener lo que se ha conseguido para los niños hasta los 15 y las personas embarazadas, y aumentar los reembolsos para los proveedores que impactan la calidad de Husky para todos nuestros vecinos en Connecticut, inmigrantes o no. Tengo muchas facturas que no he pagado por atención médica. Con algunas he pagado de 20 en 20, de 50 en 50, pero no siempre he podido terminar de pagar. Muchas veces he tenido que elegir entre comprar mis medicinas o pagar las facturas o pedir dinero prestado. Siempre me están llamando para cobrarme las cuentas, incluso durante esto ha pasado cuando la pandemia. Mi marido no va al médico y soporta sus dolores. Una vez le cayó un trozo de metal en el ojo en el trabajo y tuvo que ir al hospital. Era tan caro que todo lo que ganó en ese mes, lo trabajado, lo tenía que pagar en el hospital. Ahora tengo los glóbulos blancos muy bajos y me refirieron a un especialista de hematología. Todos los estudios que me han hecho me han salido tan caros y a pesar de ser una emergencia, se han tardado en darme las citas que yo necesito. Cuando no se tiene seguro médico en el hospital, los especialistas te tratan como si que uno no valiera nada, fuera menos. Vivir sin seguro médico me produce ansiedad y depresión. Me da miedo ponerme enferma y no saber qué hacer. Pido al Comité de Apropiaciones que actúe, por favor, en este año. Muchas gracias por su atención.
Thank you.
Dear Senators and Representatives of the Appropriation Committee of the Connecticut General Assembly.
Check,
My name
1,
is
2,
Lisa
check.
Perez. I am 17 years old and have lived in Hartford for 12 years. I'm a member of the Hartford Deputation Defense alongside 400 immigrant families and allied neighbors in our community. I do not have health insurance, and this has significantly affected my life because of my visual impairment. My two younger siblings were born in Connecticut and have health insurance. Unfortunately, I do not share that privilege. Living with a visual disability comes with challenges, such as paying for new glasses or eye exams whenever needed. Moreover, just the thought of going to the dentist makes me feel guilty about the financial burden it places on my mother, who has to work night shifts and struggles to cover our expense in general. Even at school, I am required to have physical exams that my mother needs to pay for. It is disheartening to think that something as essential as healthcare is out of reach due to financial limitation. Everyone deserves access to health insurance regardless of their circumstances. No one should have to choose between their health and their finances. Insurance is a fundamental human right that should provide us with the security and support we need in times of medical need. I hope that by sharing my story, we can raise awareness about the importance of accessible healthcare for everyone, especially those who face additional challenges. Together, we can advocate for a system that guarantees everyone the support to receive care without fear or financial strain. It is also essential to maintain what has been achieved for children up to age 15 and pregnant individuals and increase provider
Don't worry, let him go. He's fine.
as
He's fine.
as
We all, many of us know what little ones are like. Let him walk. Keep going.
as this directly impacts the quality of Husky for all our neighbors in Connecticut.
He's not going to hurt anything. Let him
Immigrants,
go.
immigrants or not. Thank you for your time.
And what was her name? Your name is Kristen?
Kristen Perez.
And what's her name?
Oralis Guzman.
Thank you. Thank you. And for clarity, your Saleha and Elizabeth are not here, right? Thank you. You're all set. Thank you. Up next is Mary Beth Semino. Mary Beth Semino,
I am here.
go ahead. Before Mary Beth, can you stop for 1 minute?
Sure.
Christopher Purchase, can you unmute yourself and try to speak? Oh, where did he go? Now he's gone. Mary Beth, the floor is yours.
Thank you.
Go ahead.
Good morning, Senator Alstein, Representative Walker, and honorable members of the Appropriation Committee. My name is Mary Beth Semino, and I live in Wallingford. I have worked at a facility now known as Arden Care Center in Hamden for the past 43 years. I have been a dedicated 45 years of my life to healthcare as a certified nursing assistant, and I'm also a certified end-of-life doula. Because of this, I can confidently be here in front of you today and say, you must increase funding for nursing homes across the state. I have dedicated more than half of my life, and it's just not a job, it's a passion. I've been at Arden Care Center through multiple ownerships, and each one gets worse than the other. There will come a point in nursing home staff won't be able to care for people we are responsible for, and that time is quickly approaching. In my facility, we are staffed to work at a level of about 150 residents, but currently we are caring for 200 residents, and it is rising daily. The staff ratio needs to be addressed quickly. We used to have at least 7 CNAs on a unit of 30 residents for days. Now We're lucky if we have 5 and sometimes 4. CNAs are not the only one feeling the pinch. Our LPNs and the support staff, such as housekeepers, are overwhelmed as they continue to bring in more patients and residents because the need is growing in the state. Patients need time for proper care, and this is time we don't have. Many of our patients need help eating and struggle to communicate when something's wrong. Those tasks require us to pause for a while and work with them. But when we do that, then we fall behind on our other tasks, and there is no catching up. Many times, many of us miss our breaks because of that. We try to provide compassionate care and have a simple conversation or check on the residents' mental health. But instead, again, we run out of time. We get new team members, but they don't stay long. They come to our facility and within a month, they're gone. They see the workload that they are taking on and the low wages. They quit, they leave, and sometimes quicker than when they're fully trained. I can tell you one girl I trained one night was gone within 3 hours. She did not even stay the night. We invest this time and training just for what? So they walk out? We attract staff members who want to stay, put in hard work, but to do this, we have to involve offering competitive wages. Unsurprisingly, we struggle with the staff in the nursing homes when CNA wages are lower than some retail settings. We need you to hear our cries today and address the issue immediately. We need to have you involved in the increasing of funding in nursing homes, because without these additional funds, the future of our nursing home programs in Connecticut are at risk. If you have any questions, I'm more than willing to answer at the end. Thank you again for your time and consideration. We are struggling every day and we need your support.
Thank you. Up next is Thomas Burr. Thomas, are you here? He comes regularly. I'm sure you can get his testimony online. Up next is Francisco Lopez, Yessi Manzanares, and Minerva Antigua. Are the 3 of you here? Okay. Go ahead.
Hola, buenos días. Mi nombre es Minerva Antigua. Estoy aquí para pedir al Comité de Apropiaciones que por favor nos sigan dando fondos para expandir Husky para niños hasta los 26 años. Nuestro hijo tiene seguro médico de Husky porque se benefició de la expansión de Husky para niños menores de 15 años. Gracias por apoyarnos y por favor poner más fondos en los años anteriores. Pero mi esposo y yo no tenemos ningún tipo de seguro médico. Es muy difícil cuando tienes un problema de salud y los médicos te mandan de arriba para abajo sin ninguna solución, simplemente por no tener un seguro médico que cubra el costo de visitas o especialistas, dependiendo de la enfermedad que tenga. He vivido momentos muy difíciles, tanto mi familia como yo, y créanme que no es nada agradable. Vivir en suspenso si te sientes enfermo o no poder ir al médico o llamar a tu médico primario y lo único aliados son ibuprofeno y Tylenol o remedio casero para aliviar el dolor y así evitar emergencias. Yo, como muchos, seguimos luchando a pesar de esta nueva ola de discriminación racial. La comunidad sigue en pie porque hoy más que nunca necesitamos acceso a la salud, porque tanto niños, adultos entran en una etapa de depresión y ansiedad. Hoy se necesita tener un seguro médico que cubra sus necesidades, sin importar su edad o su estatus migratorio. Pido al Comité de Apropiaciones
que financie la elegibilidad de expansión de Husky hasta los 26 años y en el futuro crear un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad. La necesidad de salud no termina a los 13 o 15 años, que es lo que tenemos hasta ahora. Gracias.
Go ahead.
Buenos días.
Yeah, good morning.
Bendiciones. Hola, mi nombre es Jessie Manzanares, vivo en Brisbane, Connecticut, soy líder del comité de lucha. Y,
No, you're not going to get it, Rebecca. Just let them speak. Go ahead.
Hola, mi nombre es Jessie Manzanares, vivo en Brisbane, Connecticut, soy el líder del comité de lucha. Así que hoy estoy aquí para pedirle a los legisladores de agregar fondos para expandir Husky, que daría acceso de salud para niños hasta 26 y señores de edad de 65. Yo tengo 56 años de edad. Desde que llegué a este país me ha hecho difícil acceder al cuidado de salud y otros recursos porque no tengo estatuto, no califico seguro del Estado. Desde noviembre del 23 me sentí muy mal de un dolor fuerte en mi seno, donde busco ayuda, pero no recibo hasta 5 meses después. Mientras tanto, yo he soportado el dolor usando medicamentos caseros, analgésicos para el dolor en la espera del referido. Me sentí mal, me fui a emergencia donde me detectaron cáncer de seno. Debido a eso perdí mi trabajo, mi apartamento, porque esta noticia me devastó emocionalmente, físicamente y económicamente. En el hospital me refirieron a empezar quimioterapias inmediatamente, donde tuve que esperar otros 5 meses para empezar mi tratamiento. Por eso no cumplí con los requisitos y estar listo de esperar por tener seguro médico. No tengo un doctor primario que cuando me sienta mal yo pueda llamar para una cita. Por gracia de Dios sigo adelante en pie en lucha, pero triste como indocumentada. No califico para seguro médico. Recibimos la ayuda adecuada para tener una vida saludable. Hoy les pido al gobernante, legislador del comité de apropiadores que agregue, que nos ayude con fondos para expandir el Husky hasta 26 de señores de edad de 65. Estoy informando la vida de los muchos. Gracias, Jessie Manzanares. Gracias.
What is your name? Name, please.
For her,
Yeah,
Jessie Manzanares.
thank you. Next.
Okay, my name is Francisco Lopez. I'm with May the Road, Connecticut. I already submit my testimony, so I just want to make some commentaries only. Well, the first thing is you hear the tragic histories of many of the people here, and there's a human component definitely beyond the economics part. What we are doing, what the government is doing for that. Basically, the macroeconomic function of the government is to close the gap between the balances of supply and demand. But beyond that, they have a lot of consequences, as you can see in the human aspect of all of this, many tragedies, many very bad situation. I know the environment is not very conducive now for many things. The situation in Washington, and a lot of people are very angry about that. Probably many will take the streets, and who knows what happened next. So my recommendation is not just going to the 26 years old threshold, but actually to expand to everyone. We're leaving out the population that is more productive. That's the biggest spectrum. Thank you for your attention.
Thank you very much. Appreciate it. Up next is Josh McTome. Josh?
I am here. Do you all hear me?
Yes, we can hear you. Go ahead.
Thank you, Senator Austin, and thank you to all the members of the committee. My name is Josh Michtam. I am an elected member of Hartford City Council, and I am also speaking in favor of expanding Husky coverage for all immigrants up to age 26. I'm not going to speak on what many have spoken about in terms of the personal impact, if they can cover it better. And I've talked before, and I think you all can understand what is the community-wide impact, how good healthcare creates stability in communities like Hartford. I want to talk instead about what is maybe the elephant in the room, which is that I think there are people among leadership, among you all, who believe this is the right thing to do, but are also concerned about the attention that it may draw from the bigoted cabal that is currently running our federal government. And I just want to talk a little bit about what is the role of leadership, of leaders, of elected officials in a moment like this. Because certainly, and I too am an elected official, we can't fight every time, right? There are times to negotiate, times to wait, times to take smaller gains. And I understand that. But we also have to realize that this is not a fight we get to pick or not pick. The feds have picked this fight. They are coming for us one way or another. And by us, I mean many, many in this state. They are already coming for our children, our queer and our trans children. We're seeing them at the national level come for people of color in positions of power. We cannot avoid who they are and what they want. And in this moment, I think it is the work of leaders to recognize that and to stand up to them, and to do that by deepening our commitment to compassion and our commitment to expanding the circle of the people we consider community and expanding what we do in terms of caring. Expanding Husky is good sense economically. It's good for communities, but more importantly, when leaders stand up to the tyranny and the bigotry that's coming from above, it empowers and it emboldens regular people. If what we want is an activated public, a public that can resist tyranny, that public needs to see its elected leaders brave and willing to fight as well. And so I urge all of you, if you see the morality of this expansion of Husky, do not be cowed by the negative consequences that will come from the feds. Instead, believe that if you show your bravery, the people will show their bravery and they will back you up. That's all I got, unless you have questions.
No, we don't do any questions. Thank you.
All right, have a good one.
We're going to go back to Christopher Zurcher. Christopher, can you try signing on now?
Can you hear me now?
Yes, we can. The floor is yours, sir.
Sorry about that. Thank you very much. Senators and representatives and committee members. I'm here to support the increase in funding for the independent living centers by 1 million in the governor's proposed 26-27 budget for human services agencies. My name is Christopher Zurcher. I'm a former staff member and now consumer at the Center for Disability Rights in West Haven, one of 5 centers in the state. I learned of CDR in around 2007 when I was having legal problems with my present employer. I thought I was being discriminated against. I heard Executive Director Mark Gallucci was an ADA expert, so I sought him out and he helped me through that legal process. I'm now answering phones part-time as a volunteer because things have happened in my life that prevent me from working full-time there anymore. You know, some call the center needing things to help them read because they're 100 years old and their ophthalmologist says, what do you expect? You're 100 years old. Some can't get a handicap spot in their apartment complex, or they need funding. They need help finding transportation from their home in Hamden to a hospital in New Britain for a special procedure, or they can't do their laundry because they just got back from ankle surgery and they can't get down 2 flights of stairs to the washing machine. These are just a few of the thousands of questions we get from our callers every year. The services that the centers provide are essential to many who call for information. Many live on $1,000 a month or less. They can't afford a walker or a ride or a personal care assistant. Even if they have insurance, they don't know if the PCA is covered or how to go about getting one set up. So please support an increase of $1 million for the independent living centers in the state.
Thank you.
Thank you.
Up next is Tina Floyd.
Not online.
Is Tina Floyd here? Up next is Carla Esquivel.
Also not online.
Is Carla here? Up next is Elena Josephson. The floor is yours.
Thank you, Chairs, Senator Ostin and Representative Walker and the members of the Connecticut State Appropriations Committee for this opportunity to submit testimony on the budget you are crafting for the next biennium. My name is Alina Josephson, and I'm an early childhood clinical manager for the Village for Families and Children, an affiliate site for the Child First program. Child First is an evidence-based early childhood mental health program that helps families build strong, nurturing relationships to heal and protect young children from trauma, adversity, and chronic stress. Using a multi-generational trauma-informed approach, we provide in-home psychotherapy for parents and children and connect families with critical services that support child development. I've been with Child First since 2014 and have witnessed the profound impact our services have on families, breaking cycles of trauma and adversity. Child First serves some of our most vulnerable populations, including pregnant caregivers, infants, toddlers, and young children up to age 5. Families we work with face immense challenges, such as domestic violence, loss of a parent to gun violence, or caregivers who have experienced trauma. Others are involved with DCF or struggling financially. These families balance economic stress, parenting challenges, and safety concerns, all which affect a child's development. Our referrals include children on long wait lists for developmental assessments, those who have experienced neglect or abuse, and parents who want better childhood experiences for their children. The impact of Child First extends beyond the individual families that we serve. When we help one child, we help their siblings, their parents, their teachers, and entire network support, strengthening our communities. I was recently approached in an early childhood collaborative meeting to share Child First with more preschools and local daycares. While excited about bringing these services to more families, I knew that with our extensive wait list, families would have to wait too long for help, and many would never be able to receive our services. The experience that we have as children impact us in long-lasting ways, both positive and negative, which makes our support so vital. Child First affiliates receive state and federal funding from the Connecticut Office of Early Childhood and the Department of Children and Families to sustain and deliver these critical services. Continued financial support is essential to reach the children and families who need us the most. In Region 4 alone, we currently have 75 families on our waiting list. Over the past year, I've seen firsthand how Child First improves children's development, reduces family stress, and strengthens communities. These life-changing services make a lasting difference. I respectfully urge you to support this funding request to ensure that families in need can continue to access the critical mental health support that Child First provides. Thank you for your time and consideration.
Thank you. Up next is Lori Pasqualini. And I just want to put out a little notice to everybody. If you have a number higher than 243, you should probably transfer to remote because you will not be speaking before midnight. So you should not, if you have a number higher than 243, you will not be speaking before midnight. and maybe later than that. So you should transfer it to remote. Go ahead, Lori.
Good morning. I'm Lori Pasqualini. I'm the Chief Financial Officer for Ability Beyond, and I'm here today to support the bill and actually ask for additional funding on top of what's there. Thank you for being here, Senator Austin, Senator Lesser, Representative Dathan, and Representative Gilchrist. Really appreciate all the funding we've gotten over the last few years throughout the pandemic. It's just not enough to keep us moving in the right direction moving forward. Since the COVID-19 pandemic, our single biggest challenge for our organization and all of our focus, all of our efforts are on reducing turnover and improving attraction to applicants for our field and keeping them on board. The living wage in Connecticut is $25.28. Our starting wage in our intermediate care facilities is $19. In our acquired brain injury programs is $17.75. This $19 is 75% of the living wage. It's amazing we get staff to work for us as we do in this environment. We need to increase funding to be able to support the most vulnerable. These are not easy jobs. We have made significant investments in making the jobs more understandable for our staff and in trying to get more applicants coming on board. And we have reduced our vacancy rate from where we were 2 years ago down to 14%, but that compares to 10% prior to the pandemic. And at that time, 10% was really hard to live with. So you can imagine how bad it is now. More specifically, 62% of our programs have a vacancy rate of 10% or more. 1/3 of those programs have 30% or more, and some of the programs are at a 60% vacancy rate. You heard from other speakers the impact of vacancy on the staff and turnover and the residents that we serve. Our employment services, which is funded through the acquired brain injury through DSS, our turnover is between 50 and 75%. We're lucky if we can keep people 30 to 90 days where they're even able to be effective. We've been working to try and improve that, working with the Bureau of Rehab Services. One of our biggest challenges is the fact that we have funding from many different departments within the state: Department of Developmental Services, Department of Mental Health and Addiction Services, Office of Workforce Development, Bureau of Rehab Services, intermediate care facilities, and our starting pay rates are all over the place for people doing those same jobs. I ask you respectfully to increase the pay rates and support the nonprofit organizations that provide these services, as if we go out of business, it's going to cost the state significantly more than it does now. Thank you very much.
Thank you, Lori. Thank you. Next is Carrie Litke. Carrie Litke, number 29.
Hello. Good morning, almost afternoon, and thank you for the opportunity to speak today. My name is Carrie Litke, and I am a program manager in the outpatient department at Child and Family Agency, as well as a clinician. I am here to urge that you increase funding for nonprofit mental health services by at least $264 million for the fiscal year of 2026, including a 6% Medicaid rate increase for behavioral health services, and to annualize the full amount of the fiscal year 25 ARPA funding. Additionally, we're asking for an 8% increase for the fiscal year of 2027 to ensure more long-term sustainability. So today you're going to be hearing from many of my colleagues who will share with you the data that shows how more than 80% of the children in Connecticut that we serve are covered by Medicaid. You'll hear from a group of the most passionate humans who dedicate themselves to this work every day. Often you will also hear those who serve in the mental health field speak about their work as part of their identity. We hold advanced degrees, licenses, and are often trained in evidence-based treatment models in order to provide the most appropriate and beneficial treatment to the children we work with and their families. To sustain the level of quality treaters, we must provide an improvement in medication reimbursements that are comparable with those to surrounding states. Otherwise, we will continue to lose mental health treaters to private practices, hospitals, and in the field generally. Imagine a young father who has a 3-year-old daughter who is always crying, having nightmares, unable to sleep in her bed alone, and is constantly yelling and having behaviors in the home and environment and school. And the dad just doesn't know what to do or how to help her. He shares that his wife, which was his daughter's mother and primary caregiver, died 3 months ago after a brief illness. He says he's been trying to get her into therapy for almost 2 months, but everywhere he calls, they say they've met their number of Medicaid clients that they can take for that time period, or there is a wait list. He contacts our agency and we're able to get him in and get the child in to services right away. Not only am I the program manager of our intakes and outpatient, I'm also a parent, which gives me a unique perspective because my children have also accessed mental health services, however, in the private sector. My commercially insured children have not had to be placed on wait lists or have not been able to access the needed mental health care, like the child I shared in this story who had Medicaid. The disparity is horrendous and unethical. We can do better. We have to do better. Remember, the children of today will be the adults of tomorrow. And if we do not invest in them now and their mental health, then when? Thank you very much for your time.
Thank you. Up next is Tracy Wodash. Tracy, the floor is yours.
Distinguished members of the Appropriations Committee, my name is Tracy Wodach, President and CEO of the Connecticut Association for Healthcare at Home. I'm also an RN with over 40 years experience. The Connecticut Association for Healthcare at Home is the united voice for our licensed home health and hospice agencies, as well as several non-medical homemaker companion agencies. Together, our members provide services that foster cost-effective home care for Connecticut's residents in the setting they prefer most, their own homes. Other than temporary federal relief through ARPA funding during the pandemic, Connecticut has not meaningfully increased Medicaid rates for skilled medical home health services in over 2 decades. In fact, we experienced a 15% behavioral health rate cut in 2016 and elimination of an add-on rate for high-risk underserved populations in 2017. We also are reimbursed half a nursing visit rate when doing the same quality visit if in the same home or congregate setting on the same day. It's devaluing and viewed as a penalty. Regarding the homemaker companion agencies who provide non-medical support care in the community, the only increases they've received beyond ARPA funding have been due to minimum wage increases. Just this past year, the governor also ratified a contract with the self-directed PCAs under SEIU for a 26% increase over the next 2 years, an increase well-deserved, while our agency-based providers receive nothing. Meanwhile, costs for labor, fuel, essential supplies have continued to rise to the tune of 51% inflationary factor compared to 2007. And the recent Medicaid rate study supports that Connecticut rates can't compare with our neighboring states, especially Massachusetts and New York. So care providers are crossing lines to work for more pay. The overall result of all these cuts, lack of adequate funding, and disparities is greatly reduced staffing, resulting in fewer Medicaid cases served in the community and losses for providers, keeping them from hiring, retaining staff, and higher costs of care for the state. A vicious, unnecessary cycle. In my written testimony, you have our asks, but we're asking for significant increases for licensed home health, over the next several years to stabilize and align with inflationary measures, eliminate that 50% subsequent visit penalty rate, return the behavioral health rate to the 2016 rate, believe it or not. It still would be 15% higher than our current. Implement the add-on rate for high-risk and rural cases. For Homemaker Companion, 13% increase this year and next to adjust for the 26% PCA wage gap on SEIU side, and then a 10% annual increase thereafter. And then retroactive to January 1st, an increase to adjust to the minimum wage. Without fair funding, we'll continue to close. Caregivers will leave for higher paying jobs, and thousands of people will be left without care in the community. Thank you.
Thanks, Tracy. Up next is Amanda Nardozzi. Amanda, online.
Good morning, senators, representatives, and committee members. My name is Dr. Amanda Nardozzi, and I'm the Executive Director of Safe Haven of Greater Waterbury. Our organization provides essential services to victims of domestic violence and sexual assault in the Greater Waterbury area. We are a member of the Connecticut Coalition Against Domestic Violence. Today, I'm here to share my perspective on the vital role that Safe Connect, Connecticut's 24-hour domestic violence hotline, plays in the overall system service and the critical support it offers to both victims and service providers. Safe Connect has been a cornerstone of Connecticut's domestic violence response since its inception in 2019. The statewide hotline serves as a vital lifeline for survivors, providing immediate access to help, safety planning, and a connection to the right services. It offers a single coordinated entry point to domestic violence assistance, which ensures that callers can quickly and efficiently receive the support they need, whether it's shelter, legal advocacy, or counseling, without delays or confusion for the survivor. From my experience, Safe Connect significantly reduces the burden on our organizations. Before Safe Connect, each member organization was tasked with providing 24/7 hotline coverage, but with no dedicated funding for this service. As nonprofits, this left our local agencies stretched thin, scrambling to find ways to cover the hotline, especially after the close of the business day, while simultaneously working to provide that critical in-person, long-term services to the survivors needed. The hotline is not just a point of entry for services, it is also solving a significant logistical challenge. With Safe Connect in place, the hotline is handled by a specialized trained team who triage calls, assess immediate needs, and connect survivors with the local member organization best suited to assist. This allows local agencies like Safe Haven to focus on providing comprehensive, in-depth services that truly address the unique needs of each survivor. If Safe Connect were to cease operations, the responsibility for answering the 24/7 hotline calls would revert to the member organizations. At Safe Haven, we are already facing challenges with staffing shortages and turnover, exacerbated by the proposed funding cuts, and the amount of clients we provide service to each year has increased. Adding the burden of answering hotline calls would overwhelm our already strained staff, diverting attention from the essential work we do in providing survivor-centered services. It would also reduce our ability to ensure that each individual survivor receives the specialized trauma-informed care that they need to begin rebuilding their lives. As one of the 4 dual programs in the state of Connecticut, which means we serve both domestic violence and sexual assault victims here, we already manage the sexual assault hotline for the Greater Waterbury area, which stretches our staff to their limits, especially after completing full days of trauma-centered work. The added responsibility of another hotline will cause significant burnout within our staff, leading us to experience increased turnover, affecting the overall services we can provide. This approach does not adequately support our survivors, who are already grappling with life-altering circumstances. The long-term effects of trauma can have profound and far-reaching consequences when not addressed, impacting not only workplaces, but families, children, and society at large.
Amanda, you have to.
Safe Connect is not just a lifeline for survivors, it's an essential component of an efficient survivor-centered system. By answering calls and triaging survivors' needs, Safe Connect frees up local advocates to focus more on long-term, in-depth work. For example, survivors may call Safe Connect with immediate safety concerns, such as the need for shelter or assistance navigating the legal system. Safe Connect assesses their needs and connects them directly with an advocate from a member program in their area who can provide the necessary ongoing support. Often it is an immediate need for shelter as they are fleeing violence. Without Safe Connect, the system would break down, leading to delays, confusion, and increased distress for survivors. Picture yourself going through a severe
This brings up a point, and I really mean this very sincerely. We want to hear from everybody, but at the rate of 3 minutes an hour, which is 3 minutes a person, we will be here till 4 o'clock. If people keep adding on beyond the sound of the meter, then that just adds us even continuously. We want everybody to have an opportunity to try and get in during some of the reasonable hours where people will obviously be awake and aware and able to see them, to see their testimony. So it's not because of us, because we'll just drink a lot of coffee and be really sick tomorrow. But that's not what we're trying to do. We're trying to give everybody an opportunity to say a few words, identifying what they are here to testify in support of or against. That's what we're here for. So we ask you very sincerely, when you hear the bell, please stop. We do have control and we can cut you off, but that's not fair. We want you to get your point in. So with that.
Madam Chair,
Yes, ma'am.
if I may add, I would like for Rebecca to demonstrate for those people who are online the high sign that you will get that your 3 minutes are up. So Rebecca, will you demonstrate? You will see Rebecca's face. You will see the name timer. You will see Rebecca's hand up. And that means that you need to summarize your testimony, or what will happen to you, which has happened to others, is that we will mute you. Okay? So thank you, Madam Chair.
The more we find the people and we identify what you're here for, the better off we are, because there is strength in numbers. But when people can't get to their points, it's a lost testimony in my case. So thank you all, okay? Kelly Ann Estefan? Not online, okay. Okay, oh, Kelly's here. Hi, good morning. Still. 3 minutes, go ahead, Kelly. Yep.
Good evening, Senator Olson, Representative Walker, and honorable members of the Appropriations Committee. My name is Kelly Ann Evstethiou, and I'm from Norwich. I work as a certified nurse's assistant at Orchard Grove Apple Rehab, where I've been for the last year. I've been a CNA for almost 20 years, providing care at various facilities around our state. I'm here today to share my story and ask that you expand funding for nursing homes so caregivers can earn a livable wage. Many of the residents I work with depend on Medicare to cover their cost of care. Those Medicare reimbursements are what pay the salary of many of us who work in the nursing home setting and rehabilitation setting. I got into healthcare after taking care of my grandparents as they aged. When my grandfather passed away, it was suggested by family members that I become a CNA. I've worked in hospitals, assisted livings, and nursing home settings across our country. Yet in recent years, I've become overly frustrated with the system. I provide extensive care, put in long hours, and sometimes as much as 70 hours a week, and yet not making a livable wage. Every single thing I need to pay for is going up, except my paycheck. So much so that my family has had to make difficult decisions to move in with in-laws. My husband and I are back under his parents' roof because we cannot afford to pay rent, never mind paying a mortgage. My income goes to paying all our expenses just to get by. I never even have a small enough amount to put away for savings. I have considered leaving nursing on multiple occasions. After the COVID outbreak I was burnt out and exhausted. I've been a licensed hairdresser. I've worked in a bakery, but none of them fulfilled me. So I came back yet again to what I absolutely love, providing care, and it is one of the most rewarding jobs I've ever had. but it's at an expense of my financial stability and livelihood. The healthcare workers need you to step up and make sure we're paid living wages, that our facility gets increased funding so that we can attract good, hard workers to the field. Make sure to increase funding for DSS and the Department of Aging in the upcoming budget. Thank you for your time.
Thank you very much, and thank you for your testimony. Next is Chris Pankratz. Okay. And after Chris Pankratz, it's Yumira Rodriguez. She online? Okay. Go right ahead, sir.
Thank you, chairs and representatives, members of the Appropriations Committee, for the opportunity to speak today. My name is Chris Pankratz, and I'm CEO and co-owner of Masters in Home Care. We're a Medicare certified and accredited home health care agency serving Connecticut residents since 2014. I've worked in home health care in the state for over 20 years, and I'm here today to urge this committee to address the unsustainable Medicaid reimbursement rates, which threaten access to skilled home health in Connecticut. For decades, Medicaid reimbursement has failed to keep pace with our rising costs of wages, medical supplies, and compliance, making it increasingly unstable to serve Medicaid patients. On average, Connecticut reimburses 59% less than Medicare for the same home health services. This gap forces agencies to either cut back or eliminate Medicaid services entirely, leaving vulnerable residents with fewer options. I'd like to share an example of the impact of our services in the community. Since 2016, our nurses have provided home-based care for a 40-year-old man with paranoid schizophrenia. Before our nurses stepped in, he wasn't taking his medications. He was experiencing severe hallucinations and repeatedly cycling between hospitals, psychiatric holds, and the judicial system. Thanks to consistent nursing care and medication management, he has remained stable, stayed out of the hospital, and even held intermittent employment, something that was unimaginable before home health care services. But without action, more patients like him will lose access to care. Agencies will be forced to cut services or close, leading to more ER visits, hospitalizations, and forcing people into costly institutional care. We'd like to support and ask for support for increases over the next years to the skilled system, an annual Medicaid rate adjustment indexed to inflation, so we don't have to continue discussing this, and eliminating, as you heard before me, the subsequent visit rate penalty, which, if you're not familiar, cuts our reimbursement in half when we're serving patients in the same location. And I've included further details in my written testimony on these points. Investing in home health is both morally right and fiscally responsible. Without action, Connecticut's Medicaid patients will have nowhere to turn but costly emergency rooms and institutions at a much greater expense to the state. Thank you for your time.
Thank you, and thank you for your testimony. Next, Ms. Rodriguez.
Sí, continuamos.
Good afternoon. Go right ahead. You have 3 minutes, ma'am. 3 minutes. That's it.
Buenas tardes, adelante. Tienes 3 minutos. Okay. Hola, estimados miembros del Comité de Proporciones a la Asamblea General de Connecticut. Mi nombre es Yumira Rodríguez. Soy de New Haven, miembro de Connecticut Student for a Dream. Gracias por la oportunidad de testificar sobre HB 6864. Una ley relativa al propuesto del Estado para el bienio que termina en 30 de junio de 2027. Pido al comité apropiados afinar la elegibilidad Husky para todos los residentes de Connecticut con ingresos elegibles, independientemente de su estatus migratorios, hasta los 26 años. También apoyó el aumento de las tasas de reembolso de Medicaid para todos los 26 años. Actuales beneficiarios de Husky y puedan tener un mejor acceso de atención. Yo soy Yumira, estudiante de Wilbercross de grado 11. Me importa este tema porque las personas migrantes necesitan ayuda del seguro médico para poder atender sus enfermedades y dolencias físicas, ya que garantiza su bienestar y contribuye a una sociedad más saludable y equitativa. Y también debido al acceso de seguro médico y la atención oportuna y ayuda a prevenir la propagación de enfermedades contagiosas. En mi caso, no tengo seguro médico ni mi familia. Temo que alguien se lastime o sufra de alguna enfermedad grave y no poder atenderlos por medio de los exorbitantes precios de consultas o tratamiento que es requerido si los costos son altos. También los seguros médicos ayudan a cubrir una parte significativa de los costos de atención médica. Esto nos ayuda a librar nuestro temor de no poder tener un esfuerzo en estos momentos que nuestra comunidad está amenazada y vulnerable, ya que también previenen problemas financieros con costos inesperados. Pido al comité apropiados que financie la elegibilidad de Husky para todos los residentes elegibles de Connecticut, independientemente de su estatus migratorio, hasta los 26 años de este año, y cree que un plan para abrir el acceso de todos los inmigrantes independientemente de su edad. Necesidades sanitarias no permiten los 26 años. Gracias por su tiempo.
Good afternoon, dear chairs and members of the Appropriation Committee. My name is Yomaira Mireya Rodriguez. I am from New Haven. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. I am Jamaira, an 11th grade student at Wilbur Cross. I care about this issue because migrants need help from health insurance to be able to care for their illness and physical ailments, as it guarantees their well-being and contributes to a healthier and more equitable society. And due to the access to health insurance and timely care, it helps prevent the spread of contagious diseases. In my case, I do not have medical insurance, nor do my family. I fear someone will get hurt or suffer from a serious illness, and we will not seek care because of the exorbitant cost of treatments that are required. Medical insurance also helps to cover a significant part of the cost of medical care. This will help us alleviate our fear of not being able to have support at this time when our community is so threatened and vulnerable, as it also prevents financial problems with unexpected expenses. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26 this year, and create a plan towards opening access to all immigrants regardless of age. Healthcare does not end at age 26. Thank you for your time.
Thank you, and thank you for your testimony. Next, Dennis. I'm not going to try your last name. You're on the remote. Pronounce it, please.
Sorry.
What is your last name? Pronounce
Dennis Spitz.
Yeah, I'm glad you said it. Okay, thank you very much. Thank you, sir. Go right ahead.
Thank you for letting me speak here today. My name is Dennis Spitz, and I'm the CFO at CT Renaissance, a nonprofit organization that was founded in 1967. Our organization provides behavioral health and criminal justice services through Fairfield and New Haven counties, and last year we've served 4,000 individuals. Some of the programs that we run are inpatient and outpatient clinics, and we run them in low-income area, which means it's mostly funded by Medicaid reimbursements. At this point, we have had to close down 2 of our clinics because the rates are simply nowhere near high enough to pay for the clinicians that we have. Even with those closures and the focus on the remaining 2 outpatient clinics that we have, we are looking at very heavy losses for those clinics, basically exceeding $1 million for the 2 remaining clinics. We're currently making whatever efforts we can to salvage those locations, but frankly, at the rates that those programs are being reimbursed, it seems almost impossible for us to reach any possible way of keeping those programs. If things continue, those clinics will close down as well, and this will be 4,000 people between all of them that frankly will not get those services. Maybe they will go to other nonprofit organizations and overwhelm them in the time, or they will go to the emergency rooms and require emergency services that will end up being more costly to the state of Connecticut. At this point, we desperately need additional funding to keep those programs running, because if we don't, those people will end up having significant issues and cause significant problems for the state of Connecticut itself. That's all there is to say to that. And unfortunately, there's no easy way around it. The only way for us to survive is to increase our funding. Thank you so much for your time.
Thank you, and thank you very much for your testimony. And I will make sure we read your testimony. Patrick, Ma?
Not online.
Not online. Okay, next, Travis Pegram. He's online.
Hi.
Yes.
Good afternoon, members of the Appropriations Committee. My name is Tavish Pegram, and I'm a resident of East Hampton. Thank you for the opportunity to testify on HB 6864 in the Human Services budget. I'm in favor of increasing Husky funding for immigrant community and ask the committee to fund coverage through age 26, regardless of immigrant status. It is also important to maintain what has been gained for children up to age 15 and pregnant individuals, and to increase reimbursement rates for providers, which impact the quality of Husky for all of our neighbors in Connecticut. I get private insurance through my work, covering my wife and my newborn son, but that doesn't mean that other people's health does not affect me or my family. If you don't have insurance, you must weigh every health decision against bankrupting your family. Is it cold? Is it a cold or maybe the flu coming on? What is this worsening cough you have? If getting this checked out and possibly treated puts too much of a financial burden on your family, you are going to wait and see if it actually gets so bad that it must be addressed. Cross your fingers, head back to work, because you clearly don't have the luxury of sitting at home and not working until everything is cleared up. So you may or may not be sick, but you can't afford to get it checked or treated. You can't afford to not work. So you're going to be at the cubicle next to me, trying not to cough, or at the drugstore in line ahead of me, picking up some vapor rub for what might turn out to be RSV, hoping it's nothing serious. And now I'm sick, and now my newborn is at risk. Anyone without access to healthcare in my community is a danger to me and my family, regardless of my coverage. My wife works in healthcare, and I've worked in an adjacent field. And what everyone seems to know who works in and around medicine is that the most effective, efficient, and cheapest form of healthcare is preventative care. It is irresponsible and wasteful to advocate for any kind of healthcare system that does not incentivize everyone to seek appropriate medical treatment early and often, to get screenings, to get vaccinated, to detect and treat problems before they become serious for themselves and then later for the rest of us. The burden of treating uninsured patients in the emergency department is passed along to those with insurance. The more uninsured individuals in the population, the more expensive insurance is for all of us. Expanding access to health insurance for immigrants up to age 26 is a necessary, though incomplete, step towards ensuring my family's health and financial well-being. It does not make sense to differentiate arbitrarily between classes of people in our communities because our individual health is not isolated. To best protect myself and my family, I need everyone to have healthcare access. I need the community as a whole to be healthy, because diseases don't discriminate based on documentation. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26 this year, and create a plan towards opening access to all immigrants regardless of age. I also ask the committee to increase Medicaid reimbursement rates, which is a needed step to ensure Husky recipients can access care. Thank you for your time.
Thank you, and thank you for your testimony. Next, Jose Quezada? Online. Jose? Go right ahead. You have 3 minutes.
Estimados miembros del Comité de Aprobación de la Asamblea General de Connecticut, mi nombre es José Quesada Revelo. Soy de New Haven y soy un inmigrante ecuatoriano de 16 años. Soy estudiante de Wilbur Cross High School y soy miembro de CT Students for a Dream, una organización que lucha por los derechos de los jóvenes indocumentados y sus familias. Veo la importancia de un seguro médico para nuestros inmigrantes. Gracias por la oportunidad de testificar sobre HB 6864, una ley relativa al presupuesto del Estado para el beneficio que termina el 30 de junio de 2027. Pido al Comité de Aprobaciones Financieras la elegibilidad de Husky para todos los residentes de Connecticut con ingresos elegibles, independientemente de su estatus migratorio hasta los 26 años. La campaña Husky for Immigrants es importante para mí porque veo la importancia de que todos los inmigrantes tengan un seguro médico en Connecticut, sin importar su estatus migratorio. Afortunadamente, yo cuento con un seguro médico Husky. Esto me ha ayudado mucho en muchas situaciones. Por ejemplo, en diciembre tuve un accidente en el cual tuve que ir al hospital y al día de hoy tuviera una deuda muy grande si no hubiese por ese seguro. Muchas personas no cuentan con esta oportunidad de tener un seguro médico. Puedo tomar de ejemplo a mi madre, que sufre un dolor en su brazo cuando hace mucho esfuerzo y no puede irse a revisar o tener una cita médica porque no tiene un seguro. Mi madre podría tener revisiones y saber el motivo de por qué tiene eso, y luego tener medicina para curarse. Esto me hace sentir muy mal al ver a mi madre sufriendo por no poder tener una solución a sus dolores. Esto no ayudaría solo a mi madre, también ayudaría a todos los inmigrantes que estén en una situación parecida a no contar con un seguro médico. Yo no veo justo que las personas sufran por no tener un seguro médico, ya que yo lo veo como algo que todos deberíamos tener sin importancia de dónde seamos y no solo por un privilegio para pocos. Yo apoyo a Husky for Immigrants y le pido al comité que apoye y financie la elegibilidad de Husky para todos los residentes de Connecticut, independientemente de su estatus migratorio hasta los 26 años. Este año, y que cree un plan para abrir acceso a todos los inmigrantes de todas las edades. Gracias por su tiempo, José Quesada.
Good afternoon. My name is Jose Cristobal Quesada Revelo. I am from New Haven. I am a 16-year-old Ecuadorian immigrant. I am a student at Wilbur Cross High School, and I am a member of Connecticut Students for a Dream, an organization that fights for the rights of undocumented youth and their families because I see the importance of health insurance for us immigrants. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. The Husky for Immigrants campaign is important to me because I see the importance of all immigrants having health insurance in Connecticut regardless of their immigration status. Fortunately, I have Husky health insurance. This has helped me a lot in many situations. For example, in December, I had an accident in which I had to go to the hospital. If I had not had any insurance, I would currently have a large debt, but many people do not have this opportunity to have health insurance. I can take the example of my mother who suffers from pain in her arms when she exerts a lot of effort and cannot go for a checkup or have medical appointments because she does not have insurance. My mother could have checkups and know the reason why she has that, and then have medicine and be able to cure herself. This makes me feel very bad to see my mother suffering for not being able to have a solution to her pain. This will not only help my mother, it will also help all immigrants who are in a similar situation of not having health insurance. I do not see it as fair that people suffer for not having health insurance, since I see it as something that we should all have, regardless of where we're from, and not just a privilege to few. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to 26 this year, and create a plan towards opening access to all immigrants regardless of age. Healthcare does not end at age 26. Thank you for your time, Jose Cristobal.
Oops, thank you. Thank you for your testimony. Next, Rhonda, this is remote. Is Rhonda not online? Okay. Okay. Mark Kosnoff? Online. Good afternoon, sir. Go right ahead.
Yes. Good afternoon. Representative Walker, members of the Appropriations Committee. My name is Mark Kosnoff. I'm a Meriden resident, and I'm also the Executive Director of United Action Connecticut. It's a faith-based organization that supports social justice causes. I too am here in support of increasing funding for Husky. It's critically important to maintain what has been gained for children up to age 15 and pregnant individuals. And I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 26. You probably have heard and will hear the rest of the day some very heartbreaking stories about immigrant individuals and families that have had to forego medical treatment because they have had no medical insurance and can't afford to pay out of pocket. You'll also hear some testimonies from others indicating that Husky is economically sensible. I'd like to make a couple other points. First, in the United States, healthcare industry is big business, and thousands of people can't afford it. I know this sounds like a cliche, but healthcare is a human right. In every other industrialized nation, healthcare is a human right, and medical debt and not being able to access care does not exist. Connecticut can't fix all the national healthcare crisis, but it can ensure basic, affordable access to healthcare for all its residents. Second, I'd really like to talk about our immigrant neighbors. It seems like it's currently fashionable to bash immigrants and treat them as less than human. And too many people feel that undocumented immigrants don't belong here and don't deserve any consideration for health aid. I really find that kind of disgraceful. At United Action Connecticut, I have worked with immigrant families for over 12 years, and I know the real facts. Immigrants pay taxes, they have lower crime rates than native-born residents, they are not eligible for federal entitlements, most work at least one and often multiple jobs, they're family-oriented, they go to church, and although they are labeled as undocumented, many of them are awaiting asylum decisions. Let's not forget how important they are to our state economy, as they are vital to many industries, including agriculture, construction, home health care, the restaurant business, and domestic work. I'm simply asking you look at the immigrant community not as interlopers, but people who are raising families, working hard, and trying their best to contribute to their community. I know you have some really tough financial decisions to make over the next few weeks, but expanding Husky coverage is one area that will have an extremely positive impact on our state residents. And it's simply the right thing to do. Thank you.
Thank you, sir, and thank you for your testimony. Have a good day.
Thank you.
Linda Mays, I don't see you on remote. And Linda Mays. Okay, next. Yan Ponchin. Remote. Okay. From the same organization. Rodrigo Nino.
He is here, but he needs to accept being promoted to a panelist.
Okay. Rodrigo, please accept the invitation, please. And Giselle Nino.
Rodrigo has accepted.
Okay, go right ahead, Rodrigo. Go right ahead, Rodrigo.
Adelante, Rodrigo.
Rodrigo? Okay, how about Giselle? Are we having computer problems or understanding on how to turn it on? I mean, to connect? Okay, we'll come back. We'll come back and try again. As soon as you let us know, okay? Karen Valderrama?
Also online.
Karen? Go right ahead.
Adelante, Karian.
Go right ahead. Hello? Your microphone is muted. Turn on your microphone, please.
Su micrófono está en silencio, por favor, préndalo.
Hello? You must turn off your microphone or turn on your microphone, whichever way you want to do it. Okay, we're going to have to move on. Okay? Manuel Coral?
Representative, he is not online.
I am having some difficulty getting some people to accept being promoted.
Okay.
It may be helpful to have our interpreter just make an announcement to all the people online about accepting the promotion.
Okay. Would one of the interpreters please speak out to all the people who you are interpreting for and tell them to accept the invitation to be on?
Por favor, a todos nuestros miembros en la línea, por favor acepten su invitación para que puedan hablar y decir su testimonio.
Okay. Now, Karen, are you ready to speak?
Yes.
All right. Okay. Somebody has to turn off their speaker on their computer in order for us to hear you, okay?
Okay.
Go right ahead.
Buenas tardes. Gracias por la oportunidad de dar mi testimonio. Mi nombre es Karian y quiero compartir mi historia como madre en el programa de Chiropractic. Mi viaje con Chiropractic comenzó cuando el Departamento de Niños y Familia nos refirió a mí y a mi hija de crianza a sus servicios. Cuando mi mejor amiga falleció, me convertí en la madre de crianza de su hija de 2 años. Mi esposo y yo teníamos nuestra propia hija que también tenía 2 años en ese momento y un hijo de 11 años. El peso de mi dolor era abrumador, mis días eran consumidos por reuniones, regulaciones y la presión de asegurarme de cumplir con los requisitos del DCF. A veces sentía que mi propia vida había quedado en suspenso y a menudo me encontraba en un mar de incertidumbre. Mi hija de crianza también estaba luchando su dolor. Se manifestaba en comportamientos agresivos, pesadillas frecuentes, enuresis y arrebatos emocionales. Era agresiva contra mi otra hija y me sentí impotente sin saber cómo llegar a ella o ayudarla a superar su dolor. Entonces Chiropractic entró en nuestras vidas desde el principio. Su equipo fue profesional, compasivo y siempre disponible. Escucharon mis miedos y luchas, me brindaron la orientación y el apoyo que tanto necesitaba. Lo más importante es que me ayudaron a entender el dolor de mi hija adoptiva y me enseñaron cómo apoyarla a través del juego, a través de la terapia de juego. Mi hija de crianza comenzó a sanar lentamente, aprendió a expresar sus emociones de manera más saludable y a medida que nuestros vínculos se fortalecían, vi la niña feliz que estaba destinada a ser. De lo que no me había dado cuenta era de lo mucho que mi propia hija se había visto afectada por todo lo que habíamos pasado, a dedicar tanto de mí a mi hija de crianza. Me había distanciado involuntariamente de mi propia hija. Chiropractic reconoció esto y también abrió un caso para mi hija. Con su ayuda pude concluir mi relación con ella. Empezamos a hablar más, a pasar el tiempo juntas y reconectarnos de manera que yo había descuidado. Hoy compartimos un vínculo más fuerte. Estoy orgullosa de ser la madre que me he convertido. Sé cómo apoyarlos emocionalmente y reconozco la importancia de estar presente para ellos en todos los sentidos. Chiropractic me dio las herramientas para navegar el capítulo más difícil de mi vida y gracias a ella mi familia es más fuerte. El apoyo recibí me cambió la vida, no solo a mi hija adoptiva, sino a toda mi familia. Le insto a que continúen apoyando programas como Chiropractic. La familia es crisis, necesita estos recursos. Los niños que han sufrido un trauma necesitan este nivel de atención y los padres como yo y la orientación y el apoyo que solo organizaciones como Chiropractic pueden brindar. Mi historia es solo una de muchas, pero espero que me muestre el impacto que tienen estos servicios. Muchas gracias.
Thank you.
Thank you for the opportunity to provide my testimony. My name is Karian, and I want to share my story as a caregiver in the Child First program. My journey with the Child First began when the Department of Children and Families referred me and my foster daughter to their services. When my best friend passed away, I became the foster mother to her 2-year-old daughter. My husband and I had our own daughter, who was also 2 years old at the time, and an 11-year-old son. The weight of my grief was overwhelming. My days were consumed by meetings, regulations, and the pressure of ensuring I met DCF's requirements. At times, it felt like my own life had been placed on hold, and I was often in a sea of uncertainty. My foster daughter was struggling as well. Her grief manifested in aggressive behaviors, frequent nightmares, bedwetting, and emotional outbursts. She lashed out to me and my daughter, and I felt helpless, not knowing how to reach for help or help her through her pain. Then Child First entered our lives. From the beginning, the team was professional, compassionate, and always available. They listened to my fears and struggles. They provided the guidance and support I so desperately needed. More importantly, They helped me understand my foster daughter's pain and taught me how to support her through it. Through play therapy, my foster daughter slowly began to heal. She learned to express her emotions in healthier ways. And as our bond strengthened, I saw glimpses of the happy child that she was meant to be. What I hadn't realized was how much of my own daughter had been affected by everything that we had gone through. In dedicating so much of myself to my foster daughter, I had unintentionally distanced myself from my own child. Child First recognized this and opened a case for my daughter as well. With their help, I was able to rebuild my relationship with her. We started talking more, spending more time together, and reconnecting in ways I had neglected. Today, we share a strong bond. I am proud of the mother I have become. I know how to support them emotionally and recognize the importance of being present for them in any way. Child First gave me the tools to navigate the hardest part of my life, and because of them, my family is stronger. The support I received was life-changing, not only for my foster daughter, for my entire family. I urge you to continue supporting programs like Child First. Families in crisis need these resources. Children who have endured trauma need this level of care, and parents like me need the guidance and support that only organizations like Child First can provide. My story is just one of many, but I hope it shows the impact that these services have. Thank you.
Thank you, and thank you for your testimony. Let me try again. Rodrigo Nino? Rodrigo? Or Giselle? Rodrigo.
¿Me escuchan?
Go right ahead, sir.
Ok. Estimados miembros del Comité de Apropiaciones de la Asamblea General de Connecticut, me llamo Rodrigo Nino. Estoy casado y soy padre de 2 hijos. Vivo en la ciudad de Norwalk y soy miembro de Comunidades Sin Fronteras. Gracias por la oportunidad de testificar sobre la HB 6864. Para el presupuesto de servicios humanos, estoy a favor de aumentar la financiación de Husky para nuestra comunidad inmigrante y pido al comité de que financie la cobertura hasta los 26 años, independientemente de su estatus migratorio. También es importante mantener lo que se ha conseguido para los niños hasta los 15 y las personas embarazadas. Aumentar los reembolsos para los proveedores que impactan la ciudad de Husky para todos nuestros vecinos en Connecticut, inmigrantes o no. Mi vida cambió drásticamente. Me dio la bacteria Helicobacter pylori. Esta bacteria se originó úlcera y gastritis crónica. Es muy difícil llevar el dolor que tengo. El doctor me dijo que necesitaba operarme. Tenía fecha para una operación. Tengo esperando muchos años. Siempre me pregunta por mi seguro médico y respondo que no tengo. Tomo medicina diariamente y estoy desesperado. Solo les pido a ustedes que hagan realidad el tener seguro de vida médico para todas las familias que sufrimos en nuestra salud. La salud es un derecho humano, no un privilegio. Si Connecticut quiere un futuro que incluya en las familias saludables y una fuerza laboral estable, próspera y en crecimiento CT, debe garantizar que todas las familias tengamos acceso a la cobertura de salud. Gracias por escuchar a la comunidad inmigrante. Gracias.
Dear members of the Connecticut General Assembly Appropriations Committee, my name is Rodrigo Nino. I am married and I'm the father of 2 children. I live in the city of Norwalk and I'm a member of Comunidades Sin Fronteras, CT. Thank you for the opportunity to testify on HB 6864 for the Human Services budget. I support increasing Husky funding for our immigrant community and ask the committee to fund coverage up to age 26, regardless of immigration status. It is also important to maintain what has been achieved for children up to 15 years and for pregnant people, and also increase reimbursement for providers who impact the quality of Husky for all our neighbors in Connecticut, immigrant or not. My life changed drastically. I got the Helicobacter pylori bacteria. This bacteria causes ulcers and chronic gastritis. It's very difficult to bear the pain that I have. The doctor told me that I need to have a surgery. I have an appointment for an operation. I've been waiting for many years, but they always ask me about my health insurance, and I answer that I don't have it. I take medicine daily. I'm desperate. I only ask you to make having health insurance a reality for all the families who suffer for our health. Health is a human right, not a privilege. If Connecticut wants a future that includes healthy families and a stable, prosperous, and working stable, prosperous, and growing workforce. CT must guarantee that all families have access to health coverage. Thank you for listening to the immigrant community.
Thank you and have a good afternoon. Next, I'm going to go to Jan Ponton, Yale Child Study.
Yes, hello. Senator Austin, Representative Walker, and honorable members of the Appropriations Committee. On behalf of the Yale Child Study Center, thank you for the opportunity to support the governor's proposal to increase Medicaid reimbursement rates. The Yale Child Study Center is a Yale School of Medicine department providing research, clinical services, and training for children and families, serving over 3,800 families, more than half of whom are Medicaid enrollees. And Yale commends the governor for addressing the behavioral health crisis among children and families. Insufficient reimbursements rates lead to clinical shortages, longer wait times, and more severe interventions. A DSS study shows Connecticut's Medicaid rates are much lower than peer states, affecting clinician recruitment and retention. Raising rates would improve access to various essential services, preventing crises and reducing emergency care dependence. Yale Child Study Center conducts 60,000 visits annually, with Medicaid covering half. Adequate reimbursement is vital to maintaining quality care and avoiding strain on our resources. And outdated rates hinder timely access to behavioral health services. We support a budget increase that rates based on the DSS study and Medicare rates, closing the reimbursement gap and ensuring equitable access to behavioral health services for all children. However, we also express concerns about Governor Lamont's budget proposal, which increases hospital taxes and reduces care reimbursements, straining providers and threatening essential services. This could destabilize healthcare delivery and limit children's access to care, and would be at odds with the goals of the above. Hospital funding cuts jeopardize psychiatric care for children, leading to service reduction, staff shortages, and longer wait times. So we urge the General Assembly to consider these impacts and protect patient access and provider stability. The CSC is already collaborating with stakeholders to support these efforts. We strongly encourage adopting Medicaid rate increases to enhance Connecticut's behavioral health infrastructure and improve outcomes for children and families. Thank you for your leadership and consideration.
Thank you, sir. Thank you for your testimony. Next, we have Manuel Coro. Not on. Okay. Jenny Canepa.
Yes,
Go right ahead, ma'am.
thank you. Good morning, everyone. Dear members of the Connecticut General Assembly Appropriations Committee, thank you for the opportunity to testify on HB 6864 regarding the Human Services budget. I am in favor of increasing funding for Husky for our immigrant community and ask the committee to extend coverage up to age 26. My name is Jenny Canepa, founder of United Parents for Student Success, and I'm here to support the Husky program. I respectfully request that the Appropriations Committee fund Husky eligibility for all residents of Connecticut who meet income requirements, regardless of their immigration status, and extend coverage up to the age 26. Medical needs to not end at age 15. As a mother and a community member, it is crucial that all children have access to healthcare. Not child should have to suffer or endure pain caused by illness or by not receiving assistance when their mental and emotional health is affected and they need to help of a healthcare professional. Children have the right to a happy, safe, and healthy life, and part of that right includes access to adequate medical care. It is essential that every child have access to the Husky insurance program. I want to share the story of a student who had an accident and fractured his collarbone. Unfortunately, on the day of the last public hearing last year, he turned 16. The cost of his first medical visit was high, and due to financial constraints, he struggled to continue his treatment. This has had a significant impact on his participation in the Army program, and it is deeply painful because not only did it restrict his activities, but the bone did not heal properly, leaving a visible bump. For all these reasons, I kindly urge to you approve the necessary funding to extend the Husky program until the age of 26. Thank you for your time and considerations.
Thank you, and thank you for your testimony. Have a good day.
Thank you.
Next, Nancy Rembert. Not online. She's here. You guys just couldn't stay away from us. You wanted to come and testify. We liked her. Nope, you were good. Leave it on. Yeah. Pull it closer to you so you can thank her. Okay.
Hi, and good evening to the honorable members of the Appropriation Committee. My name is Nancy Rember, and I'm from New Haven. I have worked as a personal care assistant / PCA for the last 3 years and a half. I'm here today to urge you to increase the funding of the Department of Development Service and the Department of Aging and Disability. Being a PCA is emotional. While providing care for a person, for someone can mentally drain you. It's not from my work requirements either. It's due from the financial needs. I live now only from paycheck to paycheck. And sometimes, well, it takes me 2 paychecks just to pay my rent. Half of my monthly income is already gone just from rent. It leaves me broke with very little money. And if I have emergencies or things that I need, I don't have the money because of the bills that I have to pay. I have to monthly tackle issues, life situations as far as paying electricity bill, car insurance, or my cell phone bill. All these things are necessary for me to get by my day and to do my job. It's also causing me mental stress. My consumers, my coworkers, my family members, they see the stress that I'm under and they worry about me. I struggle to let go of my worries while I'm with them. The economy is making it unaffordable for Connecticut. I'm sorry, the economy is making it's unaffordable for me to stay, and I don't know how much longer I can do this. PCAs like me have made some progress in the recent years and refuse to go back. We need your help to ensure that no matter what happens in Washington, it's critical that Medicaid service receives the funding that we need. Thank you for letting me testify, and thank you.
Thank you. And thank you for coming in person. Thank you. Wait, she wants a picture. Kodak moment. Thank you. Next, Todd Johnson. Online. Todd? Todd?
Yes, I'm sorry. It took me a while to turn off mute. Thank you, the committee, for allowing me to speak today. I've just have a couple of quick things. I live in Portland, Connecticut. Back in 1983, I had a motorcycle accident and became a paraplegic. I currently use complex rehab technology is in a power wheelchair. Now, my life over the past 40 years, being paralyzed, has come with a great amount of challenges. And as we all get older, those challenges seem to increase. So I'm here to testify and give you a personal perspective on what I feel these proposed changes could impact my life and others in my situation. Now, I don't know exactly in just what parts of the bills, but this is dealing with the budget. So I believe when I go through it, it'll be a better understanding. First, I'd like to mention I do have health insurance coverage through Husky C without a spend down. And that's due to being part of the MedConnect program, which is tremendous, which is Medicaid for employees with disabilities. Now, my understanding is that there's been a change in the law that is going to remove the part where we are increasing our income limits and the asset limits for the next couple of years. And then after 4 years, it's supposed to eliminate that altogether. But I have heard that that is being changed and they're just going to be doing one increase. If I'm incorrect, I'm sorry, but I just want to bring that up as a concern. I'm hoping that it will continue with the 4 years and then have no asset income or asset test or income limit. Secondly, I'm concerned about the block grants for hospitals for Medicaid coverage. The concern is once the hospitals use up their block grant for coverage, let's say it's early in the year, what do people who have Medicaid go for? Or will certain things be delayed for certain conditions until the following year block grant comes up? And then lastly, I heard in the law that there is for weight loss, and I could put my my video on. I happen to be a larger gentleman, and I would say my doctor mentioned to me that I'm obese. Unfortunately, there's not an easy way to lose weight. If I was able to use a weight loss drug without the stipulation of me having to have another condition like diabetes, that is something that can happen. Oh, timer. Sorry, I'm done. Thank you very much, everyone, for allowing me to testify.
Thank you, Todd. Thank you for your testimony on such important issues. Next, we are hearing from Ari Garcia, followed by Christina Emery. Ari is online. Go right ahead, Ari.
Can you guys hear me?
Yes, we can.
Okay. Dear chairs and members of the Appropriations Committee, thank you for the opportunity to testify on HB 6864, an act concerning the state budget. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. My name is Ori Garcia Esquivel. I am a student at West Hill High School in Stamford, Connecticut, and a part of the organization Nosotras Connecticut. And I care about Husky for Immigrants because I believe that as members of the human race, we should live in a world where we all have a responsibility to take care of one another, and that starts with healthcare. Our communities are full of people who contribute to our lives every single day, whether that's through raising families, working, or supporting each other. We all belong to one another. I think it's time we all recognize that our communities are filled with kind, hardworking, and resilient people. Yet, unfortunately, way too many of them suffer in silence because we choose not to give them access to healthcare. We choose not to give them access to a basic human right. The lack of healthcare is not just about statistics, it's about real people. Our friends, our neighbors, the people we see every day, everyone deserves to be treated with compassion, care, and dignity, regardless of someone else's birthplace or what's in their wallets. If everyone in my community had health care, it would be shown within us that we haven't lost our humanity in the face of injustice, and that despite the political and economic state of the world, we're still trying to preserve the little humanity that is left. Health insurance is not just about medical care, it's about opportunities, security, and guaranteeing that all humans equally have the chance to live a stable, healthy life. It would mean that the people who contribute to our country and our economy may also have the right to receive the care they need. We all deserve a world where humanity comes first. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status up to age 26 this year, and create a plan towards opening access to all immigrants regardless of age. Thank you for your time.
Thank you, Ari. Well done. Next, we'll hear from Christina Emery. Is Christina with us? Oh.
Good afternoon, Senator Lesser and Representative Gilchrist. My name is Christina Emery, and I serve as the Executive Director of Brooker Memorial, a nonprofit in Torrington dedicated to the health and wellness of children. Thank you for the opportunity to testify today and for your dedication to Connecticut families. As a DSS designated safety net dental provider, Brooker cares for low-income children throughout Northwest Connecticut. The preventative care we provide reduces long-term oral health concerns, chronic diseases, and emergency room visits which would otherwise place an unnecessary burden on both our healthcare system and the state budget. In the last fiscal year, we provided over 9,000 dental visits to 4,700 patients, delivered services in 10 public elementary schools, and served a population where 85% are on Medicaid or uninsured, making Brooker the largest provider of dental care to low-income children in Northwest Connecticut. Continued low Medicaid reimbursement rates are putting the financial sustainability of our safety net dental program at risk and threatening our ability to continue to serve low-income children. Last year alone, our program experienced a net loss of over $330,000 or $36.16 per visit. Unlike other community-based safety net providers such as FQHCs, hospital-based clinics, or dental hygiene schools, Brooker receives no supplemental government payments for serving a predominantly Medicaid population. In the last fiscal year, we filed over 7,000 Husky claims, receiving an average reimbursement of $120.65 per claim. This reimbursement is significantly lower than the PPS rate paid to the local FQHC, which was just recently forced to close its dental clinic due to low reimbursements. Medicaid payments cover only 65% of what private insurance would reimburse for the same procedures. Currently, only 62% of Husky-insured children in Northwest Connecticut receive dental care. To expand services, we must recruit additional providers, invest in a new operatory room with necessary equipment, and launch an in-school dental clinic at the local Head Start, providing care where children need it most. However, these efforts will not be feasible without increased reimbursement rates or supplemental payments to support our mission. I urge you to protect Medicaid patients in Connecticut and raise dental reimbursement rates to ensure safety net providers like Brooker can continue to serving children in need. This investment will not only expand access to essential care, but also reduce emergency room visits and improve public health outcomes in the state. Thank you for your time and consideration.
Thank you, Christina, for your work and your testimony. Next, we'll hear from David Weinrep online.
Dear members of the Human Services Committee of Connecticut General Assembly, my name is David Weinreb. I am a bilingual educator, community organizer, and LGBTQ advocate from New Haven. I'm also the co-chair of the Ward 14 Democratic Town Committee and an executive board member of the New Haven Federation of Teachers. I am a documented, insured patient of my local federally qualified health center, Fairhaven Community Healthcare. I stand in strong support of HB 6864. If this bill is passed, we have the opportunity to invest in the success of our newcomer families, increase access to gender-affirming care for undocumented LGBTQ youth and young people, and strengthen the overall health and wellness of our neighborhoods. I've been working as an educator, worked with new immigrant students since 2010. While working at the Fairhaven School, 5 blocks from my home here in the Latinx majority community of New Haven, I was privileged to teach 5th and 6th grade Spanish-speaking newcomers, many of whom were undocumented children from Guatemala, Mexico, Ecuador, and the Dominican Republic. They are brilliant young people with incredible life experiences and families who care deeply about their children's education, health, and well-being. They and their families also have tremendous unmet needs, neglected and exacerbated by an inability to access health care. Many have experienced significant trauma in their journeys, and if their mental health challenges are not addressed, they distract and derail students and their families from academic success. Many also suffer from a variety of untreated chronic medical conditions, the symptoms and pain of which impact students' attention, attendance, and of course their health. I've worked with parents who are trying to access healthcare, but their provider options, services, and medications are limited or prohibitively expensive, appointments are sparsely available, and concern regarding documentation discrimination pervades. And the consequences is that families of our children, some of the strongest and most persistent people I've ever met, struggle to succeed. I'm also the founder and lead organizer for the City of New Haven LGBTQ Youth Task Force. Through this work, we have learned of so many of the challenges faced by LGBTQ identifying young people, including their ability to identify welcoming providers and access gender-affirming care. Building LGBTQ-affirming schools is not enough. Until undocumented LGBTQ young people and their families are able to access Husky, many will struggle mightily to survive and cannot access the variety of services and supports they need to thrive in their schools, their homes, and in their communities. We can work to fix this. You can work to fix this. We can pass HB 6864 and help young people and their families access mental health services, as well as the regular, consistent medical care that they need, that we all need. we can pass this and ensure that everyone has resources and advocacy that they need to lead healthy, open, safe, and meaningful lives. I ask the committee to support and pass this legislation. Thank you for your time.
Thank you, David. Next, we'll hear from Daniela Capetta.
Hi, good afternoon. My name is Daniela Capetta, and I'm a behavioral health nurse with Alara Caring. Thank you for the opportunity to testify today in support of increasing the reimbursement rate for behavioral health, home health providers, specifically by restoring the cut to the medication administration rate made in 2016. As a nurse working with young adults aged 18 to 25 who are transitioning from the Department of Children and Families into independent or supervised living, I have witnessed firsthand the challenges they face. Many of my clients have endured extensive trauma, including physical and sexual abuse, and often have little to no support system. Their transition into adulthood is faced with uncertainty, and without the right support, they are at high risk of instability, hospitalization, or involvement in the criminal justice system. My role extends far beyond traditional nursing care. I coordinate with community providers to ensure my clients receive critical medical and mental health care. I assist with scheduling appointments, arranging transportation, and relaying clinical information to keep them safe in the community. Education is a fundamental part of my job, teaching them about their diagnoses, medications, and essential daily living skills. Medication compliance is a serious challenge in this population. Without proper administration and education, many clients experience decompensation and hospitalization. Providing consistent medication administration and oversight is crucial to keeping them engaged in treatment and preventing crisis-level interventions. Additionally, substance use is a significant concern among these young adults. I work closely with them to reduce use, prevent relapse, and navigate legal requirements that may impact their ability to access care. For those with criminal histories, I help them adhere to court requirements while staying on track with their health and recovery goals. These young adults require highly specialized nursing care, professionals with the expertise to navigate complex cases with compassion, advocacy, and a commitment to long-term stability. Without our services, many struggle to access care, increasing reliance on emergency services, hospitalizations, and state-funded programs. For these reasons, I respectfully urge the committee to restore the rate for home health medication administration. Investing in these services is an investment in prevention, stability, and better long-term outcomes for vulnerable young adults. Thank you for your time and consideration.
Thank you, Daniela. Thanks for your testimony. Next is Karen Hansen.
Good afternoon, distinguished members of the Appropriations Committee. Thank you for the opportunity to testify on House Bill 6864. I am Karen Hansen, the Director of Family-Based Recovery, Model Development and Operations Program at the Yale Child Study Center. I am testifying today to support the Department of Children and Families budget, specifically the funding allocated for family-based recovery. FBR is an in-home treatment model for parents with a substance use disorder who are actively parenting a child under the age of 6 with a goal to reduce out-of-home placements. Our program aligns with DCF's mission to focus services on Connecticut's youngest residents to ensure they grow up in safe, stable homes. 5 behavioral health agencies across Connecticut provide the FBR model. Since 2007, FBR teams have treated over 3,000 Connecticut families. 82% of children remain with their parents at discharge. In a randomized control trial, families who received FBR were 21% less likely to have their child placed in out-of-home care compared to those receiving community treatment. Why is this significant? While sometimes necessary, out-of-home placements carry consequences. Children may experience developmental delays, attachment disruptions, higher rates of adverse events in adulthood, including substance use and mental health issues. Out-of-home placements not only affects the child and the parent-child relationship, but can also be traumatic for the parent, worsening mental health and substance use issues, compounding prior trauma, and reinforcing societal stigma around being labeled an unfit parent. There are also financial costs to Connecticut for foster care and treatment for both child and parent. FBR MDO is responsible for providing training and consultation focusing on risk identification and mitigation. In its 2024 Child Fatality Investigation Executive Summary, The Office of the Child Advocate acknowledged FBR MDO's essential role in preventing substance-related tragedies, recommending, quote, additional resources from DCF to support quality assurance, staff recruitment and retention, and high-quality service delivery. Despite the OCA's recommendation for increased support, the FBR MDO budget was reduced by 22.5% in the last fiscal year. This cut has hindered our ability to provide critical model fidelity oversight at a time when DCF rebid the FBR program. Currently, 77% of FBR staff are new to the model, underscoring the need for increased, not reduced, training and support. Recognizing this, DCF has included the requested $144,000 budget adjustment to enable FBR MDO to deliver essential training, consultation, and program development. FBR MDO remains committed to collaborating with DCF and provider agencies to offer model adherent treatment to high-risk families, ensuring every child in Connecticut has the opportunity to grow up in safe, stable homes with their parents. We urge you to approve the DCF budget adjustment to sustain this vital work. Thank you for your time.
Thank you, Karen. Thanks for your work and your testimony. Next, we'll hear from Kristen Delage. Is Kristen with us? Okay. Dr. John Satterfield. No? Is John in here? All right. How about Jim Schmerling? I was wondering who was making those cute noises. Go right ahead.
Thank you. Senator Lesser, Representative Gilchrist, and members of the Appropriations Committee. Thank you for the opportunity to testify regarding the Department of Social Services budget. My name is Jim Schmerling, and I'm the President and CEO at Connecticut Children's, the state's only health system focused exclusively on the needs of children. Our sole focus on children makes us unique amongst our hospital colleagues and also means that we have unique strengths and challenges. Over half our patients rely on the state's Medicaid program. According to the Office of Health Strategy's annual hospital financial report, in fiscal year 2022, for every $1 of care that we provided to a patient on Medicaid, the state provided 58 cents in reimbursement, just 58 cents. That's in comparison to 62 cents provided to all the other hospitals across the state. This funding trend is unsustainable and hinders access to care for children and families. I've submitted detailed written testimony which speaks to our financials, but today I want to yield the remainder of my time to someone who represents why we're all here today, to support families. I'm so grateful that Farah and Barry and their family are here to share their story. Farah and Barry's daughter, Amira, was born at just 25 weeks, weighing under 2 pounds. But because of her tenacious spirit and Connecticut Children's team of pediatric experts, Amira, as you can see, has grown into an adorable and rambunctious 1-year-old. I'll now turn it over to Barry.
Good day. My name is Barrington Blake. This is my family. Farrah Blake, my cousin, Amira Blake. I'm a resident of Hartford, Connecticut, and I thank you for this opportunity to testify today. Our daughter, Amira Blessing, was due April 2024, but she came in the world 15 weeks earlier, weighing about under 2 pounds, like the doctor said, and it was crazy. She spent 5 months at Connecticut Children's Hospital, undergoing some of the best care possible, and I really appreciate you guys. Thank you very much. And she came home on a nasal cannula with oxygen with less than a liter, which she's doing real good right now. As you can see, she's actually a real testimony to what Connecticut Children's Hospital has provided for us, me and my family, and everybody else. And I'm kind of nervous. I'm sorry about that. But yeah, she underwent a lot of treatment here at Connecticut Children's Hospital for respiratory, bronchiology, dysplasia, both dealing with her lungs issues, as well as PDA, which is a patent ductus arterius closure for our heart. Our blessing is home now, which we're grateful and thankful. She's doing real good. She's off oxygen at the moment, and 90% of her medications she don't even take anymore. So that's something real good. Um, Amira still sees her specialist every week. She have a nurse that come to the house. We have Bertha 3 that comes to help with her development as well. And as you can see, she's growing well, doing real well, and really appreciate what you guys have been doing for us. Um, okay. Okay, the level of care our daughter received was exceptional. The medical team and all the staff at Connecticut Children's are incomparable. They extended selfless and compassionate care to our princess and was a tower of strength to me and my family during this journey. I remember especially when me and my wife caught COVID-19, we were unable to visit the NICU per protocol as to protect all children and families and staff. They ensured that we were kept abreast about Amira's health status, even when to the extreme length of sending notes and pictures on behalf of our family to let us know that she's doing well. For this, amongst many things, me and my wife and I are extremely and very grateful and thankful for the services rendered to our miracle girl by Connecticut Children's.
Thank you so much for being here today, and congratulations on your beautiful family. I'm glad you're all healthy.
Thank you very much.
Thank you.
Next, we will hear from Andrea Calderon.
Good afternoon, esteemed members of the Appropriations Committee. Thank you for the opportunity to testify on HB 6864 and that concerning the state budget, specifically regarding the funding to support the expansion of access to Husky health regardless of immigration status. My name is Andrea Calderon, and I am a graduate student at the University of Connecticut School of Social Work. I am here today not just as an advocate or student, but also as the daughter of an immigrant family who has witnessed the challenges of an undocumented adult navigating the healthcare system without health insurance. In 2020, my loved one started experiencing chronic pain in her lower back and leg that kept her up all night and could barely walk. After struggling to find a healthcare provider, she was seen by Malta House of Care, an organization that provides primary care to uninsured patients, and was referred to San Francisco, where she was diagnosed with a spinal tumor that required surgery. With no health insurance, the surgery would cost $80,000 out of pocket, not including the cost of anesthesia. This led to another roadblock for her, finding and receiving financial assistance to cover the surgery. As we know, undocumented adults are disproportionately uninsured in comparison to their citizen counterparts and will delay medical services due to cost, language, and cultural barriers. They are more likely to use emergency services for conditions that could have been treated in primary care visits, which contributes to the growing cost of our healthcare system. Undocumented adults contributed $400 million to state and federal taxes in Connecticut in 2022, but yet they do not qualify for certain public benefits like health insurance. My loved one was lucky enough to have been approved for financial assistance and was able to have this life-saving surgery completely covered after some battles. For hospitals, it may not be financially feasible to provide charity care for every undocumented adult who otherwise would qualify for Husky Health if it were not for their immigration status. Research has shown that Connecticut hospitals could save anywhere between $63 million to $72 million on uncompensated care and reduce costs in the emergency Medicaid coverage program. Access to Husky for undocumented children has been a step in the right direction to prevent and treat costly lifelong medical conditions and address health disparities. But healthcare needs do not stop at age 18. I am here today to ask the committee to sustain funding for coverage for children regardless of immigration status and to allocate the necessary funding to expand Husky health up to age 26 and eventually beyond to address the health needs of undocumented communities. Thank you.
Well done, Andrea. Thank you for being here today. Thank you for your testimony. Next, we have a panel. We have Nelly Jara, Carmen Sanchez, and Catherine Valeda. Welcome. You all have 3 minutes total. Right?
3 minutes.
1 minute. No, no. Oh, I thought that was like, wow. 2. Go for it.
Good afternoon, Senator Lesser, Representative Gilchrist, Representative Walker, and esteemed members of the Appropriations Human Services Subcommittee. My name is Catherine Villeda, and I'm the new Coalition Director for the Husky for Immigrants campaign. I'm joined here today by 2 of our leaders, Nellie and Carmen, who will speak briefly. Husky for Immigrants is a statewide coalition of over 40 organizations advocating for equitable access to Husky health for all income-eligible residents, regardless of their immigration status. Over the years, our efforts have led to over 15,000 Connecticut residents acquiring health coverage that they would have otherwise been systematically and unjustly excluded from getting. As we have heard many of our members speak today, we are before you today in light of these achievements and current federal threats to urge the committee to protect the progress we have made thus far and to supplement these achievements by further expanding Husky eligibility to income-eligible Connecticut residents regardless of their immigration status up to the age of 26, to strengthen data protections for existing programs, and in strong support of increasing Medicaid reimbursement rates. We recognize that the fight for health justice is not siloed, and that protecting current Husky programs and improvements in Husky rates will facilitate better access to care, sustain the program for all Husky members, and better position us to advance health equity. Before I pass it over to Nellie and Carmen, I do want to take a moment to extend our appreciation to Governor Lamont, the legislature, and DSS for their support to implement, sustain, and grow the existing programs we have. We cannot underestimate the impact these programs have had on our communities, and we look forward to working with you all and our partners in pursuit of achieving health justice by protecting immigrant families and all Husky members.
Thank you, Senator Lesser, Senator Gisbert, and Representative Walker. Thank you for the opportunity. My name is Nelly Jara, and I live in Bridgeport, Connecticut. I am the Executive Director of Connecticut Worker Center, and I am part of Husky for Immigrants, Connecticut for All Coalition, and Domestic Worker Justice Coalition in Connecticut. Thank you for the opportunity to testify on HB 6864 in the Human Service Budget. I am in favor of increasing Husky funding. I am a cancer survivor. My 27 years of fighting with this illness give me the opportunity to be here to advocate for others in my community who have been denied access to certain treatments due to the medical condition. Every week in my workplace, we hear from family members the challenge they are facing and receiving some medical assistance or having difficulty to see a doctor. Some of our members, especially our domestic workers in Connecticut, they are denied of this health assistance. They are isolated, and this is the moment for all of you senators and representatives to support our people. I asked the Appropriation Committee to support this fund, to support this bill, and also I want to congratulate because every year you put effort and trying to, support our community, and I am sure that you're gonna continue doing. And sometimes it's hard for me to see members that are not here anymore. I kept good memories on my heart, but I'm here every year advocating for my community, for the good work you're doing, and thank you so much.
Estimados miembros del Comité de Apropiaciones de la Asamblea General, me llamo Carmen Lanche. Estimados miembros del Comité de Apropiaciones de la Asamblea General de Connecticut, mi nombre es Carmen Lanche, soy la directora de la organización Comunidades Sin Fronteras en la ciudad de Norwalk y también somos miembros de la Coalición de Trabajadoras del Hogar y Connecticut para Todos. En mi rol como directora de la organización, he visto cómo el vivir sin cuidado médico afecta a las familias. He visto a nuestra comunidad sufrir por no tener acceso médico para sus hijos y demás familiares. Dentro de nuestros clientes se ha vivido el temor, incertidumbre, ansiedad, pánico por estar enfermo, porque no cuentan con un seguro médico que los proteja y les dé la libertad a sus familias en recuperar su salud. Viven bajo la presión de pagar una factura de miles de dólares y van a la sala de espera de emergencia a atenderse. Y muchas veces asisten a clínicas comunitarias, pero luego de referirlos a un especialista, tienen que esperar de 6 meses a 1 año en una larga lista de espera. También tenemos a la salud mental. Las clínicas de salud mental están retrasados con largos turnos de espera para poder dar consultas a nuevos pacientes que no tienen seguro médico. Los inmigrantes, si tuvieran un seguro médico, estas situaciones podrían cambiar y ser de beneficio para su salud. Connecticut es un estado de los más ricos del país y más rico del mundo, con un presupuesto que actualmente tiene un superávit. Nuestras políticas estatales deberían priorizar el fortalecimiento de la red de seguridad para las personas que más lo necesitan, de modo que nuestro estado pueda volverse más equitativo y todos los residentes de Connecticut tengan la oportunidad de prosperar. La expansión de Husky a todos los inmigrantes que reúnen los requisitos de ingresos, independientemente de su estatus o edad, es una política clave para promover la equidad y la salud pública en nuestro estado. Los obstáculos con los que las personas sin seguro médico se enfrentan implican una menor probabilidad de recibir atención preventiva y una mayor probabilidad de ser hospitalizadas por afecciones que podrían haberse evitado y una mayor probabilidad de morir en el hospital que aquellas personas que tienen un seguro médico.
Thank you so much for your testimony. Thank you all so much for being here today.
Good afternoon. My name is Carmen Blanchet, and dear members of the Appropriations Committee of the Connecticut General Assembly, my name is Carmen Blanchet. I am the director of the organization Comunidades Sin Fronteras in Connecticut. I live in the city of Norwalk. Thank you for the opportunity to testify on HB 6864 for the Human Services budget. In my role as a director of the organization, I have seen how living without health care affects families. I have seen our community suffer from not having medical access for their children and other family members. Among our clients, they have lived with fear, uncertainty, anxiety, panic, and being sick because they do not have the medical insurance that protects them and gives their families the freedom to recover their health. They live under the pressure of paying a bill of thousands of dollars if they go to the emergency room for treatment. And many times they attend community clinics, but after being referred to specialists, they have to wait up to 6 months to a year on a long waiting list. Mental health clinics are also delayed with long waiting shifts to be able to provide consultations to new patients who do not have medical insurance. Immigrants, if they had medical insurance, this situation could change and be beneficial for their health. Connecticut is one of the richest states in the richest country in the world, with a budget that is currently in surplus. Our state policy should prioritize strengthening the safety net for the people who need it the most, so our state can become more equitable and all Connecticut residents have the opportunity to thrive. Thank you.
Thank you. Thank you very much. Nadine Padowitz. Nadine with us. No. Okay. Richard Fishman. I see him online. Richard, go right ahead. You just have to unmute. Your hand is raised. I don't. Hi, Richard. Richard, can you try speaking? All right, we will come back. Richard, can you log off and log on, please? Is Brittany Sanchez with us?
Hi, yes, I'm here.
Okay, go right ahead.
Good afternoon, Senator Austin, Representative Walker, Senator Somers, Representative Nuccio, and members of the Appropriation Committee. My name is Brittany Sanchez, and I have the privilege of serving as the Senior Director of School-Based Health Centers, Behavioral Health, and Outpatient Services at Child and Family Agency of Southeastern Connecticut and New London. Thank you for the opportunity to testify on HB 6864, the governor's budget. I've worked in mental health field for nearly 15 years, starting in a group home where I saw firsthand how critical access to quality evidence-based care is for our vulnerable children and families. I've worked in Illinois, Massachusetts, and now my home state of Connecticut, and I can tell you firsthand the crisis in community mental health has never been worse. It takes a village to raise a child, and right now we need to rely on the village more than ever. But when that village, non-for-profit mental health agencies like mine is underfunded and struggles to survive, children and families are left with nowhere to turn. I want you to take a moment and think about a time when you or your child were in need, when there was one window of opportunity to accept help, to trust a provider, to take that first step towards healing. Now imagine that window closing before the clinician sitting across from you is burned out, suffering from compassion fatigue, overwhelmed by a system that does not value or support them. It feels horrible to not be able to provide the level of care we know our clients deserve, but that is the reality of non-for-profit clinicians right across Connecticut. Low Medicaid reimbursement rates are driving clinicians out of non-for-profit work. The only way any of us, including clinical leaders, can afford to stay in this field is by taking on private practice jobs just to make ends meet. We are burning out at this unsustainable rate. Because of this, we cannot compete with hospitals, private practices, and schools for qualified clinicians. We lose staff who want to stay but simply cannot afford it. Children and families struggle to access quality care from clinicians trained in evidence-based practices because there is not enough providers to meet that overwhelming need. This is not just a staffing issue, it's a public health crisis. When a child is in severe distress, cannot access a trained evidence-based clinician, they don't stop suffering. Instead, their condition worsens until they end up in an ER, scared alone, and waiting for a provider that they will never get to see again. This is the reality of Connecticut right now. We need higher Medicaid reimbursement rates, hire and retain clinicians who are committed to this work, reduce burnout so that staff can focus on providing quality evidence-based care, ensure the next generation of clinicians can afford to stay in non-for-profit. Without action, more children and family will go without critical mental health support, more clinicians will leave, and non-for-profit mental health agencies will struggle to survive. We cannot afford to wait any longer. Please support increasing funding for community non-for-profits by $264 million, including increasing Medicaid rates for behavioral health services. Thank you for the opportunity to testify.
Thank you so much, Brittany. Thank you for your testimony. Richard, we're going to go back to you. Are you with us? I saw you for a second. All right, we're going to keep going, Richard. Adrian Benjamin. Hello.
Good afternoon. I'm Adrienne Benjamin, and it's wonderful to be here with such strong allies and dedicated representatives for our most vulnerable people in the state. I'm here representing the Profound Autism Alliance and my daughter Zoe, who's 28. She also has profound autism. She receives services both day and residential from HARC, and I'm very grateful for that. She's totally nonverbal, is very active, but has no safety awareness. She needs guardrails, and let me tell you about her guardrails. Human guardrails. The direct support professionals who work with her are her human guardrails. They cut up her meat so she doesn't choke. They make sure her bath water isn't too hot. They prevent her from running in the street, which she does unfortunately like to do, and they make sure she gets her seizure medication on time. Does that sound like a minimum wage job? Nope, we know that. Yet these professionals make only $1 more than minimum wage workers. At last week's appropriation hearing, Commissioner Sheff stated that the staffing shortage is critical, worse than it's been. And I think there were about 10 or 12 CEOs from the different agencies that provide this work that stated the same. They can't find the staff to work for $17.25 an hour, $17.65, whatever it is. And just for context, there's empty group homes, but 100 people on the emergency waiting list waiting for resources like that. They're waiting because there's not enough staff to take care of people with severe needs. There's 700 people on what's called the urgent list. What are we going to do? So it seems I'm about to give the same speech I've been giving for years. The governor's budget is inadequate to meet the needs of those served by DDS, especially those with autism and ID. The rates are too low to get for the agencies to raise the wages of their staff. So those direct support professionals, I call them the human guardrails. And I know there's a lot of talk about fiscal guardrails, and I know we have to be responsible, blah, blah, blah. But I've been sitting here for hours, and I sat here for hours last Friday talking to appropriations, hearing about these incredibly important needs of vulnerable people, whether it's the mental health crisis, the addiction crises, the people sitting here behind me who are fighting for health insurance. Why are we fighting? Are we fighting each other for the same little piece of the pie? It's just really hard. I'm typically an optimistic person, but it's getting harder. Year after year, again and again. Our community advocates, we demonstrate, we write letters, we write op-eds, and here we are with not much things not getting much better. If there's something you want to tell me to do that we're not doing, I will listen, I will try, I will bring my daughter places where make people really uncomfortable so that they can see what her needs are. Thank you so much. And I know I'm speaking to my allies, so thank you.
Well, thank you, and it does make a difference, so thank you for being here. I see his hand up. Richard, let's try you again.
You can't stay until 4 tonight.
Okay, we're gonna move on. Patricia Reamer. You online? Yes. Patricia, yep, go right ahead.
Thank you. Good afternoon, Representative Gilchrist, Representative Walker, and other esteemed members of the Subcommittee for Appropriations looking at the state budget. My name is Pat Reamer. I'm the Vice Chair of the Board for Root Center for Recovery. And as some of you may remember, I'm a former commissioner of the Department of Mental Health and Addiction Services. Thank you for the opportunity to offer testimony regarding the need to fund room and board in Medicaid for new substance use disability residential providers. The Root Center is a large provider of methadone maintenance and the oldest in the state. They have approximately 265 employees in 13 locations across the state where they offer opportunities for treatment and recovery for individuals they work with. As we know, the epidemic continues. Things have not changed about this, and it continues to impact residential providers across the state. There is a reason we need to have treatment options for individuals who are struggling and need this level of treatment. And it needs to be readily available. As you've heard from previous people that testimonied, in the moment that somebody is ready to go for treatment, if the bed is not available, there is a very high chance that we will lose them back into the drug that they may have been using. And the Root Center is establishing its first residential site, excuse me, in New Britain to serve patients and others across the state. This site is now ready for treatment, and I'd encourage anybody that's interested to take a tour anytime. It is a residential site, very unlike others that I have seen. It's ready, albeit waiting for licensure, but unfortunately, the lack of room and board payment is still an issue. This funding is needed to ensure that providers of residential substance use disorder treatment are properly reimbursed for room and board. The current DSS budget under the SUD waiver only funds current residential treatment beds. The current policy of not funding residential treatment for individuals that need it does not seem to be consistent with Connecticut's desire to decrease the damage created by the abuse of opioid medications. And I would also remind you that alcohol is still a substance that is highly abused and causes many, many deaths. While I haven't worked in the system for a couple of years, I stay engaged with this mission-focused work. I would say that the Root Center provides the environments for treatment unlike any that I've ever seen. they are able to build beautiful sites and offer treatment that is really respectful and recovery oriented. We believe all people should have choices about the care they receive. And many clients have found these level of beds to be incredibly useful in their journey to recovery. We urge the committee to pass the bill to fund room and board for Medicare recipients. Thank you very much for your attention to this matter.
Thank you. Thank you, Pat, and great to see you again. Thank you.
Nice to see you too.
Eric Cruz?
Somebody left their glasses over here.
Oh, somebody leave their glasses?
They've been there.
Oh, okay.
Oh, I'd see.
Oh.
They're part of the desk.
Sad,
I
we've been here.
appreciate the decor up here. Thank you. Hello, my name is Eric Cruz Lopez. I'm a member organizer with Connecticut Students for a Dream, an organization that builds power and fights for immigrants here in Connecticut. Thank you for your opportunity to testify on HB 6864, an act relating to the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. I also support increasing Medicaid reimbursement rates so that current Husky recipients can have better access to care. I want to start by highlighting that the young people that you have heard testify today on camera are testifying from their school. They have stepped out from their classes, found a room in Wilbur Cross High School and in Danbury High School to let the committee know the need for the increased funding for Husky, not only for immigrants, but also for Medicaid reimbursement rates. Because they understand the issue and they understand that that matters not just for them, some of whom might have health insurance, but also for their siblings because some of them are in mixed status families. And they will continue to testify in class. They will continue to testify when they're at work. They will continue to testify when they're at watch parties where like 20 or 30 of them are gathering in New Haven and Danbury because they understand the need that they have and see in their communities. In the current climate that is working overtime to push immigrants into the shadow, young people and young immigrants will continue to play their historical role of stepping into their power and overcoming their fears to build power and win campaigns that change the material conditions of immigrants. I can share hundreds of stories of our members, of their families, of our communities, of myself and my own family that highlight the need for more Husky funding. But I will leave that to our members who are firm in their stance, who are strong in their power, and who are clear in their messaging of young people ages 14 to 25 who will continue beyond this hearing to keep working towards better support from Connecticut and to build a better Connecticut, not just for immigrants, but for all of young people in Connecticut. Thank you.
Thank you for your testimony this afternoon. Next, we have Matt Barrett.
Good afternoon, Representative Walker and Senator Lesser, and to the distinguished members of the Appropriations Committee. My name is Matt Barrett, and I'm President and CEO of the Connecticut Association of Healthcare Facilities and the Connecticut Center for Assisted Living. And I appreciate the opportunity to testify this afternoon. As the committee carefully evaluates the needs of all of our state's constituencies and communities in the budget, we once more ask that you consider the needs of our skilled nursing facilities in your deliberations this year. Unfortunately, the governor's two-year budget recommendation now before the Appropriations Committee continues the decades-long policy of eliminating skilled nursing facility statutory increases in the rates. For SFY 26 and SFY 27, when including the state and federal share, the overall reduction in this item amounts to $111.4 million. And I included the excerpt from those provisions, that budget detail in our testimony. And corresponding to that, there's also statutory implementation language related to this inflationary reduction included in Senate Bill 1251, an act implementing the governor's recommendation for health and human services, which is legislation introduced at his request. And that's before the Human Services Committee. And I understand that Senator Lesser has scheduled a hearing on that over the next week or so. And so we'll have the opportunity to also testify correspondingly in opposition to that provision, but also to recommend substitute language to provide for the inflationary increase, which I've also included in my testimony here. I've submitted a written version of our testimony, so if I could just briefly summarize by saying, providing these inflationary increases at this time is critically important to Connecticut skilled nursing facilities. Rates have not been adjusted for inflation since 2022. Therefore, the inflation adjustment, if it's adopted, it will be at least 5 years before inflation has been included in the rates, and which are now based on 2019 costs. Medicaid providers from across the system are losing ground year after year because of these policies that do not adjust for inflation. 50 nursing homes have closed since 2021, signaling that an ongoing Medicaid investment in facility operations and infrastructure is needed. The Medicaid budget hasn't addressed employee wages and benefits since 2021. And once more, thank you so much for this opportunity to testify.
Thank you for your testimony. Next, we have Cynthia Johnson. We are going to go to Richard, actually is
After.
oh, after, yeah, so after Cynthia Johnson, we'll try to go back to Richard Fishman.
I just want to say something. Fun fact, I haven't had one person testify that they love the budget yet.
Good afternoon. That is not going to start with me either. I'm Chair Austin and Walker and Subcommittee Chair Leaders, Lesser and Chilgress. I hope I said the names right. And all the members of the Appropriations Subcommittee on Human Services. My name is Cynthia Johnson. I live in New Haven, Connecticut, and I'm a personal care attendant to my own daughter. I'm here before you today as a mother and a caregiver. At the tender age of 6, my daughter began having grand mal seizures. And as you can imagine, this was a very scary thing for our family. Her seizures have developed into a very rare condition where they change up. She's had 6 different types of severe seizures since then. In 2014, the seizures changed to drop seizures. And in the middle of Dixville Avenue, she had a drop seizure that broke her jaw in 3 places. And the impact of it was so severe, her teeth released from her gum. They didn't break, they just came out. And since then, my daughter has been suffering with PTSD, vertigo, and other issues. Even though she was here to go to college and to become a fashion designer, she has now changed that to become a veterinarian. She loves pets. Pets love her, and she's fighting. This past winter, she also got pneumonia, had 4 seizures in 2 weeks. She's a fighter. I want to make sure that she understands that she's not going through this alone. But when services and funding is cut and slashed, people that are going through things like this, their services are also cut and slashed. I'm here before you today to ask what happens to us, the ones that are taking care of them, and the ones that we are taking care of. These services are so crucial because these people are trying to live independently. They're trying to take care of themselves. They're trying to survive. And we are trying to help them. We are their support system. We are their lifeline. And we can't do it without the funding as well. Please support the PCAs like me that are coming behind me, that are going to give their testimony as well, because this work is so crucial to survival, not just mentally, but spiritually, and for future. They're not all older people. Some of them are younger. My daughter is only 37, and she's going through this, and she's fighting to be productive citizens. Thank you for this opportunity, and thank you for listening.
thank you for being here and for telling your daughter's story. Thank you. Next, we're going to try to go back to Richard Fitchman and then Judy Stein.
Can you hear me?
Yes, we can.
Great. All right. Thank you. Good afternoon, everyone. I'm Richard Fitchman. I'm an ophthalmologist. I've practiced for over 4 decades in central Connecticut. By way of background, 6 generations of my family have lived in Connecticut. I was chief of ophthalmology at 2 hospitals in New York City, an associate professor at Downstate University, where the chairman of ophthalmology held out the possibility of me succeeding him, but I chose instead to return to my roots and begin a practice in Connecticut. I became chief of ophthalmology at the Newington VA Hospital. I relished the opportunity to help those who had given so very much to our country. And from my first day in practice, I accepted Medicaid. I treated thousands upon thousands of Medicaid recipients over the years, and I personally felt a great deal of pride knowing that these patients, regardless of their economic status, would receive the exact same level of care as everyone else. I believe that our society will be judged by how we treat our most vulnerable citizens, and Medicaid is a tremendous blessing to all of us. My grandmother immigrated to this country at 16 years old. As a relatively young woman, she was diagnosed with an aggressive form of breast cancer. The family was indigent. Medicaid didn't exist, but she was treated at Mass General Hospital at no cost, a charity case. Without that help, she would not have survived, but she did, in fact, live for another 50 years. And during those 50 years, she told me multiple times to constantly make sure that I helped those in need despite her poverty. And in a nutshell, that's why I became a doctor. Running a busy practice for decades, financial prudence was very important to me. Inflation is very real. So I fully understand that you as legislators need to be fiscally prudent. For more than 2 decades, though, Connecticut has not increased Medicaid reimbursement to physicians despite hefty inflation. A recent study confirmed that Connecticut pays well below its peer states for most services, and I read a study about 2 months ago listing the most desirable and least desirable places for new physicians to practice, and Connecticut was number 4 on that list at the bottom. So there is a cost to be paid for that. And as I worked very hard to recruit physicians, it became harder and harder, and this is one of the reasons. And unfortunately, when patients lack access, they delay care, which ultimately leads to higher health costs. The bill before you today only partially begins to address this health care crisis, allocating just $60 million over the next 3 years. House and Senate leadership instead offered a plan to invest several $100 million over the next 4 years to address Medicare rates. This is a very important step that will begin the process of strengthening our healthcare safety net. I cannot express to you the incredible pride I've had in my country and state for the ability to help those that truly need it. It's been one of the greatest blessings in my life. For that reason, and all the others I've mentioned, I urge your support for increasing Medicaid rates for physicians in Connecticut. Thank you for your kind attention.
For your testimony this afternoon. Next, we have Judy Stein.
Mr. Chair, Judy contacted us. She is running a little behind, so she will be joining us when she can.
Okay. Annalee Reed.
Hello, can you hear me?
We can.
Okay, wonderful. My name is Annalee Reed, and I am the administrator of All Point Home Care. Thank you for the opportunity to testify today on critical issues of Medicaid reimbursement rates for home care services in Connecticut. This is not my first time sitting before you pleading for an increase in home care services rates so that we are better aligned with the increased cost of living and are able to attract nurses to support the vast needs of our patients. At All Point Home Care, we specialize in providing home care services to some of the state's most medically complex individuals. Our patients include those with tracheostomies, ventilators, and complex feeding needs, such as gastrostomy and nasogastric tubes. We also care for fragile diabetics and behavioral health patients who require regular home visits for medication management. Individuals who, without consistent and skilled home care, face significant risks of decompensation, leading to severe complications and preventable hospitalizations. Despite the essential nature of these services, Connecticut continues to have the lowest Medicaid reimbursement rates in the tri-state area. This disparity has created a significant barrier for agencies like ours to compete with hospitals and other healthcare providers who can offer wages that are $10 or more per hour higher than we can pay. Even with the recent ARPA funding increases in continuous care nursing rates, the adjustments have been insufficient to attract and retain highly skilled nurses needed to care for our complex patient population. Due to this disparity, All Point Home Care is only able to staff approximately 55 to 60% of the authorized hours for nursing. This chronic understaffing directly impacts patient care, leading to gaps in coverage that have already resulted in unnecessary hospitalizations, outcomes that are not only detrimental to patient health, but also drive up healthcare costs. We are at a critical juncture. Without a meaningful adjustment to Medicaid reimbursement rates, access to home and community-based care will continue to erode, placing vulnerable individuals at greater risk and straining our already overburdened healthcare system. Therefore, we respectfully urge the committee to approve a 10% increase in Medicaid rates for all visit codes. This adjustment will help ensure that home care agencies can offer competitive wages, attract and retain skilled nursing staff, and provide consistent, high-quality care to Connecticut's most vulnerable residents. Increasing Medicaid rates is not just an investment in home care agencies, it is an investment in the health, safety, and dignity of our community members who rely on essential services to live safely at home. Thank you for your time, attention, and commitment to the health and well-being of Connecticut residents.
Thank you for your testimony. Next, we have Donna Garcia, followed by Susan Schnitzer. Susan? Susan's here. Okay. After Susan, we'll go to Amanda Skinner.
Good afternoon, Representative Walker and Senator Lesser. My name is Susan Schnitzer. I'm the president and CEO of the Connecticut Institute for Refugees and Immigrants. I'm here advocating on the behalf of our organization and also Jewish Family Services of Greenwich and IRIS, which has their primary office in New Haven. The three of us together are the three main primary refugee services agencies here in Connecticut. And we're here advocating for an increase to the Welcome Fund from $1 million to $3,050,000. How we came up with that figure, and it is in my testimony, currently that 3 million plus is what we have in the state budget in 3 different streams of funding. We are asking for that to be put into one stream of funding. I wanted to talk a little bit about, I'm not going to read my testimony, I'll be quick, what that money does for our agencies. So with those funds, we were able to provide services, help people get employment, help children and young adults really thrive in schools, connect people with vital healthcare services, and help out with housing and teach English to folks. And what these services do is really prepares our families and our individuals for the rest of their lives here in Connecticut or whether they move to other places in the US. We always look at it, it's not a hand out, it's a hand up. It's someone to walk alongside them, really teach them how to navigate how life is here in the United States, how life is here in Connecticut, so that they can thrive and their children can thrive. And they can continue to be part of our communities. We know that immigrants are over 19% of the workforce here in Connecticut. And in my testimony, there's numbers which I'm sure you've heard about the positive economic impact of having refugees and immigrants, as we have throughout centuries here in Connecticut and in our country. I did want to leave you with a couple of short stories that I'm not going to do justice to, but just how services have really helped individuals. So we have a young woman who we actually honored at our gala this year. And she's 20, for 20 years, she lived in a refugee camp, growing up in that refugee camp. She's one of 5 children, and her parents made education a priority for them. They came here about 8 years ago, and between then and now, she has received her undergraduate degree. She is now teaching honors physics and math in Bridgeport Public High Schools. Also, her success is really inspiring her siblings and her cousins to do the same. We have another gentleman. Thank you.
Thank you for your testimony and thank you for your work. Next, Amanda Skinner, followed by Dr. Dante Brittis.
Thank you, Senator Lesser, Senator Ostin, Representative Walker, and honorable members of the Appropriation Committees. My name is Amanda Skinner. I'm President and CEO at Planned Parenthood of Southern New England, testifying regarding the DSS budget of HB 6864. As the state's largest provider of sexual and reproductive health care to almost 50,000 patients in our last fiscal year at 14 health centers across the state, Planned Parenthood believes that all people should have access to quality, affordable health care as a basic human right. We are compelled to speak out about the importance of the Medicaid program to our patients, nearly half of whom are enrolled in the Husky Health program, and the urgency of investing in reproductive health care providers at family planning clinics in our state. We thank this committee and Governor Lamont for your strategic investments in women's health care and family planning, including supporting an increase in the Social Services Block Grant allocation to PPS&E earlier this year and an additional $800,000 in funding through our DPH grant. While the modest Medicaid reimbursement increases included in Governor Lamont's proposed budget are a step in the right direction, greater investments from the state in our public health infrastructure are urgently needed to ensure that reproductive health care providers can continue providing care to the people who need us most. PPS&E is an indispensable and irreplaceable provider of family planning care in Connecticut. We are committed to health equity, serving all who need our services regardless of their insurance type or ability to pay. The majority of our patients are people of color, 46% have Husky Health as their insurance, and 26% are self-pay. Reproductive health care providers like us are often primary care providers for our patients, women of reproductive age, people of color, young people, and those who are uninsured, and people with low incomes. We are a safety net provider and reduce the burden on the broader public health care system in Connecticut, and yet we do not have the buffers that many other safety net providers have. And unlike private practices, we do not have the ability to offset low Medicaid rates due to our payer mix and our services mix, which is more than 90% preventive services. We are facing serious operational pressures that threaten our ability to continue meeting the needs of our patients and our communities. For PPS&E, across all payers, reimbursement for healthcare services covers only 51% of the cost of providing those services. We are running on a deficit and spending down our reserves. This is not sustainable and will have a negative impact on our patients and on the public health infrastructure in our state. The broader healthcare network in Connecticut is also not positioned to provide the services that we offer to our patients if our ability to provide care becomes constrained. We estimate an investment of approximately $3 million is necessary. This investment would underscore Connecticut's position among the other leader states who are firmly committed to ensuring that reproductive health care remains accessible for all who need it in this increasingly hostile political environment. Access to reproductive health care services remains vulnerable here in Connecticut. Increasing Medicaid reimbursement rates for family planning providers like PPS&E will strengthen patients' long-term access to time-sensitive, essential reproductive health care. We urge Governor Lamont, the legislature, and this committee to prioritize continuing your commitment to strengthening reproductive health care access by investing to ensure the sustainability of reproductive health care providers in our state. Planned Parenthood patients are counting on you. Thank you for your time and consideration.
Thank you for your testimony. Next, we have Dr. Dante Brittis, followed by Errol Miller.
Good afternoon. Senator Lesser, Senator Orston, Representative Walker, and I think Representative Gilchrist is here as well, esteemed members of the Appropriations Committee. My name is Dante Brittis. I'm a practicing orthopedic surgeon in Fairfield, president of the Connecticut Orthopedic Society. As a rep of the orthopedic docs in the state, I appreciate the opportunity to talk to you about HBG 864 and specifically the Medicaid portion of the budget. Medicaid funding has challenged our country and our state historically. As a society, we have deprioritized medical care of this vulnerable segment of our population. Connecticut Medicaid rates for surgeries and office visits are 40 to 60% lower than Medicare rates, the bottom. This reimbursement does not cover overhead costs for delivering patient care. While many physicians continue to provide care, it's not financially sustainable. Our failure to adequately fund creates a caste system with 30% of our population struggling to access mental health, primary medical care, and relevant to my organization, basic orthopedic care. After years of discussion, we appreciate commitment of Dr. Lamont and the legislative branch for reassessing physician reimbursement. As a reference, physician reimbursement has not been updated for 17 years. This is a generation. The current proposal of 20 million the first year, 50 the second is a step, but is a baby step. It does not come close to addressing. The antiquated reimbursement rates are not just reflected in the physician fee schedule. Rates for ambulatory surgical centers are outdated. In the case of orthopedic care, do not cover the implants necessary to perform basic surgical procedures. The unintended consequence of this is the procedures are shunted to the hospitals where they can cost 2 to 3 times more. To make my point, our surgical center affiliated with my practice performed a series of Medicaid surgeries over the last months. We evaluated the economics. This was done purely to illustrate to you, our reps, the folly of the current system. 25 cases were done. We followed the reimbursement from Medicaid on these, and we matched the costs of it. Every one of the cases was a double-digit loser across the board. No one came close to neutral cost. These same cases done in the hospital would cost 2 to 3 times as much the neutral cost. It's time for our prosperous state to commit to delivering appropriate care for our most needy citizens. The economic benefits will be realized quickly as emergent care becomes necessary from the current system will be reduced. Patients will have access to orthopedic care that will likely help their employment status and be productive members of our society. Beyond the economics, the system which improves access and care is a reflection of our humanity. Your next door neighbor will be better off. This is not partisan. We can no longer look in the mirror and accept a system where Connecticut fails to provide for the basic health care of greater than 30% of our population moving forward. We look forward to the appropriate economic support to move our agenda ahead. Thank you.
Thank you for your testimony. Next, we have Arlene Miller, followed by Jacqueline Pinney.
Good afternoon, senators, representatives, and honorable members of the Appropriation Committee. My name is Arlene Miller. I'm a resident of New Britain, a mother. A mother, and I work as a nurse consultant at the Department of Children's and Families, DCF, in the central office. I've been a nurse consultant at DCF for the past 18 years, but held the same role at DPH for 4 years prior. I've also been a state employee for the last 13 plus years. I am here to request that there be no cuts in funding to DCF and to ask that you increase the funding to our department in this year's budget, mainly because we're starting to see a significant issues tied to these cuts. My job with DCF is to perform the medical nursing licensure inspection for our 66 congregate care homes throughout the state of Connecticut, and investigate associated complaints and incidences, as well as making sure policies and procedures are being followed that keeps the program in compliance with state and federal laws. In addition, I also supervise and provide oversight for our statewide medication administration program throughout the state of Connecticut, which includes overseeing those approved for MedPass and dealing with medication errors. The staff shortage at our programs has led to significant increase in incidents of med errors in recent years. We are seeing a high turnover of nurses and med-certified staff employees in these programs, the people our children depend on for their medication. When you don't have properly trained staff or nurses on duty, the kids miss their doses. For some kids, this can be detrimental, especially those on psychiatric meds or with behavioral issues. That one missing dose can mean acting out, confusion, or may lead to hospitalization. We never want to see one of our kids hospitalized, but when we fail them because we don't have the necessary staff, it happens. We also struggle to hire and retain good staff. Because of the remote location of these programs, the group home setting are in communities, environments which are best suited for the care of the kids. However, our staff can't afford to live in some of these communities due to their low pay rates. They don't always have reliable vehicles either, and they depend on public transportation. These homes serve a fragile
Your 2 minutes have
population.
expired. Thank you so much for your testimony. Next, we have. I'm sorry. That next we have.
Good afternoon, Madam Co-Chair, Senator Lesser, and honorable members of the Appropriations Committee. My name is Jacqueline Pinney. I am a resident of Wethersfield, Connecticut, and the Executive Director of Independence Unlimited in Hartford, Connecticut, one of the state's 5 independent living centers. This year, centers have a small ask of an increase of funding by $1 million for the 5 centers, $200,000 per center. Centers for Independent Living empower and support people with disabilities to work, live, and thrive in their communities. In the last fiscal year alone, our center has helped 27 people gain employment, 33 people gain access to transportation in some form to get to work or in the community. 85 people were able to access and secure housing. We completed 7 home modification projects, and we assisted 12 people moving out of nursing homes with very limited funding. With an increase of funding, we could be doing so much more, and that was demonstrated by the increase we received as centers to provide the deaf service advocates. Currently, our center's deaf service advocate is working and has 56 active people on her caseload. But a big part of all my staff's job is to make things happen or make things work without the means. They are truly miracle workers. I ask today that you see our value, hear our voices, and continue to support us in our ask. Thank you.
Thank you for your testimony. Next, we have Rosanna Ferraro, followed by Dr. Lars Helgeson. Is Rosanna with us? Okay. Is Dr. Lars Helgeson here? No, Dr. Helgeson. Is Joe Pandolfo here? Is Marissa Osnianik?
Hello. Thank you for the opportunity to provide testimony today. My name is Dr. Marissa Oshanik, and I'm a clinical supervisor for United Community and Family Services, an affiliate site for the Child First program. Child First is an evidence-based early childhood mental health program that helps struggling families build strong, nurturing relationships that heal and protect young children from the devastating impact of trauma, adversity, and chronic stress. We do this by using a multi-generation, trauma-informed approach, providing psychotherapy to parents and children together in their homes and connecting them with services they need to make healthy child development possible. Child First affiliates receive state and federal funding from the Connecticut Office of Early Childhood and the Department of Children and Families. I'm grateful to the committee for the ongoing investment in Child First and ask for continued support to maintain the current funding levels. My site serves around 120 families per year across more than 40 towns throughout Eastern Connecticut. For the past 8 years, I've been a supervisor of the Child First program. Child First is something special and truly unlike any program out there. After completing my doctorate at NYU, I began my job search. I was immediately drawn to the Child First program's unique two-person team approach and focus on providing support to families of young children in their natural environment, the home. I did not come across any other programs in New York that provided the same wraparound, two-generational approach, and I thought to myself, Connecticut's really got a good thing going. I eventually moved to Connecticut and became a Child First supervisor. While supervising my teams, I regularly hear about short and long-term change that's happening within the families. For instance, caregivers who are now able to reflect on how their own struggles, like depression, can make interactions with their child more difficult. Child First emphasizes understanding both the child and the caregiver's trauma, believing that meaningful change occurs when the caregiver can feel supported enough to reflect on their own experiences. Parents voice that they've even felt supported and understood by their Child First team, sometimes when there's no other support system in their life. I have seen the firsthand impact of this program. To foster meaningful change, caregivers need opportunities to reflect on the experiences that influence their parenting beliefs and actions. I respectfully ask that you support the continued funding of Child First to ensure that families can continue to access these life-changing services. Thank you.
Thank you for your testimony. Next, we have Jonah Semwezi, followed by Joni Antico. Is Jonah with us? Great. Hi, Jonah.
Good morning. Good morning. Good afternoon, members of the Appropriations Committee. My name is Jonah Semwezi, and I'm 13 years old. I'm in 8th grade and attend Edgewood Magnet. I've been a part of Soul Youth for the past 9 years and currently serve as a leader in training. Unlike other organizations, Soul Youth is in my neighborhood, Westville Manor. Soul Youth is important to me because that's taught me everything from social skills to how to test the pH balance of water. Without Soul Youth, I would not have the confidence to even consider speaking here today. One of my favorite memories was looking for microorganisms under microscopes using samples from the local brook. I got to demonstrate to my peers how to use a microscope and share my love for science without being ridiculed or told I'm corny. Soul Youth inspires us to be curious, embrace change, step outside of our comfort zones, and to try new things. It's a safe place where my friends and I can be ourselves without worrying about being judged or held back. My sister's first job was at Soul Youth. There she learned to speak her mind, care for the environment, and to connect with others, even when it was tough. Now she's working full-time as a molecular and cellular biologist at Yale. Seeing her success makes me want to follow the same path, and I truly believe that journey starts with Soul Youth. Please support increasing funding for community nonprofits. Programs like Soul Youth make a real difference for kids like me, and we need your support to help keep them going. Later on, you'll hear from Soul Youth Executive Director Kendasi. Thank you for listening to my testimony and for this opportunity to share my story.
Thank you for your testimony. You did great. Next, Joni Antico, followed by Kuldip Bogal.
Hello.
Hello.
Good afternoon, distinguished members of the Appropriations Committee. Thank you for this opportunity to testify before you regarding skilled nursing facility funding in 26 and 27. My name is Joni Antico. I'm an RN, Director of Clinical Services for Wachusett Healthcare with 4 centers in Connecticut. Wachusett has been providing nursing home care in our communities for 9 years. Collectively, we have 380 beds across our nursing homes with a 90% occupancy rating. We have 405 employees that work at our facilities, and we are members of the Connecticut Association of Healthcare Facilities. I have been a clinician for over 30 years in long-term care and skilled nursing facilities, and I have noticed a great change in the acuity and the cost of care for our residents. Current funding makes this challenging. We have to do so much more with less. The public health emergency may be over, but we are still recovering. Even though the COVID-19 public health emergency is officially ended, I can say that our nursing homes, the residents we serve, and our employees continue to be challenged like no other time in our history of providing services in Connecticut. I feel every day we are getting closer to a point where we can say the pandemic is truly behind us. Ravaging inflation, severe staffing shortages, and hindering admissions, increased labor costs, and slowing nursing home recovery. Never before experienced inflation and the ongoing staffing crisis are the top issues that are not addressed in the budget recommendation. Inflation. We're losing ground and unable to keep up with inflation. Here are some examples of what is happening. The rising cost of utilities, food and wages, cost of supplies, durable medical equipment, medication cost. The proposed funding for nursing homes does not recognize what is happening with inflation, and we are asking you to recognize the real inflation that we are experiencing in the state budget. The staffing crisis with severe staffing shortages in our nursing homes that we have faced during the pandemic is not letting up. We continue to struggle with staffing, requiring to use agency or pay overtime to our employees to maintain staffing levels so that we can provide quality care to our residents. Our skilled nursing facilities need more resources to boost the pay of our extraordinary employees, but the proposed budget doesn't address this issue. Again, I have been a nurse for over 30 years, and the ever-changing landscape in healthcare and pressures to do more with less is at an all-time high. We need your help. The federal and state resources that were a lifeline to our community have all terminated. Now all of our operators and employees are losing ground against inflation. More funding is needed in the budget to address the persistent and ongoing inflation we are facing to help us with the soaring labor cost. Thank you. I'd be happy to answer any questions that you may have.
Thank you for your testimony. Next, we have Kuldeep Bogal, followed by Elizabeth Kanata.
Can you hear me?
Yes, we can.
Good afternoon, everyone. Honorable state senators, state representatives, and all committee members. Thank you for the opportunity to present testimony regarding the critical issue of funding for residential care homes in Connecticut within the Department of Social Services budget. My name is Dr. Kuldeep Bogal. I'm the operator and owner and administrator of High Chase LLC in Wellington. I'm here today to express my strong opposition for the government's proposed funding freeze for residential care homes, yet again, while urging legislature to ensure that all homes receive an increase in their rates, particularly to address the inflationary costs we continue to face. As the owner and administrator of High Chase LLC, a 36-bed facility, I can attest to the ongoing financial strain caused by frozen rates and escalating operational costs. Despite our best efforts to reduce costs over the years, we are no longer able to sustain these cuts. Our rates have remained largely stagnant for over a decade, and although there have been minimal increases in recent years, they have not kept pace with rising expenses. I would like to highlight several areas where lack of sufficient funds is impacting in our particular facility to provide quality care for residents. Employee wages. The wages we can offer our employees are barely above Connecticut's minimum wage, leading to high turnover and lack of consistency in care for our residents. Each time we hire a new employee, we incur a cost of $106 for background checks and fingerprinting, a process we have been paying for our own pocket without any reimbursement. Investing in better trained, more stable employees will not only improve outcomes for our residents, but also result in long-term savings for the state. Medication. Residential care homes are required to have med-certified staff on every shift to administer medications, which demands significant training. However, many of our employees are housekeepers with limited educational backgrounds, and we are unable to pay them at a rate that incentivizes them to complete the required training. Nurses who typically administer medication in nursing homes and hospitals earn significantly more, and this discrepancy is leading to shortage of staff willing to take on this responsibility of administering medication. By allowing our in-house staff to manage medications, we saved the state substantial funds in the past by reducing unnecessary hospital visits and law enforcement intervention. Getting nurses to come and do the medication in homes is very costly. And I know that from experience. If you have to get nurses into our home right now, we're talking about millions of dollars. Employee benefits. Historically, HICHES has provided comprehensive medical and dental coverage for all employees. This is to intensify them.
Thank you for your testimony. Next, we have Elizabeth, followed by Jennifer Passion Blocker. And I know there are lots of folks who have important things to communicate to us. We do have 250 more people who are signed up to testify, and we are trying to get through everyone. So we will listen to you, and we'll also read your written testimony. Thank you. Please push the button again.
Good afternoon, respected Chair and members of the Appropriations Committee. Thank you for the opportunity to provide testimony on House Bill 6864. My name is Dr. Elizabeth Kanata, and the perspective I bring to this testimony is as a licensed psychologist of over 30 years with expertise in the area of child and family intervention and support, and as the Vice President of Community-Based Family Services at Wheeler, where I oversee many programs that are designed to strengthen and support the health and well-being of children and young adults and families in Connecticut. I also bring the perspective from my roles as an appointed member of many state advisory boards and councils and of other work groups across the child and family serving system, including serving as a tri-chair of the Connecticut Children's Behavioral Health Plan Implementation Advisory Board. And in my written testimony, I provided a link to our annual report. Wheeler is a community behavioral health provider and a federally qualified health center with a broad continuum of community-based services. Approximately 70% of our patients are on the state's Medicaid program. Wheeler serves over 70,000 children, families, and adults across Connecticut annually. In my role, I oversee programs for families that depend on grant funding and/or insurance reimbursement for services. In my job and in the advocacy work that I do, one of the greatest challenges right now is the workforce crisis. At a time where the level of distress for young people and for families continues to rise and the need for effective services at every level of care is increasing, we are plagued by an inadequate workforce to meet those needs. While Connecticut has been the envy of many other states for our robust array of evidence-based effective treatments to meet diverse needs of youth and families, service capacity in those programs is being impacted by difficulty hiring and retaining staff in the programs where we need them most. As someone who has dedicated my career to partnering with families, providers, state agencies, researchers, and higher education to shape our system, and as someone who has witnessed the tremendous gains and positive outcomes for children when we have dedicated the resources to an excellent system of care, I urge you to take action now to not let that system erode further. I join the other Connecticut nonprofit providers to request that you increase funding for our vital programs by $264 million in fiscal year 26, including a 6% COLA for state grants, increasing Medicaid rates, and annualizing the full amount of ARPA funding from FY25. In addition, we ask that you provide an 8% COLA in fiscal year 27. We have data that demonstrates the impact of high-quality programs to strengthen families, promote emotional stability for children, reduce the multi-generational impact of trauma, reduce recidivism, and enhance outcomes for well-being, all which arguably also have long-term positive budgetary impact for the state. Thank you for your consideration and your hard work on behalf of our Connecticut residents.
Thank you. Next, perfect timing. Next, we have Jennifer Passion Blocker, followed by Lindsay Fresher.
Do I press the button? Or is that
No,
already
you're
on?
good. Just
Okay.
keep talking.
Good afternoon, Senator Austin, Representative Walker, Senator Summers, and the members of the Appropriation Committee. My name is Jennifer Passion Blocker. I am the Clinical Program Director for the Transitional Support for Emerging Adults, also known as TSEA, program at Community Health Resources. I'm here to speak on behalf of Bill number 6864. The program assists DCF-involved young adults transitioning into independency. When we think of successful transitions, we identify areas such as maintaining stable and suitable housing, remaining free from legal involvement, employment, educational, vocational programs, and development of life skills that can be used in everyday life. We as a program agency can come up with many data points to demonstrate the utilization and need for our program. But I think the most valuable information is the tremendous successful stories that we have. One that really stands out is a young lady that was enrolled in our program. She struggled with mental health issues, including depression and suicidal ideation. She was involved in legal issues and experienced ongoing relationship conflicts. While enrolled in our program, she was able to complete high school, obtain a certification of work as a nail tech, and obtain employment. She learned how to identify and schedule an intake with a therapist. She can manage her money effectively and obtain her first credit card. She is working and saving money to purchase a car. She continued to pursue her plans to pursue more education and was hoping to secure sustainable housing. Another story is regarding another young person that entered the program without employment and residing in foster home. Since working with our program, and that young person obtained their driver's license, is enrolled in college, and has employment. The young person has worked on looking for apartments, learning the HUD rate for numerous areas, and has learned how to schedule apartment tours to obtain housing. These are only two of the many successful stories that we can share. We have many other young people that have utilized the program and have become highly successful in their transitioning from DCF involvement to becoming independent and successful adults. Decreasing funding would decrease or possibly eliminate these opportunities that these young adults have to become successful and productive adults. Increasing funding will help with continuing the work that we do and even possibly adding more specialists to work with these young people. Please support increasing funding with the community nonprofits by $264 million, including increasing Medicaid rates for behavioral health services. Later on today, you will hear the testimony of some of those young people that are involved in our program. Thank you for the opportunity to testify.
Thank you. Next up, we have Lindsay Fresher, followed by Karina Adler.
Good afternoon, chairs and distinguished members of the Appropriations Committee. Thank you for the opportunity to testify today on House Bill 6864, an act concerning the state budget for the biennium ending June 30th, 2027. My name is Lindsay Fresher. I'm an MSW Policy Practice student at the UConn School of Social Work. I'm testifying specifically in support of funding Husky for all income eligible Connecticut residents up to the age of 26, regardless of immigration status. Healthcare is a human right, and all people deserve accessible and affordable care, yet more than half of our undocumented population is living without health insurance. On top of the daily stress and threats to their livelihood, many live in fear that a single accident or illness could lead to hospitalization and overwhelming medical debt. For those with life-threatening allergies, that fear is even greater. A very simple mistake like misreading a label or a mix-up at a restaurant can have dire consequences. I've experienced anaphylaxis 3 times, twice of these in adulthood because I was given food containing nuts, despite being aware of and having the ability to disclose my allergies. Those facing language barriers and other obstacles to healthcare access are at an even greater risk of serious allergic reactions. Without insurance coverage, medication used to delay and curtail the effects of anaphylaxis like epinephrine cost anywhere from $650 to $800 for 2 doses, placing a significant financial burden on families. Similarly, such chronic and life-threatening conditions require routine care, but keeping up with these expenses is nearly impossible. In 2022, the undocumented community in Connecticut contributed $400 million in taxes, yet they can't access healthcare benefits for themselves or their teenage children because of their status. We need to establish a structure of stability for our emerging adults, and healthcare is critical to promoting their continued social, economic, and physical growth. The expansion of this healthcare funding would not only ensure equitable access to care, but it is expected to reduce emergency Medicaid spending by providing coverage for preventative care, aiming to address healthcare conditions at the onset and avoid later, more expensive critical care. This would alleviate the stress on healthcare providers to deliver services effectively and without limitation to a population that's increasingly vulnerable. Being that we are home to some of the world's most renowned medical institutions, it's both harmful and unethical to leave any person without medical coverage. I ask the Appropriations Committee to fund Husky for all income eligible Connecticut residents up to the age of 26, regardless of immigration status, and in the future to open access to all immigrants regardless of age. Thank you for allowing me the opportunity to speak to you today.
Thank you for your testimony. At this point, I would just, because we have a large number of people who are coming in and out, I've been asked to remind folks of our rules here for this public hearing. If you are signed up to testify, you must accept online, you must accept the invitation to be promoted to a panelist when prompted. Please do so immediately on the first request. If you miss your turn to speak, you will lose your spot and you will have to go to the end of the list. That could be very early this morning. So if you're anticipating that you might have an issue making your slot, please reach out to the administrator in advance. Without letting her know in advance, we cannot guarantee your place in the order. Speaker numbers are assigned and may not be swapped. Substitutions are not permitted by this committee. Only registered individuals may testify in front of the Appropriations Committee. Unregistered testimony will not be allowed. If you would like to testify in a panel, you must prearrange it. Spontaneous formation of panels will not be permitted. And lastly, you have 3 minutes to testify. Please be advised that we have a virtual and in-person timer. For those of you who are testifying remotely, you will see a member of our staff labeled timer. When your speaking time has expired, you will see the timer raise their hand, indicating it is now time for you to summarize your testimony. Please be mindful of the screen when you are testifying as a result. And I will just add as well that, again, as I mentioned before, you'll see people in and out of this hearing room. We are paying attention. We also are reviewing written testimony as well. We've got a lot of folks to hear from and a lot of important issues to consider. So we want to hear from you, but it would help us all if you pay attention to these rules. And with that, we'll go back to the scheduled programming. Karina Adler, followed by Rochelle Cummings. Yeah. Hello.
Good afternoon. Thank you for the opportunity to provide testimony today. My name is Karina Adler, and I am the Clinical Supervisor for Family and Children's Aid in Danbury, an affiliate site for the Child First program. Child First is an evidence-based early childhood mental health program that helps struggling families build strong, nurturing relationships that heal and protect young children from the devastating impact of trauma, adversity, and chronic stress. It does this by using a multi-generation, trauma-informed approach, providing psychotherapy to parents and children together in their homes and connecting them with the services they need to make healthy child development possible. I have been the clinical supervisor of Child First for 7 years in Danbury. In this time, we have seen a shift in our capacity to provide enough support to families in the greater Danbury area, particularly when it comes to bilingual families. This is because although we previously had 2 teams to support the community, we lost funding for 1 team from the Office of Early Childhood in 2020. Besides some temporary funding through ARPA, we have been underfunded and underserving the greater Danbury community for 5 years. We support families that otherwise here. We don't have services for children that young. We specialize in that age. We love that age. We understand that supporting the families of infants, toddlers, and preschoolers mean that these children may later thrive as older adults, as teenagers, and as parents themselves. The caregivers we work with often say they should have been Child First clients when they were young. Helping little ones work through trauma, strengthening the attachment with their primary caregiver, and decreasing toxic stress impacts the family for years to come. We worked with a caregiver after her children were returned after a stay in foster care. The child, age 4, and mother were emotionally affected after being separated. Through the use of child-parent psychotherapy, we helped the dyad process their separation and rebuild their relationship. This caregiver was in foster care herself as a child. The caregiver explored how her own childhood and relationship history had been impacting her relationship with her own children. She became aware of how processing her own experiences could now make her a better mother to her children. When we discharged this family, they had been transformed. Mom and child were now a team. He saw her as his person, his safe space, and she was transformed as well. Her confidence increased as a mother, as an advocate, and actually as a poet. She went on to perform and publish some poetry she had written, some about her experiences with Child First. Child First is transformational. In the greater Danbury area, the number of families served could easily be doubled if we were operating at full capacity of 2 teams. In a twist of bad timing, both staff members in Danbury went on medical leave at the same time, meaning we could not open any new referrals that came in for 3 months. If we had an additional team in line with program expectations, we could have continued to serve new families. I'm grateful for the committee for the ongoing investment in Child First and ask for continued support to maintain the current funding levels. Additionally, we are requesting a $250,000 increase to specifically address my site, Family and Children's Aid, as we are operating with only one team. Continuing with one team puts us at risk of closure, further endangering the support we're able to provide our community. Thank you.
Thank you. Next, we have Rochelle Cummings, followed by Heather Gates.
Can you hear me?
Yes, we can.
Okay, thank you. Thank you for the opportunity to address HB 6864. My name is Rochelle Cummings, and I'm the immediate past president and current secretary of Clifford Beers Community Health Partners Board. We're an integrated network of not-for-profits who've come together to deliver wraparound social services at an innovative, cost-effective, and accessible manner. So I'm here to ask you to provide a meaningful increase in social service funding, to approve a significant increase in Medicaid rates, to increase rates periodically to track inflation, and to adjust the guardrails. So the first thing I learned as a board member was how vital the work is that we're doing to the health of our communities. Trauma is a fact of life for many of our children and families. At the board meetings, I hear about the raw anguish and despair of families in crisis, and I'll tell you, it's hard to hear it or remove. It must be excruciating to experience. Children lose a parent to death or prison. Children are physically or sexually abused. Children are different from their classmates and are bullied, and children face drug use in the family. Communities are in crisis because of school shootings. Families try to help their children, but sometimes more than caring and good intentions is needed. And that's where Clifford Beers comes in. So you've trusted us to care for these most vulnerable community members, and we're grateful. And we must trust you to give us the resources to fulfill that responsibility. But another thing I've learned is that no matter how committed we are to the mission, no matter how caring our staff, we simply don't have the funding to do the job. Let me tell you what it's like to want to help children and be stymied by seriously deficient funding. I sat on the finance committee as we struggled to create a workable budget, and I've stared at far too many columns of red numbers. I know that we're efficient. I know that we're careful and thoughtful stewards of your money. We've pared our expenses. We've made innovative changes to our service model, and we're doing so much with so little, but it's never enough. Yet we know how crucial it is to be there for our committee, so we try harder. It's frustrating, it's sad, and we worry every single day about the impact of these shortages on the children. No one's doing this work to get rich, but even the most dedicated staff have to feed their families and put a roof over their heads. So we lose staff to better paying jobs. We're forced to lay off staff and to reduce services. Sometimes it seems like every time we provide a service, we lose money. And that's the definition of unsustainable. I'm asking you to help us help you care for the most vulnerable among us. I'm asking you to invest in the well-being of our children and our families. Please find it in your hearts and in your budget to provide adequate funding for social services, our children and our families. Thank you so much.
Thank you for your testimony. Next, we have Heather Gates, followed by Deb.
Good afternoon. Thank you for being here. I'm Heather Gates. I'm the president and CEO of Community Health Resources. We provide mental health and substance use services to over 20,000 children, families, and adults every year throughout Connecticut. We are also a CCBHC, and about 70% of those who we serve are on Medicaid. I submitted written testimony for you to review, which has a lot of facts and figures in it. We are appreciative of the governor's budget, but it is not enough. It does not get the job done, and we hope that we are able to come through this session with a much firmer commitment for the need for funding for behavioral health in the state of Connecticut. I actually want to use my time to try and tell you two stories, if I fit it into the 3 minutes, about those who we provide services to and why it's so critical. The first one is about a young girl. At 6:30 in the morning, a single working mom requested our mobile crisis services for her 15-year-old daughter who is struggling with depression, anxiety, and refusing to go to school. During her work break that morning, the mother met two mobile crisis staff at her home. and upon entering the home together, her daughter was found covered in blood with deep flesh wounds along her forearm, saying she was trying to find the vein and wanted to die. 911 was immediately called, and mobile crisis staff worked to stabilize the situation. This young girl was admitted for 2 weeks to an inpatient facility. She then completed partial hospital and IOP programs, and then eventually referred to one of our in-home teams for further follow-up care. That is a story that could have ended in a very different way if it were not for the services that are funded and that CHR provides. The other story is a man who is 56 years old who became addicted to prescription pain medication. When he could no longer obtain prescription refills, he turned to street drugs and heroin. He hid the addiction from his family and employer, and yet he was using heroin every day. He knew his life was out of control, but was too ashamed to admit it and didn't want to ask for help. Finally, a close friend put him in touch with CHR and walked him into one of our buildings for treatment. His family rallied around him and he entered into recovery, which now includes daily methadone treatment together with intensive therapy and wraparound support. Today, he's grateful for the care and support he receives and wants to help other people overcome addiction and find joy and hope in their daily lives. Thank you.
Thank you for your testimony. Next, Deb Pullen, followed by Margaret Barilli.
Good afternoon, Senator Austin, Representative Walker, Senator Lesser, and the rest of the Appropriations Committee. My name is Deb Poland. I am the Chief Strategy Officer for the Community Health Center Association of Connecticut. And as you well know, we work with all 17 community health centers across the state who serve 440,000 people every year, 1 in every 8 Connecticut residents, including 264,000 Medicaid enrollees. I'm happy to be here today to share some of our thoughts on the governor's budget proposal, which, as Representative Walker implied earlier, we also have some concerns with. You have my written testimony with some additional information, and you're also going to hear from some of our health center leaders later on today, or for some of them, most likely early tomorrow morning. We're here to urgently request a strong increase in rates for community health centers. As you well know from the rate study that was released recently, the state of Connecticut pays health centers about 80%, and we actually think it's 75% of our comparison states' rates. We've also looked at our Medicaid rates in comparison with costs. We know that health centers across the state are losing about $85 every time they see a Medicaid patient for a medical visit, and $121 every time they're seeing a Medicaid patient for a dental visit. These cost versus rate scenarios are not the kind of thing that can be improved by just simply seeing more patients. Seeing more patients actually makes it harder for our health centers to stay in business. You're going to hear from a lot of different healthcare providers today asking for Medicaid rate increases, and they're all correct. They all need Medicaid rate increases. One thing that makes health centers unique, however, is we cannot restrict the types of patients that we see. If somebody comes in and wants to see us and they're on Medicaid, we can't say, oh, we only take a few Medicaid patients. We see everybody in our service area. So the only options that health centers have when they're sustaining these losses on Medicaid is to either reduce services or close sites. And we've already seen health centers start to reduce services. We have a health center up in Torrington who today is their last day of providing dental services. We have another health center in Waterbury who has recently made the decision to stop providing restorative dental services. We have other health centers in similar positions ready to make similar decisions. These decisions are unfortunate. They impede primary care access for Husky enrollees and also for all of our patients. The state has made a commitment to improve access to primary care. That is part of the goals that have been set forth by the administration and the legislature. The only way to do that is to increase rates. We are asking for the state to meet its commitment by increasing rates to community health centers. Thank you very much.
Thank you for your testimony. Margaret Barilli, followed by Danielle Winkler.
Yes. Hi, members of the Appropriations Committee. Thank you and good afternoon. I'm a licensed, you can hear me okay?
Yes, we can.
Okay, good. I'm a licensed acupuncturist and the founder and director of Niantic Acupuncture and Family Wellness, LLC, in Niantic Acupuncture, and I also serve as the president of the Connecticut Society of Acupuncturists, the CTSA, and I'm representing the society today to offer comments on the governor's proposed budget for the next 2 years. Acupuncture has been a covered medical benefit under Medicaid since October of 2021, so we're relatively new. Our members across the state are now providing service to a community of patients who've been previously underserved and unable to pay out of pocket for non-pharmaceutical interventions like acupuncture to treat their chronic pain and other health conditions, including mental health. At my practice alone, we've seen a lot of inspirational transformations take place in our population of Medicaid patients. They are some of our most committed patients, and gratitude they demonstrate for having access to our medicine is heartwarming, to say the least. For many of these patients, acupuncture can be the only intervention that actually provides relief. Unfortunately, the low reimbursement rates we started out with that are currently provided by Medicaid are preventing a larger number of acupuncturists from participating in the program as providers. And this, of course, makes access to this care difficult for the Medicaid population, who often have to travel unreasonable distances to utilize acupuncture benefits or wait for weeks or sometimes even months to get an appointment with an in-network provider. Currently, Medicaid rates for acupuncture equal approximately 55% of the Medicare rate. The CTSA supports your plan of increasing the rates for Medicaid providers over a 4-year phase and ultimately, hopefully reaching 80% of the Medicare payments. The important point is that with more Medicaid acupuncture providers, we can serve more patients. Thank you so much.
Thank you for your testimony. Next, we have Danielle Winkler.
Good afternoon, distinguished members of the Appropriations Committee. My name is Danielle Winkler, and I'm the lead specialist for the Transitional Supports for Emerging Adults at Wheeler. On behalf of my colleagues and the young adults I serve, I'm here today to thank you for your continuous support of our grant-funded program through the CT Department of Children's and Families. Maintaining support for this program is vital in assisting young adults transition out of the DCF system. I've worked with this program since its inception in 2019, and I've witnessed the need for our services grow immensely. Moreover, I have seen firsthand how TSEA changes lives. Whether it's helping a young person secure their first job or apartment, obtain acceptance into a post-secondary education, or receive vital mental health care, this program bridges the gap between foster care and adulthood. TSEA provides a systematic framework that can be applied to all young adults and tailored to their needs. Your continued support of the TSEA program provides critical assistance for young adults who have overcome significant adversity and face immense challenges entering the real world. Your support ensures retention of a dedicated staff who implement intense, individualized plans, empowering young adults to successfully transition out of the DCF system and achieve long-term independence. Our staff plays an intricate part in helping young adults become contributing members of society. The TSEA program is an essential investment in the future of Connecticut's youth. You will be hearing from some of those young adults very shortly. Thank you so much again for your time and continued support.
Thank you for your testimony. Next, we have a panel of we have the whole panel right here. Edison, Javier Naranjo Chiliquinga, Perla Cardozo, Ana Lever, Patricia Rosas. Hello, proceed. And you have 2 minutes each, is that right? Okay. I'll push the button.
Continue.
And the other, there's another one. Perfect.
Ok.
Okay.
Estimados miembros del comité, mi nombre es Patricia Rosas, vivo aquí en Hartford. Soy madre y abuela, soy miembro del grupo Manos Unidas de New Britain y Hartford Deportation Defense aquí en Hartford. Gracias por la oportunidad para testificar sobre HB 6864, una ley relativa al presupuesto del Estado para el bienio que termina el 30 de junio del 2027. Pido al Comité de Apropiaciones Financieras la elegibilidad Husky para todos los residentes de Connecticut con ingresos elegibles independientemente de su estatus migratorio hasta los 26 años. También apoyo el aumento de las tasas de reembolso de Medicaid para que los actuales beneficiarios de Husky puedan tener un mejor acceso a la atención. Esta legislación es importante para tener un poco de paz mental en medio de todo el caos que actualmente se vive. He sido muy afectada por no contar con seguro médico. Soy sobreviviente de cáncer de riñón, dolor de cabeza que me envió a urgencias. Así no funciona uno bien para trabajar y cuidar de la familia. Estoy muy afectada también por estar siendo testigo de cómo mi comunidad paga las consecuencias de este sistema roto. Todos nos enfermamos, por lo tanto es urgente que tomen acción y expandan el seguro médico para todos los inmigrantes. Ayudaría para poder tener chequeos médicos a tiempo, para que después no sea demasiado tarde y ya tenga una enfermedad que muchas veces es tarde para curar. Sería bueno vivir más saludable. Pido al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes elegibles de Connecticut, independientemente de su estatus migratorio, hasta los 26 años. Este año y que cree un plan para abrir el acceso a todos los inmigrantes independientemente de su edad. Las necesidades sanitarias no terminan a los 26 años. Gracias por su tiempo.
Hello, my name is Patricia Rosas. I'm a mother and I'm a grandmother. I live in Hartford. I'm part of Manos Unidas and also of the Hartford Deportation Defense. Thank you for the opportunity to testify in favor of HB 6864 and act concerning the state budget for the biennium ending June 30th, 2027. I ask the Committee of Appropriations to finance the eligibility for Husky for all residents of Connecticut with eligible incomes, regardless of migratory status, up until 26 years old. I also support the raise in rates of reimbursement of Medicaid so that the current beneficiaries of Husky can have better access to medical attention. This is an important bill because we need to have some mental peace within all the chaos that we currently live in. I've been very affected since I don't have medical insurance. I'm a survivor of kidney cancer. And recently I had a terrible headache that sent me to urgent care. This isn't the best way to maintain my health since I still need to work and take care of my family. I'm a witness on how my community pays for the consequences of this broken system. We all get sick, and for this reason, it is urgent that you take action and expand the health insurance for immigrants. This would help us get routine medical treatment so that it's not too late when we do fall ill. It would be great to live a healthier life. I ask the Committee of Appropriations to finance eligibility for Husky for all eligible residents of Connecticut, regardless of migrant status, up until 26 years of age for this year, and that a plan is created for access to healthcare for our immigrant residents, regardless of age. Healthcare does not end at 26 years old. Thank you for your time.
Thank you for your testimony. And Edison.
Estimados miembros del comité, mi nombre es Edison Javier Naranjo. Vivo en New Britain, Connecticut, y soy miembro de Manos Unidas. Husky para inmigrantes me beneficiaría porque tendría acceso a exámenes físicos anuales y sabría cómo va mi salud, y beneficiaría también a toda mi comunidad inmigrante. Y sabría en mi salud cómo va todo. Tuve que pagar una factura muy alta debido a que me quitaron mis muelas. Había ido por un simple dolor de cabeza, hice un chequeo y tuve que pagar una factura muy alta. En realidad, todos tenemos que pagar facturas muy altas cuando vamos a este tipo de servicios médicos y pues también nosotros tenemos que pagar lo que es un presupuesto reservado que tenemos para otras facturas, entonces realmente no nos alcanza. Ahora estamos en el 2025, Husky para la comunidad inmigrante corre el riesgo de ser privatizado. Pido al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes elegibles de Connecticut, independientemente de sus estatus migratorios hasta los 26 años este año y que creen un plan para abrir el acceso a todos los inmigrantes, independientes de su edad. Las necesidades sanitarias no terminan a los 26 años. Muchas gracias.
Dear Chair members and the Appropriations Committee, my name is Edison Javier Naranjo. I live in New Britain, Connecticut, and I'm a member of Manos Unidas. Husky for Immigrants would benefit me because I would have access to yearly physicals and I would know how I'm doing with my health. Recently, I had to pay a high bill due to a molar being removed. I had gone for a checkup due to a headache and ended up having to pay when in reality, these bills are very high to pay. Meanwhile, I have to pay rent and I don't make enough to have a budget set aside for medical bills. Now that it's 2025, Husky for the immigrant community is at risk of being privatized. I asked the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to 26 years of age, and create a plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 26. Thank you for your time.
Thank you. Next, we have Candace Wright, followed by Julia Rosenberg. Handasi, I'm sorry.
It's all right, thank you.
We do our best, but sometimes we screw up.
Okay. Well, thank you. Good afternoon, Senator Alston, Representative Walker, and all the members of the Appropriations Committee. My name is Kandasi Wright, and I am the Executive Director of Solar Youth, a nonprofit dedicated to empowering young people through environmental education, leadership development, and community service. This year, Solar Youth proudly celebrates 25 years, a milestone made possible through steadfast support of leaders like you, our partners, and the communities we serve. At Solar Youth, we provide year-round programming for youth ages 4 to 8, engaging them in hands-on learning that fosters curiosity, deep connection to nature, and a sense of stewardship for their own neighborhoods. Each year, we serve over 150 youth from New Haven's most vulnerable communities, many of whom live in public or subsidized housing. Through our paid internship programs, we also employ 30 to 40 high school students, offering them their first job experience while building essential leadership and job readiness skills. However, we are facing increasing challenges due to funding shortfalls, particularly as federal funding becomes more restrictive. Without adequate support, we have been forced to maintain wait lists where none ever existed before and limit access to critical out-of-school time programs, the very programs that keep our youth safe. Research shows that when young people lack access to structured, enriching activities, they face higher risk of academic struggles, mental health challenges, and involvement in the justice system. The need is growing, but with sufficient funding, we can expand our reach to serve the youth who need us most. If funding is cut, we face the difficult reality of scaling back our programs, reducing staff capacity, and limiting opportunities for youth leadership and employment. But with increased investment, we can provide more young people with transformative outdoor experiences, strengthen our paid internship pipeline, and expand nature-based learning and community service projects. Every dollar invested in Solar Youth is an investment in youth empowerment, community well-being, and a safer, more engaged future for our state. I am so honored to have been joined by Jonas Samweze. You heard him speak earlier. And Jonah represents exactly what is possible when young people have access to high-quality youth development programs. Thank you so much for your time and continued support. 25 years, this November. Thank you for your support.
Time flies when you're having fun. Julia Rosenberg, Dr. Julia Rosenberg, followed by Cal Patel.
Good afternoon, and thank you to the members and chairs of the Appropriations Committee. My name is Dr. Julia Rosenberg. I'm a pediatrician and a lifelong Connecticut resident. Thank you for the opportunity to testify, and thank you for your dedication to the health of the Connecticut community. Today, I join the chorus of our neighbors supporting funding to expand Husky coverage, including through at least age 26 for those who are income eligible, regardless of immigration status. As a pediatrician, I have a simple mission: to provide compassionate care for all children and families. However, because not all undocumented children are currently eligible for Husky, this is not possible for many youth in our state. I've had the opportunity to deliver great news to many families with young children that their children are now eligible for health care. But I've also seen disappointment, including for families with some children who are eligible and some who aren't. And while I can share the stories of the children I have seen, I continue to worry for families I do not see. I want to implore you to have this year be the last that our neighbors share heartbreaking stories of missed essential health care with real life-threatening consequences. We should be hearing these stories in our offices, not in the Capitol, not on Zoom, and not when it's too late for people to receive the care that they need. We know that children's health suffers without insurance coverage. Compared with uninsured peers, insured children do better in school. They have more successful careers and have better health as adults, with fewer costly and painful chronic conditions. What's more, with what's known as a welcome mat effect, in our many neighbor states who have rolled out the welcome mat for health coverage for all children, there's infrastructure that provides healthcare access for all children, regardless of documentation status. And we see data that there are also benefits for all children, regardless of documentation status. A rising tide lifts all children's health. And many of our neighbor states have less foregone care and more preventive visits for all of their kids. We want to be able to provide compassionate care to all of our neighbors, especially in these times of fear and uncertainty. I don't want to have to tell another family that their child's recent birthday celebration disqualifies them from receiving essential health care. Childhood does not stop at age 16. We support Husky coverage for undocumented individuals through at least age 26 to ensure we keep our state's future, our children, healthy and thriving. Covering all children makes sense for individual health, financial health, and public health. But importantly, healthcare is a human right. Thank you for your leadership and for your thoughtful consideration and time.
Thank you for your testimony. Next, we have Cal Patel, followed by Marisol Orth.
Hello.
Hello.
Hi. Good afternoon, Senator Olston, Representative Walker, and esteemed members of the Appropriations Committee. Thank you for the opportunity to offer testimony relating to increased residential care home funding rates. My name is Cal Patel. I am the administrator of Essex Village Manor and executive board member of Connecticut Association of Residential Care Homes. Today, I'm here to encourage, specifically to encourage providing funding for residential care homes, especially for inflationary increases. We provided residents with 24-hour staff supervision, medication supervision, housekeeping, breakfast, lunch, dinner, physical plant maintenance for approximately $3,200 a month. Our cost of service, especially our valuable employees, have increased greatly over the last few years, but the rates have not kept up. Increased costs in gas, insurance, food expenses, accompanied by suboptimal rate adjustments, have made operating homes very difficult, and we're losing beds on an annual basis. Without residential care homes serving the vulnerable population, the state would be paying significantly more dollars providing long-term care at nursing homes or residents going in and out of hospitals at a much higher cost. These funds are critically important for our workforce. As other providers have said, We're losing talent. Our state is losing talent. Long-term care employees are leaving our state because of the high cost of living, and we're just not able to pay what a fair wage is. So we desperately need the increases for our frontline staff who care for these residents. Our most critical costs, like I said, are employees, but also our insurance. As everybody have here in the news, everybody's insurance is going up. Our liability insurance. So we need the funding to increase to help support the viability of these facilities that care for our most vulnerable population. Thank you. I appreciate the time, and I look forward to any questions if there are any.
Thank you very much for your testimony. Next, we have Marisol Orth, followed by Elizabeth Lucas Moran.
Good afternoon, members of the Appropriation Committee. Can you please hear me?
Yes, we can.
Thank you. Thank you for the opportunity to testify today. My name is Marisol Orth. I have been a behavioral health nurse with Alara Caring, formerly New England Home Care, for 23 years. I am here today to ask you to restore the rate for home health medication administration to 2016 levels. In behavioral health, our role as nurses has at times been overlooked because of our services are billed under the name of medication administration. Our role is much more than that. We serve as the facilitators of the relationship between patients, physicians, and often family members as we perform the healthcare treatments to best meet the patient's needs. Those needs at times are not limited to psychiatric evaluations, also medical evaluations. Most of our patients develop comorbidities along the way. It's an unfortunate side effect of many of the medications used in psychiatry to stabilize the patient. Home health is, if you will, the hands-on, field-based partner that meets patients where they are, delivers healthcare treatments, and connects with related community providers as required to best meet the needs of our and progress of our patients. We partner with community clinics, recovery homes, IOP programs. We work transitioning clients to the community from inpatient stays and work in collaboration with clients in outpatient SUD programs. We are currently in an opioid epidemic where even the patient that smoked marijuana on the streets needs to be educated on the use of Narcan due to the possibility of being laced with another substance, and they can overdose. One of the goals we work to achieve is to maintain patients safe at home, which helps keep the community safe. This sometimes requires us to interact with the court system and probation officers. We are at a critical juncture when it comes to inadequate rates of reimbursement for Medicaid-funded home health providers. As our state continues to push the care for more individuals in the community, not only with psychiatric diagnosis, but also medical long-term needs, it is imperative the community-based Medicaid infrastructure is recognized and financially supported. In the past, behavioral patients were institutionalized in facilities like Norwich Hospital or Fairfield Hills. As a society and in the field of psychiatric medicine, we have come to better understand mental illness and that most patients do not need to be in institutions. They can live in the community with support services. Currently, we care for individuals who are discharged from Connecticut Valley Hospital and Whitening Forensic Hospital. Deinstitutionalizations allows individuals to live independently with a focus on recovery and to help them get the required specialized, individualized care provided by trained psychiatric nurses. You have heard recently in the news of a patient who killed a man with an axe and ate the body parts. He's asking for conditional release, and he will be qualified under the medication administration. It is a very important work, the one we do. We must be supported also through adequate funding. For this reason, I'm here today. Skilled home health rates have been virtually level funded since 2007. Additionally, there was a significant cut of 15% made to the rate for medication administration in 2016.
Please you're over the 3 minutes. So if you could.
Okay, thank you so much. I appreciate it. We are asking for an increase on the medication administration rate. Thank you for your time.
Got it. Thank you very much. Next, we have Elizabeth Lucas Moran, followed by Gloria Duquette.
Hello, can you hear me?
Yes, we can.
Perfect. Well, good afternoon. My name is Elizabeth Lucas Moran. I live in Hartford, Connecticut, and I'm a fourth-year student studying Allied Health Sciences at the University of Connecticut. I would like to thank the distinguished members of the Appropriations Committee for holding this hearing today and allowing me the opportunity to speak. But I'm here to urge the committee to expand federal funding for Husky coverage for all Connecticut residents up to age 26, regardless of their immigration status. Aside from being a full-time student, I'm also a full-time caretaker for my mother, who is currently living with a number of chronic diseases that have significantly impacted her quality of life. Since I was 16, I have witnessed firsthand the challenges that come with accessing affordable health care. Out of fear of exposing her citizenship status, my mother neglected to seek medical care when she first began experiencing signs of type 2 diabetes. This led to a delay in her diagnosis and treatment, which just worsened her condition. Last year, she was actually diagnosed with kidney failure, and she now relies on dialysis treatment 3 times a week, which is covered by emergency Medicaid. My mother's story is not an isolated case, but it reflects the broader healthcare inequality that disproportionately impact immigrants and other marginalized communities. The challenges my mother faced have fueled my passion for public health. And throughout my college career, my professors have ingrained in me the importance of preventative healthcare services and the impact policies have on access and health outcomes, particularly for those vulnerable communities. Undocumented immigrants continue to have very limited access to healthcare coverage, and the proposed bill would help expand access to medical services by providing insurance while also reducing the number of preventable poor health outcomes. I found a study published in 2020 by Cobian and colleagues that compared longitudinal changes in insurance coverage over 24 years of follow-up between recent immigrant, early immigrant, and non-immigrant adults in the U.S. And their findings suggest that public insurance programs play a critical role in reducing disparities in insurance coverage for recent immigrants compared to non-immigrants. And according to a recently published fact sheet from the National Immigration Forum, undocumented immigrants compose the largest group of uninsured individuals in the country. This is an estimated 45 to 71% of them lacking health coverage. They also claim that undocumented immigrants contribute tens of millions of dollars in federal, state, and local taxes each year. These tax contributions of undocumented immigrants are critical to the viability of public health programs like Medicare and Medicaid. So by expanding health coverage, we can take a crucial step toward health equity, ensuring that young adults, regardless of their immigration status, have access to the care they deserve. Thank you again for your time and consideration.
And thank you for your testimony. Next, we have Gloria Duquette, followed by Christy Case.
Gloria is not online, and Christy needs to accept the invitation to be promoted.
Christy? Going once. Okay, great. Please accept the promotion if you want to speak. Thank you. That's for everybody else. Christy, please proceed. Christy, are you able to unmute yourself? You have to unmute yourself. Okay, I think she's frozen. Oh, there she is. Christy, please proceed. While Are you there, Christy?
Hello?
Yes. Okay, it looks like Christy's having some technical issues. David Galloway, you're next, and we will try again, I guess, with Christy in a second.
Okay, thank you. My name is Dr. David Galloway. As the director of a birth to three provider agency that serves families across the state, I was pleased to see that funding for potential rate increases was included in the governor's proposed budget. Services for infants and toddlers with developmental delays require a highly skilled and educated workforce. However, attracting and retaining qualified clinicians to do this vital work and families' homes and in the community has become increasingly challenging due to salary requirements and competition for staff from other sectors such as hospitals and private clinics. While the increases in rates would be welcome, there are two aspects of the proposal from the governor that I would ask you to consider. Firstly, in many cases, the salaries we must pay our clinicians equal or exceed the amount of reimbursement we can receive for their services. This problem is partially offset by current general administrative payment or gap. Maintaining the gap at its current level instead of reducing it will allow us to compete for skilled talent while remaining financially viable. Secondly, the language in the governor's proposal adopts a new tiered system for reimbursement, one that will add unnecessary administrative and fiscal burdens on our clinicians and on agencies who are providers. As things stand, our agency and many others devote significant amount of time to funding, training and ongoing support for our staff so that they can best serve families in the community and navigate the complex duties of case management within the birth to three system. I fear that the additional training requirements that would be needed to access the higher rates of funding will only serve to decrease the amount of time that our clinicians will have to devote to supporting families, while at the same time increasing turnover in our ranks. As such, with these points in mind, I ask you to please consider funding birth to three within the existing tiered system and without a reduction in gap. On behalf of the many dedicated clinicians and thousands of families that we support across the state, I thank you for your time.
Thank you for your testimony. We're going to try Christy one more time. You're muted. Okay, we're gonna go on to Maris Pelk.
I'm trying.
Okay. All right. Please go ahead, Christy.
You can hear me?
Yes, we can.
Okay. Good afternoon, Senator Austin, Rep. Walker, Senator Summers, Rep. Nuccio, and other members of the committee. My name is Christy Case. I am an advocate at Disabilities Network of Eastern Connecticut, one of the state's 5 non-residential independent living centers that help any person with a disability live, work, and thrive in the community. I'm an independent living advocate, and I have been working with consumers in my community for a little over a year. I work with various consumers with different needs. One consumer I've been helping for almost over a year find affordable housing since he's residing in a nursing home. After we get the funding that we need, we would be able to help so many more consumers every year. We advocate for individuals who feel they don't have a voice. We do not receive enough funding for all the consumers that we could help, and we have to decline to assist in some circumstances. We have consumers that need assistive technology, ramps, stair lifts, and other needs to remain in their community. Please support an increase of $1 million for the independent living centers. People living independent and productive lives in the community depend on these services. Thank you.
Thank you. Next, we're going to have Maris Pelkey. After Maris, we're actually going to go back to Judy Stein, who we had skipped, but Judy did let us know that she was having an issue. So if you are worried that you're going to miss your slot, please let the administrator know. We will be able to accommodate you. If you don't, you may have to go at the end, which could be at 4 o'clock in the morning for all we know. Maris?
Good afternoon. My name is Maris Pelkey. I'm the Executive Director of Birth to Three Services at Creative Interventions, a Birth to Three agency that currently serves over 500 families across Connecticut and employs an average of 150 employees. I'm also a parent whose family benefited from receiving Birth to Three services many years ago. I've dedicated my career to the Birth to Three system and started working in Birth to Three as a special educator 22 years ago. I am concerned about the future of the system as programs are struggling. There are 17 Birth to Three programs in the state of Connecticut, and we are functioning over capacity without the ability to create a waiting list. 2 programs have already closed due to financial constraints, and we need additional funding to remain viable and to continue serving families in Connecticut. I was happy to learn that financial support for Birth to Three has been built into the budget. However, I have three concerns about the budget as it stands. The first concern is in regards to the proposed tiered structure of payment. Stakeholder input was not gathered for this tiered structure, and it would create additional burdens for programs who are already stretched. Many of my colleagues within Birth to Three with over 20 to 30 years of experience would not qualify for the highest reimbursement rate. It's already difficult to pay competitive salaries in Birth to Three, and we don't need additional requirements to achieve recommended reimbursement rates. Birth to Three currently has a two-tier structure, professional and paraprofessional, that works well, and I request that the budget reflect this existing structure. My second concern is that the budget allocates the removal of funds for the general administrative payment or the GAP payment. Birth to Three providers rely on GAP funds to cover required, unreimbursed administrative support for families in the Birth to Three system. Increasing the rate for billable services will certainly support programs overall, but will not remove the financial burden of these unreimbursed administrative tasks. It's therefore of the utmost importance that GAP funding remain as a statutory requirement in the budget at the current rate of $200 per eligible child. Finally, Birth to Three programs have not received any cost of living adjustments across the past 8 years. We have received stabilization payments and ARPA funds, and while this has been helpful, it doesn't allow for the structure of long-term financial predictability. Birth to Three really needs a scheduled review of Medicaid rates to ensure future stability of the system. In summary, I request that the Appropriations Committee approve the budget for Birth to Three with the existing two-tier structure, the continuation of the existing GAP payments, and a scheduled review of Medicaid rates. Thank you for your time and consideration of this testimony.
Thank you. Judy Stein.
Thank you very much for this opportunity to speak this afternoon and for accommodating my medical need. I'm grateful to be here to speak for the needs for nonprofit organizations and the Center for Medicare Advocacy, of which I am the senior advisor, the founder, and an attorney. I'm Judith Stein, and I've been doing this work for over 40 years. I'm a resident of Mansfield, Connecticut, prior to that of Windham. For almost 40 years, the center has provided free legal assistance as a nonprofit organization, privately incorporated in Connecticut, for people with disabilities, older people, and people and their families to open doors to Medicare and quality health care, and to ensure that Medicaid doesn't pay when Medicare should. We also offer outreach, education, technical support for the Choices program, as well as federal healthcare policy analysis, engagement, and litigation, and assistance for the state of Connecticut and the federal delegations' analyses about Medicare. I offer this testimony regarding the budget for the biennium, particularly as it relates to the Department of Aging and Disability Services, the Department of Social Services, the Center for Medicare Advocacy, and I urge you to protect and fully fund the Center for Medicare Advocacy and all the other nonprofit organizations, many of which we've heard from today and many which we will hear from, who provide tirelessly cost-effective services to improve the quality of life for Connecticut residents. With regard to the Center for Medicare Advocacy's project with the Connecticut Department of Social Services, as some of you know, since 1990, we have appealed Medicare denials for duly eligible Connecticut residents, mostly for nursing home denials by Medicare and home health care denials by Medicare. As a result of this work, the Center for Medicare Advocacy in the last 2 fiscal years has resulted in a return of $20 million. And as a result of our work since 1990, we would have reported recoveries from our medical appeals work of $427 million for the state of Connecticut that would otherwise have been left paid by Medicaid for duly eligible people. So our work, which is costs the state at a return on investment of $5 to $1 paid to the center, is beneficial to the older disability community in this state, their families, and also to the Medicaid state budget, which we help make sure is the payer of last resort. With regard to the Department of Aging and Disabilities, and with regard to the Department of Social Services project that we run, we have not had a cost of living increase since 2017. So we request that we do get a cost of living increase and can continue this important work to bring Medicare back to meet its promise for duly eligible Connecticut residents and for the Medicaid program. The Center for Medicare Advocacy also represents people who do not have Medicaid, maybe yet, but they don't have Medicaid and rely exclusively on Medicare for access to health care. This project is brought as a result of legislation requiring the Department of Aging and Disability Services to have a Medicare advocacy and education project. We have been bringing that project to Connecticut for decades. In this last full fiscal year, we represented 1,774 people and families across the state in order to make sure that they got the Medicare coverage they were eligible and entitled to, and brought forward to them about $700,000. We've urged that this project be continued and that we get a cost of living increase on top of level funding. We also encourage continued funding for all the nonprofit organizations in this state and provide staffing as the Ombuds Office requests. Thank you very much.
Thank you. Up next is Jennifer Nadeau.
Good afternoon. My name is Jennifer Nadeau. I'm a licensed clinical social worker and the Senior Vice President of Child and Family Services at Community Health Resources. CHR is an essential healthcare provider that meets the behavioral healthcare needs of children, families, and adults from throughout the state. In fiscal year 24, we provided services to over 20,000 individuals. To date, in fiscal year 25, we've served almost 15,000 and are on track to serving more clients than last year as we enter what is historically our busiest time of the year. We rely on state funding to continue to respond to the growing demand for services with effective, evidence-based, and individualized services. Thank you for the opportunity to testify on the governor's proposed budget. I'm here to request an increase in funding for community nonprofits. While I deeply appreciate the increases the legislature has made in recent years, they have not kept pace with the growing needs of the people we serve. We continue to face crippling cost increases that far outstrip the funding we've received. Children's behavioral health services in Connecticut are facing a looming crisis due to underfunding and inadequate Medicaid reimbursement rates. As demand for these services rises and mental health disparities widen, reimbursement rates for behavioral health services remain far below necessary benchmarks, with current rates at just 62.3% of those in peer states. This shortfall makes it increasingly difficult for providers to meet the growing need for care, and untreated mental health issues result in higher costs in emergency care and hospitalizations, further stressing the healthcare system. Increasing Medicaid reimbursement would improve access, enhance service quality, and alleviate the financial burden on the state by addressing these issues proactively. Investing in children's mental health services is not only a moral imperative, but also an economic necessity to ensure better outcomes for Connecticut's future. At CHR, we currently have 28 therapist vacancies in our child and family programs, with over 200 applicants. The issue isn't a lack of therapists seeking work, but rather the challenge of offering substandard pay and benefits while competing with private practice opportunities that offer greater flexibility and higher pay. Given the choice, would you prefer to work with the most complex, high-intensity clients and their families for subpar pay and benefits, or would you choose to work with lower acuity, lower risk clients, enjoying better pay and more flexibility in selecting your caseload? Each unfilled position means more children and families are left without essential services. Many of our programs are operating at a loss, and we are constantly faced with the difficult decision of whether to continue running them at a deficit or risk even fewer families being able to access to care. I appreciate the opportunity to share my perspective today. Community nonprofits are the backbone of our service system, providing a vital safety net for children, families, and adults who have nowhere else to turn when they need help. Please support increasing funding for community nonprofits and raising Medicaid rates for behavioral health services so Connecticut can build a fully supportive system of care for children's behavioral health, one that addresses the increasing demand and complexity of needs in our communities. Thank you.
Thank you. Up next is Kimberly Smith. That's you?
Yes. Good afternoon, Senator Austin. My name is Kimberly Smith, and I am Program Director at Disabilities Network of Eastern Connecticut, one of Connecticut's 5 non-residential independent living centers. I appreciate the opportunity to speak with you today about the critical role ILCs play in supporting individuals with disabilities, and why increasing ILC funding by at least $1 million is essential. The demand for our services has grown tremendously, especially when it comes to housing support and advocacy. With an additional $1 million in funding, $200,000 for each of the 5 ILCs, we could hire more advocates to serve individuals with disabilities, especially in rural and underserved areas, expand outreach so more people know about the resources available to them, and provide quicker, direct support for urgent needs, whether it's helping someone fix a malfunctioning SNAP card, get transportation to a medical appointment, or navigate complex healthcare systems. Many people with disabilities struggle to find stable housing, access healthcare, and fight against discrimination. Our advocates do everything they can to guide people through these challenges, but with our current staffing levels, we just can't keep up with the growing demand. More funding would allow us to provide the timely, individualized support our consumers rely on. Right now, the underfunding of the cells leaves us understaffed and overworked. This puts more pressure on our advocates, leads to burnout, and limits our ability to expand services. By increasing funding, Connecticut wouldn't just be keeping up with best practices, it would be making sure people with disabilities get the support they need to live independently. This $1 million increase is a necessary step to meeting the needs of our communities. It would allow us to create much-needed advocacy positions, expand our outreach, and provide crucial services to the disability community. More importantly, a $1 million increase would allow any person with a disability to live, work, and thrive in the community of their choosing. Thank you for your time and consideration. I appreciate your commitment to supporting people with disabilities in our state.
Thank you. Up next is Janet Stolfi Alfano, Diaper Bank.
Thank you. Good afternoon, Senator Austin and members of the Appropriations Committee. My name is Janet Stolfi Alfano. I'm the Chief Executive Officer of the Diaper Bank of Connecticut. I appreciate the opportunity to testify before you in order to increase support for and access to diapers for infants and toddlers. Since 2004, the Diaper Bank of Connecticut has been helping families meet this basic need, having provided over 52 million diapers to Connecticut children since we started 20 years ago. While we are a well-established leader and one of the largest diaper banks in the country, we are only meeting a fraction of the true need in our state. In addition to our testimony in the Human Services Committee yesterday requesting Medicaid coverage for medically necessary diapers, we are also asking for an increase in our line item to $5 million. Diaper need has been documented to be the #1 predictor of postpartum depressive symptoms, and there is a growing body of research showing the physical, mental health associated with lack of access to diapers. We also know that it has a tremendous impact on a family's ability to provide diapers and bring their child to childcare, impacting their ability to attend work or school. What I'd like to do is share with you, with his permission, a bit of the written testimony of our current board member and former client, Maurice Mo Edwards, who is currently a New Haven firefighter. Thanks to the Diaper Bank of Connecticut, my pride as a father was restored. My daughter was able to wear clean, quality diapers, which prevented her from sickness and infection. Their assistance allowed me to allocate funds to other important needs. I felt confident sending her to daycare knowing she had everything she needed. Their help eased the strain on my mental health, enabling me to be more present and available for my daughter. As a result of this support, the health and development of my child improved. Children like mine who are able to have clean, quality diapers experience fewer illnesses such as urinary tract infections and diaper dermatitis. This means fewer days missed at preschool and daycare, allowing children to develop better school readiness and overall growth. Parents like myself are also able to work more consistently, knowing their children are in a better position to succeed. We all know the snowball effect, but this was more like a flower bloom, a positive cycle that helped my family thrive. I'm going to use that in future. Today, I'm a lieutenant in the New Haven Fire Department and a proud father of 3, including my daughter, Joy, who's now 16, and an honor roll student in high school. As a board member of the Diaper Bank, I'm now dedicated to spreading awareness about the critical role diapers play, not only in the growth and development of children, but also in the strength of families. Thank you for the opportunity to share a little bit of his story, as he could not be here as he's working. But thank you so much.
Thank you. Up next is George Kingston. Mr. Kingston, you're muted.
Good afternoon, and thank you for the opportunity to testify. Members of the Appropriations Committee, my name is George Kingston. I am the administrator at Trinity Hill Care Center in Hartford, Connecticut. Trinity Hill has been providing nursing home care in our community for over 49 years. We are a 134-bed nursing home, and we have 150 employees working at our facility. We are members of the Connecticut Association of Healthcare Facilities. We currently have a CMS 5-star rating, a designation reserved for the top 10% of nursing homes in the United States. While the public health emergency may be over, Connecticut nursing homes are still recovering. I can say that our nursing home, the residents we serve, and our employees continue to be challenged like no other time in the history of providing care in Connecticut. I can also say that our nursing home is as determined as ever, and we feel that each week we are getting closer to a time when we can say the pandemic is a distant memory. We are still, however, challenged by ravaging inflation, severe staffing shortages, and increases in labor costs. These issues are not addressed in the budget recommendations. We are losing ground in inflation as prices for key goods and services rise. Food costs have increased by $15,000 from the year before. Electricity expense is 13% higher than the previous year. The proposed funding for nursing homes doesn't recognize what is happening with inflation, and we are asking you to recognize the real inflation that we are experiencing in the state budget. The severe staffing shortages I mentioned a few seconds ago that have been faced during the pandemic is not letting up. Prior to the pandemic, a 7-to-3 or full-time vacancy would remain open for less than 10 days. We are routinely seeing 40-hour day positions go unfilled. Currently, in my facility, I have 200 hours of license vacancy and 250 hours of CNA vacancy. We have relied on overtime and agencies to fill these unclaimed shifts and watched our overtime utilization climb from 4% of worked hours to 20% of worked hours. Our skilled nursing facility needs more resources to boost the pay of our employees, but the proposed budget does not address this issue. The federal and state resources that were a lifeline to our community have all been terminated. Now, all of our operators' employees are losing ground against inflation. More funding is needed in the budget to address the persistent and ongoing inflation we are facing and to help us with our soaring labor costs. Thank you.
Thank you. Up next is Garrett Dolan, along with Naomi Lockhart and Michelle Duhart. Okay. The floor is yours. Just introduce yourselves as you speak.
Hello, I am Naomi Lockhart. Naomi Lockhart, thank you for taking the time to listen to my testimony today. I'm from Manatí, Puerto Rico, and currently live in Meriden. I am a current TCA participant under Wheeler Clinic. I'd like to start by saying TCA has helped with finding coping skills to adulthood, for example, handling stressors and trauma responses while in public, along with understanding living alone. Thank you for supporting the TCA program and hope that you continue supporting it along with expanding it more widely through the state for other youth as well, like me, from being in a different race, ethnicity,
and also bilingual understanding. The ICA has been very kind to me by taking their time and also being respectful of our own cultural differences and accepting me as their own.
Next. Hello, my name is Michelle Duhart. I've been in the TSEA program since April of 2024. I've been in desperate need of transportation and help making appointments. And I feel like my case manager has filled in every area I've needed. They've helped with rides and even emergencies. As of right now, my next goal is becoming fully independent, living on my own in the next few months. And I feel like my case manager has helped me tremendously, and even getting into therapy, finding new healthcare providers. She's been amazing. Without this program, I will not have the support I need to be successful and achieve my goals. So I would like to continue.
Hi. Hi, my name is Garrett Dolan. I am 19 years old and I am currently a freshman at CCSU. I have been with the TSCA program for about a year and 4 months. And in that time, I've had help opening my own bank account, going through driver school. I applied for college. I got into college. I've been able to have countless opportunities, including in December, I went to DC and I talked to Connecticut representatives about the same program, TSCA. So TSCA helps emerging adults. Once most foster kids turn 18 and graduate high school, they don't have any resources. They don't have family, they don't have money, they don't have anywhere to go. So the TSCA program is basically someone comes once or twice a week and they help you set goals to become, self-sufficient, get a job, driving, housing, anything you need. And currently, the TSCA program is only available to 2/3 out of the kids in Connecticut. And as someone who has a younger brother in the system, I would like to see this expanded so that way he and other kids like him can have these opportunities in the future.
Thank you. Up next is Phil Brewer.
Not online.
Not in person either. Up next is Coco Selman.
Good afternoon. Thank you for having me. Distinguished members of the Appropriations Committee, my name is Coco Selman. I'm here today as a home health consumer. My stepdaughter, Amelia, receives 16 hours per day of complex care nursing in our home through home health services. I am also a member of the Connecticut Association for Healthcare at Home and a former home health agency founder and CEO. I'm testifying before you today to urge the adoption of a fair and sustainable Medicaid reimbursement model that adjusts annually with inflation. My stepdaughter, Amelia, is a bright and beautiful 23-year-old woman with complex medical needs. She has cerebral palsy, chronic lung disease, is a quadriplegic, is non-ambulatory and nonverbal, requires oxygen with BiPAP, and receives respiratory suctioning and nebulizer treatments every 2 hours. Amelia was born at 26 weeks and was a twin. Her brother passed away at 2 days old. She spent 100 days in the neonatal intensive care unit, enduring 3 surgeries to her heart and lungs to stabilize her condition. After bringing her home from the hospital, the challenges of addressing Amelia's needs compounded. As Amelia's condition grew more complex over time, her need for medical care increased. Before receiving at-home nursing care at age 8, she was frequently hospitalized, spending weeks at a time in the PICU. Once she began receiving in-home nursing care with increased medical interventions by skilled clinicians, her hospital visits diminished and her overall health and well-being dramatically improved. Despite her many challenges and disabilities, Amelia is a real person. She is bright and engaged. She's a young woman who loves volunteering as a service dog trainer, writes an advice column on her blog, and loves talking about boys with her 16-year-old sister. She proudly communicates using an iPad that speaks on her behalf. Thanks to nursing at home, she is thriving. Home health care has been transformative for Amelia and our family. Families with a disabled child divorce 80% of the time, spend 26% of their annual income on caregiving costs, and file bankruptcy at a much higher rate than others. When the proper structure of home health care is in place, it keeps our loved ones safe at home, and it relieves families of many challenges they face. Investing in home health care is an investment in family. Please implement a fair and sustainable Medicaid reimbursement model that adjusts annually with inflation, as described in my written testimony. Amelia and others like her deserve access to at-home care now and always. Thank you for your consideration and time. I welcome any questions.
Thank you. Up next is Anthony Barraro. Thank you. There you go. Yeah, now it's on.
Good evening, Senator Austin and Representative Walker and honorable members of the Appropriation Committee. My name is Anthony Barrero. I live in New Haven. I'm a personal care attendant. I provide care for my mother. Sorry. I'm here today to tell you about that if you guys can look into and find a way to protect and if not expand funding for the Department of Developmental Services and Department of Aging and Disability Services. They help fund important services like mine. It says when I first became a PCA, it was to provide care for my mother who was in need. She became ill and started to need care. I shifted to become her full-time caregiver. A year and a half ago, she has arthritis throughout her back and along with fibromyalgia and multiple herniated discs. She also needs 2 knee surgeries. At some point, she will be currently dismobiled. 2 years ago, my mother needed someone to be available to be around the full clock. She needed a lot of time getting to appointments and catching up to doctor's appointments. She needed an increase in care so much that I had to step up and start providing care. I started by learning from my friend's mother, who I provided care for at home. She had taught me multiple things to help with PCA help. But the struggles really started when she finding funding to stay afloat was going to be much more difficult, and I had very little help. We had to cut back on many things in the household. My mother had some debts that I had to help her out with. So it has been some struggles, and we just want I just need you to help expand the funding with the Department of Development Services.
Anything else?
No, ma'am.
Okay, thank you. You did a good job. Thanks. Up next is Stephen Colangelo. Stephen?
Not online.
Up next is Bud Myers. Is Bud Myers here? Up next is Maria Brierton.
Madam Chair, we have attempted to promote Maria several times and she has declined.
Maria, if you could accept the promotion, we could let you speak. If you don't accept the promotion, you can't speak. All right. Christina Barman online.
Can you hear me?
Yes, we can.
All right. Good afternoon, Senator Austin and members of the Appropriations Committee. I'm Christina Barman. I live in Hartford, and I'm a member of CSU AUP and part of the Connecticut for All Coalition. I'm a sociology professor at Connecticut State University. I've got a background in public health, aging, and care work, and I'm here to urge you to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 26. I also want to urge the Appropriations Committee to fund an increase in Medicaid reimbursement rates. I have both a personal and professional reason for caring about Husky eligibility for all Connecticut residents, regardless of immigration status. We all like to think of our health as an individual attribute and the result of our own health behaviors, and it is in part, but that's not completely accurate. Our health is also very dependent on the communities in which we live and the health of the people around us. The COVID pandemic is just one example of that. Expanding Husky is the moral thing to do, but it is also the most efficient, cost-effective in the long run, and best for population health for all of us to have access to healthcare. But I also have personal reasons for urging you to expand Husky eligibility. My stepdaughter's best friend in college was ineligible because of age and immigration status. So when she needed care beyond what she could get on campus, we all scrambled to find her a sliding scale clinic. The wait times were often long, and sometimes she would still get very large, expensive bills. And we would try and help her navigate that because it was really difficult, right? It was an impossible situation for a healthy young woman that just needed basic preventative care and the regular things that college students need. Finally, I've spent years conducting research in long-term care settings, and I'm terrified about the state of Medicaid right now on the national level. But it's important to increase reimbursement rates here in the state of Connecticut. Medicaid is the single largest payer of nursing homes for middle-class families. Reductions in reimbursement rates result in tangibly worse care for older adults and worse pay for care workers. These two things are inextricably linked. The conditions for care workers directly impact the care they can provide. And from my experience, care workers were amazing and were doing the best they could, but it was often under very difficult circumstances. And both the workers and the people living in long-term care need our support. So in sum, I urge you to expand Husky and increase reimbursement rates for Medicaid. Thank you for listening.
Thank you. Up next is Ashley Gagnon. Is Ashley Gagnon here? Maria Brierton. Why do we have her up again? Maria Brierton. Did she
Yes.
accept your promotion?
Yep.
Go ahead.
Yep. Good afternoon, everybody, and good afternoon, distinguished members of the Appropriations Committee, Senator Austin, Representative Walker, Senator Summers, and Representative Nucci. My name is Maria Hernandez Brereton. I am the CEO of the Community Guidance Clinic for Central Connecticut. I am a licensed social worker and have been in the field of child welfare for over 47 years. CGCCC is a nonprofit located in Meriden, and we serve the greater Meriden-Wallingford area. We serve over 600 people a year, 96% of whom are on Medicaid. Thank you for the opportunity to testify on behalf of the governor's budget. I'm here to request that you increase funding for vital nonprofit programs such as ours by $264 million and including a 6% increase for FY26. Increasing the Medicaid rates for behavioral health and annualizing the amount for FY25 ARPA. And in addition, we ask that you provide an 8% increase in fiscal year 27. We know you can't make these investments in vital services without updating the state's budget controls. The state can afford to save for a rainy day, pay down debt, and fund essential services for Connecticut residents. Please update the guardrails to fund nonprofit services. Demand for behavioral health services is higher than ever. I appreciate the increases the legislature has been able to provide and the well-deserved focus from the legislator facing the crisis facing Connecticut children. But the needle is not moving, clearly not moving fast enough. Insufficient funds and cuts in state fiscal year 24 have caused CGCC to close its Child First program, which other people have testified is a critical program, which is a program for high-risk infants and their caregivers. We were a Child First provider for over 6 years, and our funding was cut off because the ARPA funds were not made available to us by DCF. There is a shortage of clinical staff available to serve people with mental health and substance use. We are losing clinical staff to telehealth companies and private practices because the state does not allow us to pay competitive wages. We struggle with retention of staff due to our inability to offer competitive wages, and cover the fringe and benefits. Our ongoing recruitment cost for this year alone to date for state fiscal year 25 is over $20,000. Our intimate partner violence has a wait list for services, and the program should be expanded, and we're hoping that DCF will do so, but we see no increase in their budget lines. With the governor's budget proposing a small increase in the second year, will cut funding at the beginning of the next biennium. However, if the final budget provided increased funding, we would be able to start addressing some of these concerns. Increased funding would allow my agency to offer competitive wages, especially for bilingual staff, since 62% of our clientele require Spanish-speaking clinicians. Having broader access to clinicians who speak Spanish will help meet the needs of our community. And competitive wages help us in retention, which results to better continuity care. Please support increasing funding for community nonprofits by $264 million, including increasing the Medicaid rates for behavioral health services. Thank you very much for the opportunity to testify and your leadership in providing critical services to Connecticut's children and families.
Thank you. Up next is Ashley Gagnon. Is Ashley Gagnon on? Allison Sanka. Floor is yours.
Thank you. Good afternoon, members of the Appropriations Committee. Thank you for your time and attention and the opportunity to testify today. My name is Allison Chanka, and today I'm appealing to you as both a foster mom, an adoptive mom, and an employee at a nonprofit behavioral health organization. I've been a foster parent since 2019, providing care to 8 different beautiful children so far, aging from 7 weeks to 10 years, and have had the honor and joy of adopting 2 of them. All of these children come into care at no fault of their own. All of them are on Husky, and all requiring a village of support that is DCF and the many nonprofit and Medicaid funded agencies that provide them the supports for their unique trauma, including mental, developmental, behavioral, and physical health care. And as you can imagine, many of our children have utilized all of the agencies that you've been hearing from today, including the person just before with Child First. In my professional life, I work for Bridges Healthcare in Milford, Connecticut. Annually, we touch the lives of more than 3,000 individuals through our treatment programs, mental health and behavioral health and substance use, and an additional 5,000 through our prevention efforts. 70% of the individuals that we serve through our direct programs are enrolled in Medicaid. I'm here to request that you increase funding for vital nonprofit programs as laid out in the Alliance for Nonprofits requests and written in my testimony. I know that you can't make these investments without updating the state's budget controls, but I ask you, what good are guardrails if they diminish the state's ability to guard and protect our most vulnerable children who require the greatest care and support? The demand for children's behavioral health services is higher than ever. We are seeing higher acuity in the needs of the children we serve, and it's creating pressure on the system. I've seen firsthand the tireless work and detail that the staff, our staff, and the staff of those that we've worked with through my kiddos do day in and day out to support kids. I know they are underpaid and overworked, and the nature of their work is some of the hardest and gut-wrenching cases that a person could work on. This leads to high burnout and with an easier willingness to seek higher paying jobs dealing with less difficult situations elsewhere, creating a shortage in our clinical staff. Any funding cuts means less children being seen. weights being created in programs where there weren't any, and longer waits in those that had some. And as we all know, the longer you wait to apply interventions, especially these vulnerable children while they're growing and learning, the worse or more severe the outcomes may be. And remember, when we are able to help kids, everyone benefits, the families, the schools, the community. But the opposite is also true. Those same families and schools and communities will experience reverberated and compound negative effects. So I ask you to please consider an increased funding for the community nonprofits. Thank you again for your time.
Thank you. Up next is Sanindya Bahala. Hello. The floor is yours.
All right. Dear chairs and members of the Appropriations Committee, my name is Sanindya Abala, and I'm representing ROCA, an organization supporting over 100 young women ages 14 to 24 in Greater Hartford. These women face chronic trauma, violence, disengagement from education and employment, and lack of stabilizing supports. Many are involved in the healthcare, child welfare, and criminal justice systems. 83% are victims of violence, 77% lack a high school diploma, 76% have been arrested, and 70% are young mothers. ROCA provides a proven intensive intervention for these women, many referred by DCF and probation, as their last chance before serious harm. ROCA is relentless in engaging young people who are fearful and mistrusting. The core of our intervention is a non-clinical, skills-based version of cognitive behavior therapy designed for young people with high PTSD who don't utilize behavioral health care. We provide education, life skills, harm reduction, parenting, and employment supports, and just a safe space. In the past year, ROCA retained 84% of participants, 94% showed improved emotional regulation, 100% improved PTSD and depression, 93% had no new arrests, and 52% secured employment. ROCA operates 7 sites across 3 states, serving 1,800 young people annually, and we found that the violence affecting young women in Connecticut is more severe here than anywhere else, accelerating our understanding of what it takes to address this critical issue. In the past 3 years, we've had 25% of our young women who have been shot, and we lost one and her baby to gun violence in November. Please consider Sam's story. Referred by DCF in 2021 at age 18, she was born to an incarcerated mother and placed in her uncle's care, who sexually abused her until she was 12 and became pregnant. Her son was removed from her custody and she was placed in a group home. She ran from care and cycled between an abusive relationship and the streets, leading to arrests and probation. With our support, she obtained medical care, began seeing a clinician, obtained supportive housing, and obtained documents to get on food stamps and find a job. When she got her first paycheck, she owed $17,000 in child support arrears for her son. She experienced a relapse, going back to her boyfriend, losing her housing, losing hope, and refusing to engage. When other programs might have dismissed her, we held on tight and relentlessly worked to address the systemic barrier she faced, having her case reopened to clear her child support order. She is now motivated to finish high school and explore a career. We are grateful for funding in the last biennial budget, which helped us expand capacity and reduce our wait list, enhance employment programming, begin an external evaluation, and secure additional federal and private dollars. There's an urgent need to sustain this work, and I request that you increase funding for vital nonprofits like ROCA, funded under the DSS Community Services line, which was cut in the governor's budget. Thank you for your support and for considering this request.
Thank you. It's nice seeing you again. Up next is Anna Malavisa.
Thank you very much. Can you hear me?
We can. Go ahead.
Dear chairs and members of the Appropriations Committee of Connecticut General Assembly, my name is Anna Malavisi, and I'm an associate professor of philosophy at Western State Connecticut University, and the current coordinator of the Undocumented Ally Task Force, which is a campus-wide effort centered around undocumented student needs, as well as the needs of students with undocumented family members. Thank you for the opportunity to testify on HB 6864. I'm here in support of increasing funding for Husky and ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 26. We recognize, and there is much gratitude to the state government for making Husky accessible to children up to age 15 and pregnant individuals. But this is not enough. Those between the ages of 16 and 26 years also need access to healthcare. Many of my students belong in this category, and many are still dealing with post-pandemic mental health issues, now compounded by increased anxiety due to current federal government changes and threats. Healthcare is a human right, not a commodity. When something is perceived as a commodity, it is contingent on the market, buyers and sellers. Sellers who are dependent on buyers and are concerned with the economic benefits of their product, that is, profit. It's no coincidence that insurance companies, many of them based in our state, profited by millions during the pandemic. This is the wrong way to understand healthcare. Healthcare is not something to be bought and sold. It is a right that all residents of Connecticut should have access to. The state has an obligation to provide access to good quality healthcare to all its residents. Most young undocumented people came to the US with their parents, oftentimes as very young children. Many of them do not realize that they are undocumented and what that means till the doors are closed in front of them. These young adults have no clear path to citizenship, so are ineligible for any other type of healthcare support. The only option available that is possible for them is Husky. The costs of extending access up to 26 years of age for the state is negligible compared to the benefits provided to these young people from access to preventative care, etc. Students who don't have access to healthcare cannot flourish at university. When they get sick, they put off going to the doctor for fear that they cannot afford it, but also for fear of being detained. This results in them missing classes, falling behind in their coursework, and not being able to achieve their lifelong dreams. The need to provide access for these students is as urgent as ever. Increasing eligibility to Husky to all income-eligible immigrants up to the age of 26 is a key policy to advance equity and public health that legislators can do this year. It also gives human dignity to those who too often are deprived of it. Thank you for your time.
Thank you. Representative Exum, are you ready to take over? We are at number 118 will be the next one. And I would like to remind anybody who's at a number 243 or higher, you would be here after midnight if you are here to testify in person. If you are at 243 and higher, I encourage you to change your presentation to a remote one, because you would be home speaking, not here. Go ahead, Tammy.
Next, we have Megan Gorman. And I think I see you online, followed by Catherine Bradley.
Yes. Hello, I'm online. I can take it everyone can hear me. Okay, I see my big face on the screen. There we go. Members of the committee, good afternoon or good evening at this point. My name is Megan Gorman. I'm the Community Engagement Coordinator for CMHA, Community Mental Health Affiliates. I believe this is my 6th or 7th hearing just in the past week, testifying before many of you already and again. I am here for the same reason, to implore you all to seriously reconsider the fiscal constraints of the governor's budget, HB 6864, in regards to funding for nonprofit human services. My organization serves upwards of 7,300 individuals a year across central Connecticut, with at least one individual from every municipality. Our services vary from inpatient and outpatient residential services, homelessness, outreach, providing behavioral health supports to children directly in schools, working directly with law enforcement officers as community intervention specialists to deal with behavioral health crises in the community. I say all that to remind you of just how integrated we are into our communities. We are sponsors of local softball and baseball teams. We participate in downtown safe street events. We are constantly showing up for our community and doing all we can, despite chronic underfunding and decreases of funding. In terms of the governor's budget, there are no new dollars allocated for nonprofits. And we have to be realistic about the fact that one-time ARPA funding dollars were used to give an infusion, a blood transfusion, if you will, to many struggling nonprofits across the state. And the governor's budget is an effective decrease for nonprofit funds in fiscal year 26. And while there's a small increase for fiscal year 27, I truly don't believe that many nonprofits will survive to that point. The need has only increased in our communities, and there is no relief in sight. There are other bills concerning bond funding that needs to be made available to nonprofits because that is at risk of being taken away. So the trends that we see are that the few lifelines we do have to rely on are being pulled back very aggressively. I shared in a previous Appropriations Committee meeting that due to the time and the nature of how many hours you all are going to be here, I understand there are no questions being asked. But I encourage you to think in regards to this. How do we do it? The nonprofits you see come before you, the citizens, the people who are foster parents, the individuals who volunteer, who head up these agencies. I don't know how we do it day in and day out. We know how to balance a budget. We are consistent in making sure that we get the most out of every dollar that we have for the sake of our clients, for our staff, and our communities. But we cannot continue to suffer in this way. I understand the importance of paying down a debt as that will ensure better financial health for our state down the road, but we have very real behavioral health and physical health issues that are not being addressed for many of our residents. It is a bleak situation, and I want to be hopeful, and I want to hope that all of you can agree to work across the aisle and address these fiscal guardrails for the benefit of those individuals in our community who cannot wait any longer, for those who are unhoused, for those that are chronically ill, for those that are an undue burden on emergency rooms and law enforcement because they do not have other options. Let us help you. Let us help your constituents, and let us adjust the fiscal guardrails to make sure that we don't have to keep coming back to these hearings and keep having to ask you for the same hundreds of millions of dollars that are rightfully owed nonprofits over the course of several decades, longer than I've been alive.
Thank you so much, Ms. Gorman. Could you please summarize?
Perfect timing. I will leave you with this. I thank you all for your time and dedication. I know you're sitting there because you do care, but I ask you to act it and vote upon it and make these changes. Thank you.
Thank you so much for your testimony. Have a good evening.
You too.
Next, we have Michael Patata, followed by Jocelyn Theocamuco. I'm sure I mispronounced that. 119. Oh, really? Oh, I'm sorry. Kathleen Bradley. I'm sorry. Kathleen Bradley, followed by Michael Patata. Kathleen Bradley.
Oh, get up.
You can stay there.
Hi, yes, I'm here.
Okay, thank you.
All right. Hi, my name is Catherine Bradley, and I am from Stamford. I am a social worker and a supporter of the Husky for Immigrants Coalition. Thank you for the opportunity to testify on the budget today. I'm here in support of increasing funding for Husky, and I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. And I'm also here in strong support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. This is the fourth legislative session in which I have submitted testimony in support of expanding Husky coverage for undocumented immigrants. And while I appreciate that this chamber has expanded access to children ages 0 to 15 and to those in need of prenatal and postpartum care, the reality is that the need for health coverage does not magically disappear at a certain age. The state of Connecticut must develop a sustainable and long-term plan to grant all undocumented immigrants in our state access to care. This issue is important to me as a social worker and a former healthcare employee. I previously worked in a physical therapy office where people of all ages receive physical therapy from everything from broken bones to joint replacement. But without insurance, just 6 sessions would cost $1,020. For these patients, physical therapy is necessary in order to avoid increased pain and decreased mobility. But for many undocumented immigrants, that care is out of reach due to the prohibitive out-of-pocket costs. Appropriating funds to expand Husky access would be a massive step in healthcare equity. Extending care to people up to age 26 would ensure an additional 7,700 Connecticut residents and match the age bracketing of the Affordable Care Act. And though my support for this bill stems from my fundamental belief that healthcare is a human right, there are several statistics in support of this bill as well. In 2024, over 450 healthcare professionals signed a letter in favor of Husky expansion. Additionally, expanding insurance coverage could save the state money from uncompensated care costs and running the state's emergency Medicaid program. Funding Husky expansion makes political, financial, and most importantly, moral sense. In conclusion, I support increasing Husky eligibility to age 26, regardless of immigration status, and I ask the committee to appropriate the needed funds. I also ask the committee to fund an increase in Medicaid reimbursement rates. Thank you for your time and consideration.
Thank you so much for your testimony. Have a good evening. Next, we'll have Michael Petoda, followed by Jocelyn Tiakulmunko.
Good, thank you.
Thank you.
Good afternoon, Senator Olson, Representative Walker, and members of the Appropriations Committee. My name is Michael Petoda. I'm the president of and CEO of the Child and Family Guidance Center. It's also my distinct honor to be on the Transforming Children's Behavioral Health Committee. I honor your leadership on that. I think we're making real headway, and I look forward to continuing to work with this committee. Child and Family Guidance Center was founded 100 years ago, and our mission is to provide culturally informed mental health treatment and complementary supports to children and their families regardless of ability to pay. Our services include mental health treatment, mobile crisis services, and home treatment to families in Greater Bridgeport and Greater Norwalk. Last year alone, we provided these services to over 3,000 children, most of whom have experienced complex trauma, sexual abuse, physical abuse, witnessing community violence, or witnessing domestic violence. Most of the families we serve are poor, lack affordable housing, and reliable transportation. 90% of the families we provide treatment to are Medicaid eligible. Thank you for the opportunity to testify on the governor's budget. I'm here to request that you increase funding for nonprofit programs and annualize the full amount of the FY25 ARPA funding. My testimony is going to mirror that of Dr. Kanada, Heather Gates, and other providers of mental health treatment here in the state. I've been at the center for almost 10 years. In that time, we've received one increase in Medicaid rates in 2021. As I'm sure you're aware of the Medicaid rate study, which demonstrated that Connecticut's reimbursement rates for nearly all behavioral health services are significantly lower than states of similar economic and geographic makeup. As others have testified to, there's a causal relationship between the children's mental health crisis and having highly trained clinicians to meet their needs. In Connecticut, there's a shortage of clinical staff available to serve children's behavioral health needs. Our staff is composed of 125 committed bachelor's level and master's level clinicians, most of whom are bilingual and bicultural. As others have pointed out, bilingual counseling represents a critical step forward in making mental health care accessible and effective for diverse communities. By bridging language and cultural gaps, these services not only improve the quality of care, but also empowers individuals to seek help confidently. We're losing clinical staff to school districts, hospitals, state agencies, and private practice. I'm requesting increases in Medicaid rates for behavioral health services to be able to afford clinical staff at market rates to keep our programs open. Thank you so much.
Thank you so much for your testimony, and thank you for serving on the TCB as well.
My pleasure. Thank you.
Appreciate that. Thank you. Next, we'll have Jocelyn here. So we'll go next to Heidi Sarkhan. I am butchering names. Heidi, is she online? Number 123? No. Okay. Elaine Balsley? Yes.
Balsley, yes, hi.
Hi, good afternoon.
Dear esteemed members of the Appropriations Committee, my name is Elaine Balsley, and I'm the director of a Birth to 3 program in the Greater New Haven area. I appreciate that a Birth to 3 increase is in the governor's budget, but I'm really concerned about the proposed tiered system. It will actually have a negative impact on hiring and retaining staff. As you know, the workforce is our biggest issue. I'm going to illustrate this point with an interview scenario. Thank you for coming in for an interview. It's wonderful you have 20 years of experience in early intervention as a speech therapist in Massachusetts. We really need a speech therapist. The requirements to be an early interventionist, Connecticut starts with you getting your birth to 3 initial certificate, which is 8 hours of webinars. Then your service coordination certificate, that is observations in the field, a full day training, more webinars, and a test. Then we would sign you up to become a family coach. That is a 2-day training and 6 months of TA until you are at Fidelity. Now, and after you finish that, you will be considered an entry-level 1 professional. Your salary is based on what level you are at because the levels are reimbursed differently. How do you get to the next 2 levels of reimbursement so that you receive a better salary? Well, did you have Social Security training 15 years ago and you no longer have the certificate? You'd have to repeat it. You could also get your infant mental health credential. I have it. It's difficult and it takes quite a while. Or you could become a mentor coach, but that's probably 1.5 years to 2 years away. Then you could be at professional level 2. How do you get to the top tier? You have to get your early intervention specialist credential, but that might take years. Among all 1,000+ interventionists last year, 15 took the exam, 10 passed, but they are still completing their observation. No one is currently an early intervention specialist. It's new. And actually, no, this will not count towards your continuing education requirements for your license as a speech therapist. I hope you consider birth to 3. I have an interview with a physical therapy doctorate tomorrow with 5 years of experience, and then a BCBA with 20 years of experience like you. Yes, they will all be at entry level 1. It does seem unfair. We used to have salary scales that were based on years of experience and level of education licensure, but now it's based on this tiered rate. Many of my current staff who have a combined average of 18 years in birth to 3 are working on getting to level 2. I've been a therapist for 33 years and I'm at level 2 because I have an infant mental health credential. The good news is if you have a friend with a bachelor's degree in a related field, and then you complete this early intervention specialist credential, you will receive the highest level of reimbursement as a professional. No, they don't need a license, nor do they need to be board certified. These are the real life consequences of this tiered rate. Please support the increase in birth to 3, but keep the current tiered professional and non-professional rates increased to reflect the amount that was appropriated in the budget. Thank you so much for your time and your consideration.
Thank you so much. I really appreciate that. Have a good evening.
You too. Thank you.
Next, we'll have Joelle Fishman, followed by Gary Weisenred.
Good afternoon, chairs and members of the Appropriations Committee. Can you hear me?
Yes, thank you.
Great. My name is Joelle Fishman. I live in New Haven. I'm testifying today for the Connecticut Communist Party supporting Husky for Immigrants Coalition. I urge funding Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. Last year, when the eligibility age was raised to 15, we were coming out of the COVID-19 pandemic, which revealed the need to strengthen our healthcare system overall and also exposed long-term inequalities of race and economics in healthcare and all areas of life. Raising the age has produced positive results, including access to preventative care and therefore lower costs overall, showing that all those who are income eligible should be covered. This year, there is new urgency to expand Husky to guarantee that we will move forward and not back in a changing national climate. Over half, 52% of approximately 120,000 undocumented immigrants in Connecticut have no health coverage. Denying access to healthcare coverage for some endangers the well-being of all of us. We should take note that the state and local taxes paid by undocumented immigrant workers contribute toward funding Husky. In 2022, it was estimated undocumented immigrant workers paid $406.4 million in state and local taxes. It's unjust that those whose taxes contribute are excluded from coverage. I'm speaking on this aspect of the budget and human needs today in the context of support for the entire equity agenda put forward by Connecticut for All. It's become common to say that healthcare is a human right, but the challenge for all of us is to make that a reality. Including the entire immigrant community in healthcare programs, irregardless of status, will make our state a stronger and healthier place for everyone. Please take the next step and include Husky expansion to age 26 in this year's budget. I also join in urging an increase in Medicaid reimbursement rates so everyone in Connecticut who depends on Husky can have better access to care, and also increase funding to community health centers. And I appreciate the work and care of your committee. Thank you.
Thank you so much for your testimony. Next, we will have Gary Winsenred, followed by Pamela Fairley. I see Gary. Yes. Thank you, Gary. Oh, I can't hear you, Gary. I see. Gary, I'm sorry. Could you log out and then log back in, and we'll put you through once you come back in? Thank you. Do you want me to go? Is Pamela Fairley available?
Yes. Are you hearing me?
Yes, please. If you'll go ahead and start, and we'll go back to Gary next.
Okay, thank you. Good evening, Senator Osteen, Representative Walker, and honorable member of the Appropriation Committee. I'm not sure if you're the ones that's still there. I was there earlier today. My name is Pamela Fairley. I live in Bloomfield, and for the past 2 years, or a little more than 2 years, I've been a personal care attendant. It's a job I really love because I love taking care. Because of that, I'm here today to request that you support expanding funding for Medicaid services to make all our lives just a little bit better. I got into healthcare years ago, initially as a dietary aide and cook at a facility, but switched to being a PCA because I enjoy personal one-on-one connection I get to build with my consumer. It reminds me of my dream growing up, to give the best care possible to those around me. Becoming a PCA also gave me a voice in all previous roles. As I worked in the facilities, I worked without a union. I was underpaid, underappreciated, and told my opinion did not matter. Switching careers was the best decision I've ever made. Since becoming a PCA, I've seen some improvement in life. My pay is going a little bit further. I had paid time off and I got a handful of holidays. It gave me a glimmer of hope that we were being respected for what we did. However, the ever-changing economy is hurting us now more than ever. Our paychecks just don't go as far, and I'm worried when it's time to really retire, because I am partially retired now and still have to be working. To retire, my Social Security just won't cover the bills. I've worked in this country for almost 30 years, and I feel I have nearly nothing to show for it. In these uncertain times, I'm worried about what will happen to me when Medicaid funding cuts hit our state, or will my consumer get the same care they need? How will I afford to put food on my table, let alone save for my future? That is why we need your help. Ensure Medicaid services like mine and fully funded in your upcoming programs. So I'm here not just for this part, but to ask for the legislators to put the SB 1221 with addressing lack of benefits and providing PCAs with a retirement plan that they can invest in. I thank you for listening. God bless.
Thank you so much for your testimony. Gary, I see that you're on. Oh, no.
Gary, we still can't hear you. If there's a different device you could use, that might be the best.
Next, we will have John Stakely, followed by Jacqueline Kelly. And Gary, whenever you come back, we will put you through. Good afternoon.
Good afternoon, honorable members of the Appropriations Subcommittee on Human Services. My name is Jonathan Stakely, and I'm a personal care attendant from Gales Ferry. I'm here today to strongly urge you to protect and expand funding for Department of Social Services, which funds home care providers like me. For so many, being a PCA means sacrificing income security and health benefits. I'm lucky enough to provide care for my brother who requires unique care and assistance doing things that you and I take for granted. In fact, his very survival depends on care. My brother's previous caregiver was wonderful, like family to us. But when you want to start a family of your own and you're left to make difficult decisions, like leaving a job you love for something with higher wages and health care. Unfortunately, in this field, you see a lot of caregivers come and go. Low wages and expensive health benefits make it hard to stay. Not to mention the work itself can be draining. As home care workers, we deal with stress physically, mentally, and emotionally. Even caring for a loved one, my brother, I sometimes face internal struggle knowing I could make significantly more money in another job. Unfortunately, caring for my brother is my priority. Ultimately, caring for my brother is my priority, and I'm willing to stand up for what we as caregivers deserve in hopes of bettering the lives of not just myself, but my family and my PCA colleagues. To address the issues in my field, we need investment in the form of funding for social and human services. Connecticut must budget accordingly because we know it's not coming from the federal government. I urge you to see the value in the work we do as PCAs, the work that we devote ourselves to day in and day out. Be proactive, plan for Connecticut's future, and support working people because we can't wait any longer. Thank you for listening.
Thank you so much for your testimony, for your time today. Next, we'll have Jacqueline Kelly. Oh, I'm sorry, Jacqueline, just one moment. Gary, let's see if we can hear you.
Can you hear me now?
Oh, wonderful. We can hear you now.
Well, thanks for sticking with it. I appreciate that. Co-chairs Austin and Walker, co-chairs Gilchrist and Lesser, Vice Chair Exum, thank you for the opportunity to provide this public testimony. My name is Gary Winsenreed, and I'm the President and Chief Executive Officer of Cordata Healthcare Innovations. In my written testimony, you can read about our involvement in Connecticut with the CLEAR initiative and the role we play, but I'm here today to help inform you about the very tangible value these types of deflection programs provide. Cordata has been involved in similar programs across the U.S. since 2017. One of those programs we have worked with for years is in Montgomery County, Ohio, and includes a partnership with a data sciences company. This company has interfaced all the medical record data from the 3 major hospital systems in the area, as well as the criminal justice data from the city and county public safety resources. They recently did an interesting evaluation of the deflective work in the county that I want to share. The premise of the evaluation was, for every person our deflection teams had contacted and engaged, could we look at the healthcare costs the 12 months before first contact and compare that total to the healthcare cost for the 12 months after? Similarly, were there differences in police interactions, EMS runs, arrests, violent crime, incarcerations, etc.? The results, just published in late 2024, are astounding. First, the evaluation showed that there's a significant and direct correlation between these first interactions with deflection teams and changes in all these metrics. Most importantly of all the results, death rates went down from 8% to as low as 2.5%. These programs save lives, period. But that was not all the value the evaluation uncovered. The data also showed a strong correlation to reduced arrests, fewer interactions with law enforcement, and less violent crime in these populations. These programs also make communities safer, and since they reduce or stop the redundant interactions early responders have with those struggling with an untreated disease, they free them up to be available to other constituents or to work proactively in improving the community rather than constantly reacting to emergency situations. The headline, however, is that healthcare billable costs went down by between $17,000 and $42,000 per person per year. 65% of this population are Medicaid recipients. Another 8% or so are uninsured. So essentially 3 out of 4 of these dollars that can be saved come from the taxpayer. If we accomplished similar results by investing in deflection programs similar to CLEAR across the state of Connecticut, the data says we'd likely save $500 million or more in Medicaid expense without reducing coverage for anyone. We are very proud to be a part of the CLEAR initiative with our partners on the ground in Connecticut. The teams on the ground are fantastic, and the culture of collaboration they have created in their communities, which includes referring people to many of the nonprofits whose testimony preceded mine, is as good as we've seen in the United States. I just wanted you to know that besides being good people doing good work with good intentions, this work is extremely valuable to all of Connecticut. Today, the sustainability of this work relies upon winning federal grants every 3 years. In our opinion, it is too valuable to be reliant on time-limited grants and the whims of federal funding. For a very small investment from the state operating budget or from opioid litigation funds, these teams could and should be expanded and sustained across the state. Thank you for the opportunity to testify today.
Thank you so much. Really appreciate your testimony. Have a good evening.
Thanks for having me.
Next, we'll have Jacqueline Kelly, followed by Crystal Croteau. Okay, moving on. Next, we'll have Bobby Cindy Jackson, I'm sorry. Followed by Bobby Burial.
Thank you. Senator Austin, Representative Walker, honorable members of the Appropriations Committee, Senator Exum, and Senator Lesser. My name is Cindy Jackson. I'm representing Birth to Three. I'm also chairperson of the Birth to Three Interagency Coordinating Council. I appreciate the inclusion of funding for Birth to Three services in the governor's budget. However, there's 2 areas I'd like to address. I strongly oppose the proposal to remove the general administrative payment from statute, which includes a $1 million budget reduction. This payment is based on the number of children seen in that month for programs and was established when Birth to Three moved to a fee-for-service system because much of what we do happens outside of the actual visit and is not billable. The gap is essential to maintaining the operational integrity of Birth to Three programs. It supports compliance with state and federal mandates, staff training, coordination of services. We work with DCF and many other agencies and family outreach. Furthermore, the OEC rate study recommended 2 options to bring provider rates in line with business costs. Both recommendations were calculated with the $200 gap payment in place. Eliminating or reducing the gap contradicts the study's findings and would probably have warranted a higher recommended rate increase had that been considered. Secondly, I strongly oppose the 5-tier rate system. This will negatively impact recruitment and retention of staff, and that's kind of why we're here asking for the increase. Workforce challenges are intensifying. Currently, Birth to Three faces a 16% turnover rate driven by non-competitive salaries. We can't meet the needs of children with intense needs. 2018, children with autism got 37 hours on average. Today, they average about 11 hours. We just don't have the staff. Our agency employs 48 of whom are licensed clinicians with master's and doctoral degrees as required in our personnel standards. Recruitment and retention is hindered by salaries insufficient to attract these highly qualified advanced degrees that can go in all different places to work. The OEC proposed expanded tiered credentialing system, which may take up to 3 years to reach break-even reimbursement rate, further de-insensitizes employment in Birth to Three. We will not be able to attract or retain highly qualified staff required under IDA federal requirements and our OEC personnel standards. I urge the committee to do 3 things: protect the gap payment by retaining the statute and reversing the $1 million reduction, apply the governor's proposed funding increase to the current tiered rate system, which has a professional and paraprofessional level, without adding further tiers that complicate budget predictability, further instability of the system, and the workforce shortage. Thirdly, establish a scheduled review of Medicaid rates to ensure long-term financial stability for birth to 3 providers. Investing in early intervention saves Connecticut millions in long-term special education costs and ensures that young children receive critical services they need to reach their potential. We appreciate your support in the past and thank you for your consideration of these vital issues.
Thank you so much for your testimony.
Thank you.
Next, we'll have Bobby Barrialt, followed by Caitlin Ogilvie.
So Bobby is joining us via the phone. Bobby, are you able to unmute yourself?
Yep, I'm here now.
Perfect.
Good afternoon. My name is Bobby Barrial, and I'm testifying in opposition to Governor Lamont's proposed budget proposal, which would eliminate the annual increases in asset and income limits in the MedConnect program. As someone with autism, the MedConnect program is really helpful to me because it allows me to live independently and to be able to be successful in both my vocational goals as well as just being able to live while maintaining health care. The health insurance that I receive through MedConnect is important to me because it allows me to be able to ensure that both my physical health and my mental health is cared for, and I'm able to receive all the services that I need in order to be successful in life. However, Governor Lamont's proposal that he submitted would eliminate the annual increases in the asset and income limits that the General Assembly passed in 2023, and his proposal would also eliminate the phasing out of the income and asset limits, which will due to take effect in 2029. I do want to be clear on one thing. I despite the fact that I have autism, and I do want to reiterate the fact that I wish I didn't have autism. I certainly wish I could be like everyone else who didn't have autism, but having autism, I certainly want to do my best to be successful in life, and the MedConnect program is an extremely valuable tool in helping me be successful. But having limits in income and asset limits would force me to choose in between a higher paying job, which would allow me to eventually reach financial success and health insurance. And so with that being said, I certainly hope that the committee votes to strike the portion of the proposal which would eliminate the income and asset limits. Thank you so much for taking time to hear my testimony. I hope you all have a good day.
Thank you so much, Bobby. Really appreciate that testimony. Have a good evening. Next, we'll
You
have
too.
Caitlin Ogilvie, followed by Judith Sherman.
Good evening, Senator Austin, Representative Walker, and esteemed members of the Appropriations Committee. My name is Caitlin Ogilvie, and I'm a resident of Gales Ferry. I'm also a licensed clinical social worker and have been working in the state of Connecticut for almost 18 years. I'm a service director at CHR, overseeing child outpatient, school-based services, and several community-based programs. CHR is a community-based agency providing child and adult mental health and substance use treatment, supported housing and employment, foster care, just to name a few of our services that we provide to 20,000 residents of Connecticut and their families annually. I want to thank you for the opportunity to testify on House Bill 6864, the governor's budget. I'm here to request that you increase funding for vital nonprofit programs like these by $264 million in fiscal year 26, including a 6% increase and increasing Medicaid rates for behavioral health and annualizing the full amount of that fiscal year 25 ARPA funding appropriated by legislature. In addition, we ask that you provide 8% increase in fiscal year 27. The state can afford to save for the rainy day and pay down debt and fund essential services for Connecticut residents at this time. Across the state, outpatient clinics and other DCF-funded mental health programs are seeing concerning and unprecedented vacancy rates. My child outpatient and school-based clinics averaged about a 30% vacancy rate in fiscal year 24. Hiring and retaining staff has been challenging as we can't compete with the lure of private practice or state jobs and other for-profit positions. Job candidates right out of school are requesting and seeking over $70,000 a year to be able to pay off their exorbitant student loan debts, rent, and just live. However, the average starting salary for most clinicians in a nonprofit is nowhere close to what they're asking. When positions are vacant in programs such as child outpatient, it means there is less access for Connecticut's children and families to receive life-changing and sometimes life-saving therapeutic interventions. The mental health safety net for Connecticut's children is in a dire way. You've heard testimony today about clinics needing to close due to the impacts of low reimbursement rates and funding that is not matching the demands that are out there for salary. Children and families are sitting on wait lists for all levels of care due to vacancies and inadequate staffing. I want you to take a moment to imagine that your child is in need of mental health services, and you call and you find yourself being met with waitlist after waitlist, and you finally find a community mental health center who's able to provide you with an intake. You go to that intake, finally feeling hopeful. You begin therapy with your child, but about 5 sessions in, the therapist leaves the organization, and you're reassigned, and you have to start all over again. And that starting all over again, you're rebuilding trust and relationship with this new therapist. And maybe they can't see you as often because they absorbed the rest of that caseload of the clinician that left. And now your progress slows, and so you just stop attending. Many of the children and families we service have experienced things like trauma and loss. And the key to treating people who experience trauma is to create a consistent, predictable space to process their trauma in the context of relationship. When people leave citing reasons of salary and administrative burden, our practice becomes an unpredictable place where there's loss of relationship and we're impeding the healing. Connecticut's children are Connecticut's future adults, and their future depends on us making ethical and moral choices to fund services that support their whole health. So I ask that you please increase funding for community nonprofits by $264 million and raise Medicaid rates. Thank you for the opportunity to testify.
Thank you so much. I appreciate your testimony. Next, we'll have Judith Sherman, followed by Kim Duran. Don't have Judith. Oh, looks like we don't have Judith. Okay. Kim Duran.
Hello, good afternoon, distinguished members of the Appropriations Committee. My name is Kim Durand. I am the Hospice Program Manager at Day Kimball Health at Home with over 38 years of experience as an RN. Day Kimball Health serves the Northeastern Connecticut community where 42% of our population relies on Medicaid. We are the primary healthcare provider in this rural area where healthcare options are approximately 45 miles in any direction. For over 20 years, low Medicaid reimbursement rates have significantly impacted access to care in our region. A recent example involves a patient that I recently spoke with. We'll call him Joe. He had been away from home for 2 months at a hospital and rehab. When it was time for him to return home, the rehab facility could not find an agency to accept his Medicaid insurance due to lack of resources. Joe told me, "I'm seen as a subhuman as I'm not able to work and have private insurance." This illustrates how inadequate Medicaid rates prevent vulnerable patients like Joe from receiving care where they want to be most, at home. In a rural area like Northeastern Connecticut, where resources are already limited, collaboration between skilled, non-skilled agencies and families are vital to ensure safe care plans. However, the current Medicaid rate makes it difficult to hire and retain staff. The 26% wage increase for personal care attendants last year, combined with the rising minimum wage, are not supported by Medicare, leading agencies to closures and mergers. As a result, we are facing a growing crisis, more people needing care and fewer providers able to deliver it. What we need are sustainable Medicaid rate structures. We're looking and asking for a 10% increase for all visit codes for 2025, a 10% increase for 26 through 29 to help stabilize and retain staff. We're asking to eliminate the 50% subsequent visit rate. We're asking to increase the behavioral health medication rate by 15% and restoring the rate to the prior level in 2016. and implement an add-on rate for these high-risk cases like Joe. If we do not act, we risk losing clinicians to neighboring states that offer significantly higher pay, leaving our community without the necessary providers. In a rural area like Northeastern Connecticut, we just cannot simply afford to lose one more. In conclusion, we urge the Appropriations Committee to align Medicaid rates with the true cost of care to safeguard access to home care services, which are the most cost-effective option for many individuals, especially our population. I thank you for your time and consideration, and I'd be happy to answer any questions you may have. Have a good afternoon.
Thank you so much. Have a good evening. Next, I'm going to ask Jessica Robles, 136, along with Stefania Nipari. If you
They may not be logged in yet. We may need to do 141 and 136 at the 141 slot.
Okay, all right. Let's hold off. If the two of you though could prepare to present together when we get to number 141. So at this time, I'll go to Frank Vesky, followed by Christian Damiana.
Okay, good afternoon, members of the committee. My name is Dr. Francis Vesky. I'm a licensed chiropractic physician practicing in New Britain since 1994. I've served as past president of the Connecticut Chiropractic Association and am representing the association today with my testimony in favor of HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027, and making appropriations therefore. During this time, it's become increasingly evident that the treatment of a patient with Medicaid / Husky as their only insurance carrier is woefully under reimbursed as compared to a patient under Medicare. As a matter of fact, Connecticut was shown to be lower in reimbursement for chiropractic than 5 benchmark states, the DSS consultant study showed. A chiropractic physician treating a Medicare Husky patient will typically bill the CPT code 98940, which represents a 1 to 2 region spinal manipulation, or 98941, which represents a 3 to 4 area spinal manipulation. These codes are reimbursed under Medicare at $23.14 and $35.60 respectively, while Medicaid and Husky, or Medicaid / Husky reimbursement is $15.12 and $20.72 respectively. As a result, chiropractic physicians in the state are reluctant to become participating providers in the Medicaid / Husky program or have disenrolled from the program altogether. Legislative leaders have a plan to phase in an increase in the reimbursement of chiropractic spinal manipulation equal to 80% of the Medicare rate. This reimbursement increase, coupled with the recent reimbursement of evaluation and management codes when performed by a chiropractic physician, will no doubt be an incentive for more chiropractic physicians to participate or to even re-enroll as participating providers in the Medicaid Husky program. The chiropractic profession in the state endorses that concept and asks that it be funded in the budget that you are now considering. Thank you very much.
Thank you very much for your testimony. Have a good evening.
You
Next, we'll
too.
have Christian Damiana, followed by Ann Olson.
Good evening. My name is Christian Damiana, and I'm the Public Policy Manager at Mental Health Connecticut, a direct care and advocacy organization that has provided essential mental health services across the state for more than a century. I'm here today to urge you to invest in Medicaid behavioral health reimbursement rates and fully fund the nonprofit services that thousands of Connecticut residents rely on. We stand in full alignment with the Alliance's request for $264 million increase in FY26, including a long overdue increase in Medicaid rates for behavioral health. Without these investments, the state's nonprofit mental health system will continue its slow motion decline, one that has already led to workforce shortages, wait lists, and service reductions. The governor's proposed modest Medicaid increase does not go nearly far enough to address the chronic underfunding of behavioral health care. The Office of Health Strategy's 2024 Payment Parity Report revealed what we have long known. Medicaid reimbursement rates for behavioral health significantly lag behind commercial insurance. This is not just an oversight, it is a fundamental failure to recognize behavioral health as an essential part of overall health. It also revealed another interesting fact. Within Medicaid, mental health services are paid roughly the same as physical health care. Connecticut should be proud of this achievement, which is certainly not reflected in the commercial insurance market. We recently testified before the Public Health Committee on our bill to require a biennial study of reimbursement rates across Husky. This bill will require modest funding, but the disparities it highlights should make one thing clear. Medicaid rates are a core piece of Connecticut's behavioral health access problem. While this funding does not fall within human services agencies, the report underscores the urgency of addressing Medicaid underpayment as part of the state's broader effort to improve behavioral health equity and parity. Nonprofit providers cannot sustain care at these rates. Our sector is hemorrhaging clinicians to higher paying employers because Medicaid rates simply do not allow us to pay them competitively. At MHC, we have critical vacancies that remain unfilled, not for lack of demand, but because we cannot compete with hospitals, school districts, and the state. Medicaid funds a portion of MHC's Robinson House, a live-in home for deaf or hard of hearing residents with mental health conditions in West Hartford, and targeted case management services. These programs are essential, yet without proper investment, their sustainability is at risk. Failing to invest in Medicaid rates is not just a budget decision, it's a moral choice with real consequences. Without action, Connecticut will continue to see mental health providers shut their doors, workforce shortages worsen, and residents forced to seek care in emergency rooms or go without treatment. The state cannot afford to ignore this crisis any longer. Investing in behavioral health is not just the right thing to do, it is the fiscally responsible choice that will save lives and money in the long term. Thank you.
Thank you so much for your testimony and for waiting here. Next, we'll have Ann Olson, followed by Jason Jakubowski.
Good afternoon, distinguished members of the Appropriations Committee. My name is Ann Olson, and I am speaking as a member of the Government Relations Committee with the Connecticut Association for Healthcare at Home. I have been a registered nurse for 43 years and have been in leadership roles in home health care for 33 of those years in 5 of the largest agencies in Connecticut. I've spoken with this committee several times. There's 2 of me on this. Oh my goodness. I'm privileged to speak with you today regarding the unsustainable shortfall with the home health Medicaid reimbursement. I joined Yale New Haven Health at Home as executive director in 2023. And although I'm not speaking on behalf of Yale New Haven Health System, I know firsthand that Medicaid underfunding causes financial and access issues. Many home health agencies have had to restrict the number of Medicaid patients they serve because of this underfunding. Yale New Haven Health at Home is now caring for a higher percentage of patients insured by Medicaid. Currently, it's increased from 18% to 25%. There is a loss of $1.3 million to care for our Medicaid patients. We care for a large volume of behavioral health vulnerable patients in high-risk areas, providing 67,000 medication administration visits at the inadequate Medicaid rate established in 2016. 2,100 of those visits are paid at the subsequent visit rate, which is half of the usual $53.78 or a mere $26.89 per visit. I recognize that balancing the state budget is challenging, though respectfully request that home care Medicaid under reimbursement be addressed in the new budget. And I strongly urge your support of the Connecticut Association for Healthcare at Home recommendations. A 10% Medicaid increase for all visit codes, 15% increase in the behavioral health medication administration rate, elimination of the 50% reduced subsequent visit rate, and implementation of an add-on rate for high-risk cases so that we can afford to keep our clinicians safe. Thank you so much for the opportunity to speak today, and I wish you all a blessed, wonderful evening.
Thank you so much, and the same to you. Thank you.
Thank you.
Next, we'll have Jason Jakubowski. Hi, Jason.
Thank you, Representative Exum. Always good to see my representative sitting in the chairman's seat. I am Jason Jakubowski. I'm the president and CEO of Connecticut Food Share. We are the statewide food bank serving a network of 650 food pantries, meal programs, shelters, and mobile food pantries in every legislative district here in the state. I'm here today to urge you to increase the state support for the Connecticut Nutrition Assistance Program. CTNAP is a 20-year-old bipartisan food assistance program created by a Republican governor and a Democratic legislature, because when you're hungry, no one asks or cares who you voted for in the last election. Under both the existing statute and the provisions of House Bill 7021, the monies appropriated to Connecticut Food Share for this program can only be used to purchase food in bulk for our local pantries. We cannot use the money for overhead. We cannot use it for salaries. We cannot use it for benefits. We cannot use it to buy trucks. We can only use the funds to buy food. In addition to our proposal, and as also noted in the governor's proposed budget, we are also recommending a requirement that 15% of the state's appropriation be used to purchase fresh local food from Connecticut farmers. That is not only a win for the pantries that we serve, but also a win for the Connecticut agricultural industry. We're very grateful to the governor's office and that the state have taken an interest in this program and have included us in the biennium budget. However, what we have communicated to the Human Services Committee and want to communicate to the Appropriations Committee as well is that the additional funds granted to us or provided to us in the governor's budget both come. First, they come in year 2 of the budget, and secondly, they are not nearly adequate to where we need to be. We were asked what we need. We need $10 million to fully fund the CTNAP program. The governor's budget provides us $900,000 in year 1, $1.8 million in year 2. People don't need relief in 18 months or 24 months. They need relief right now. Food pantries and meal programs across the state are seeing attendance rising to levels we last saw during the COVID-19 pandemic, and we need to work together now to provide this much needed resource to our neighbors. My team at Connecticut Food Share continues to be here to answer any questions that you have and to help support the state in any possible way. Thank you, Representative.
Thank you so much. It's good to see you, and thank you for the very important work that you do. Really appreciate you, Jason.
Thank you.
Next, we'll have Jessica and Stefania. I see you together. We're ready for your testimonies.
Hi. My name is Stephanie, mucho gusto. Hola, yo soy Stephanie Naupari Ventura, soy de Denbury. Gracias por la oportunidad de apoyarnos. A mí me importa mucho porque los inmigrantes también tenemos derecho y CPMP. Somos seres humanos que pueden enfermarse. Necesitamos del Husky, ya que nos ayudaría con atención médica para poder ayudarnos mejor. La falta de seguro hace que muchos de mis familiares no acudan al médico por la falta de dinero, ya que no se lo pueden costear, por lo que optan por tratarse en casa, esperando que solo se mejoren. Podríamos ir al médico más a menudo y tratar nuestras enfermedades, ya sean más graves o no. Pido al Comité de Apropiaciones que financien la elegibilidad de Husky para todos los residentes elegibles de City, independientemente de su estatus migratorio, hasta los 26 años este año, y que cree un plan para abrir el acceso a todos los inmigrantes independientemente de su edad, las necesidades sanitarias o o no terminan a los 26 años.
Hi, my name is Jessica Robles, soy de Denbury. Gracias por la oportunidad de testificar sobre HB 6864, una ley relativa al presupuesto del Estado para el venido de terminar el 30 de junio del 2027. Pido que el comité apropiado financiar elegibilidad de Husky para todos los residentes de Connecticut, con ingresos elegibles independientemente de su estatus migratorio, hasta los 26 años. También apoyo el aumento de tasas de reembolso medicial para los actuales beneficiarios de Husky. Pueden tener un mejor acceso de la atención. Yo soy Jessica, una estudiante inmigrante que vive en los Estados Unidos. Pienso que es importante esta legislación porque las leyes son injustas al no dar el mismo derecho a las personas indocumentadas. Con el hecho de tener nuestro seguro médico, a mí me importa esto porque a mi hermana mayor no tiene seguro médico porque ya pasó de los 15 años, al igual que a mis padres. Esto afecta a mi familia porque si en algún momento necesitan ir de emergencias al hospital, el costo va a salir muy alto por el hecho de no tener seguro médico. Y esto pasa a la mayoría de las familias que son inmigrantes, no van a ir al hospital por el costo, que es haciendo que se puedan emplear tanto remedios caseros. Si mi mamá sufre de dolor en los tobillos que afecta que ella esté parada mucho tiempo. Un día no aguantó y tocó ir al hospital de emergencia, la cual pasó una noche porque sabía el costo que iba a venir. Después tuvo su recuperación en casa. Los días llegó el bill y era una cantidad extremadamente grande para pagar. Yo no solo ayudaré a mi familia, sino que también a mi comunidad inmigrante. Y lo que puedo hacer es ser partícipe de las alegaciones que tenemos para que se abra una nueva ley. Para nosotros los inmigrantes y tenemos al menos nuestros seguros médicos, facilitando que podamos ir al médico y tener costo menos a lo que se toca pagar. Pido al Comité de Apropiaciones financie la elegibilidad de Husky para todos los residentes elegibles de Connecticut, independientemente a su estatus migratorio hasta los 26 años este año. Y creo que el plan abrirá el acceso para todos los inmigrantes independiente de su edad. Las necesidades necesarias no terminan a los 26 años. Gracias por tu tiempo.
Dear chairs and members of the Appropriation Committee, my name is Stefania Naupari. I'm from Danbury. Thank you for the opportunity to testify to NGP 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have a better access to care. I am Stefania, and it matters to me because immigrants also have rights and we're human beings who can get sick. We need Husky students who will help us with medical attention. The lack of insurance means that many of my relatives do not go to the doctor due to a lack of money since they cannot afford it. So they choose to treat themselves at home, hoping that they will get better on their own. If we had Husky, we could go to the doctor more often and treat their illnesses, whether serious or not. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26 this year, and create a plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 26. Thank you for your time.
Dear chairs and members of the Appropriations Committee, my name is Jessica Robles. I'm from Danbury. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. I'm Jessica, an immigrant student who lives in the United States. I think this legislation is important because laws are unfair by not giving undocumented people the same right to have our health insurance. This matters to me because my older sister does not have health insurance because she's already over 15 years old. And the same goes for my parents. This affects my family because if they ever do need to go to the hospital in an emergency, the cost will be very high due to not having health insurance. And this happens to the majority of families who are immigrants who do not go to the hospital because of the cost, which means they can get worse by taking home remedies. My mother does suffer from ankle pain that affects her from standing for too long. One day she couldn't stand it and had to go to the emergency room, where she stayed one night and recovered at home. A few days later, the bill arrived, and it was an extremely large amount to pay. It will not only help my family, but also my immigrant community. And what we can do is be a participant in spreading the word, so that a new law is open for us immigrants, and we have at least our medical insurance, making it easier for us to go to the doctor. I asked the Appropriations Committee to fund Husky eligibility for all income-eligible CT residents, regardless of immigration status, up to age 26 this year, and create a plan towards opening access to all immigrants regardless of age. Thank you for your time.
Thank you so much for your testimonies. Have a good evening. And next we'll have Rep. Delaney pick up to chair for a bit.
Thank you, Representative Exum. Happy to be here. Moving right along, next we have Mr. Josh Paulik, followed by Ms. Samantha Ramon.
Distinguished members of the Appropriations Committee, Chairs Austin and Walker, and Rep. Delaney, thanks for facilitating in this moment. I am the Reverend Josh Paulik. I'm a resident of Glastonbury. I serve as the minister at the Unitarian Universalist Society East in Manchester. I'm a leader with both the Greater Hartford Interfaith Action Alliance and Connecticut for All. And as such, I offer this brief testimony on behalf of GIA's 50+ congregations and thousands of members in Greater Hartford, and on behalf of Connecticut for All 70+ labor, community, and faith-based organizations across the state. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027, with respect to the budgets of the human service agencies, specifically for the Department of Social Services, which administers Husky. I am testifying in support of increasing funding for Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 26. The Husky expansions passed in recent years are working. In the last 4 years, Husky coverage has been expanded to undocumented children ages 0 to 15 and to undocumented pregnant and postpartum people. These policy changes are having a positive impact on our state. Healthcare coverage, we know, creates access to preventive care, which leads to a healthier population overall, lower uncompensated care costs for hospitals, and lower healthcare costs overall. Thank you for your role in these previous expansions. Let's continue this progress by expanding Husky to age 26 this year. I also urge the Appropriations Committee to fund an overall increase in Medicaid reimbursement rates, so that all residents who depend on Husky can have better access to care. While I appreciate that the governor's proposed budget increases Husky rates, the more robust plan put forth by House and Senate leadership would bring all providers up to at least 75 to 80% of Medicare rates in a multi-year plan. This plan would also increase funding to community health centers, which are a critical provider of care to folks on Husky and those without insurance at all. Improvements in Husky rates would lead to greater provider participation. We've been hearing that a lot today, which would create better access to care for all Husky recipients. Bottom line for me is that healthcare is a fundamental human right. Expanding Husky eligibility, regardless of immigration status, and increasing the overall reimbursement rates acknowledge this human right, take it seriously. These appropriations are compassionate and caring. They prioritize the health and well-being of all residents. Having access to quality, affordable healthcare makes a huge difference, not only in a person's life, but in the life of their community, their workplace, their school, and in the quality of life overall in our state. Thank you for this opportunity.
And thank you for your testimony, Minister. Up next, we have Ms. Samantha Ramon.
Hi, can you hear me?
Yes, ma'am, and we're ready for your testimony.
Perfect. Thank you. I apologize. My camera is not working. I just want to take the opportunity to thank you for allowing me to speak today. My name is Samantha Ramon. I am the area director, operations director for Aviana Healthcare in Connecticut and Massachusetts. I am also a Connecticut resident. Aviana Healthcare is a licensed home healthcare agency providing continuous skilled nursing, also known as CSN, services in Connecticut for more than 20 years. We are the largest CSN provider in the state and are proud to employ more than 365 nurses who provide this highly specialized care to medically fragile children and adults across the state. Continuous skilled nursing allows these children and adults, many of whom require feeding tubes for nutrition, tracheostomy tubes to maintain their airways, or ventilators to help them breathe, live and grow safely in their homes and communities. At a time when Medicaid funding is a topic of much discussion, we urge you to recognize that home is not only the strongly preferred location for these patients to receive care, it is also far less costly to the state Medicaid program than emergency room visits and hospital stays, which is where these children and adults are forced to go and stay when they do not have this critical home care, nursing care. Workforce challenges that we experience are too many children and adults needing complex nursing care in Connecticut are not receiving it, with approximately 35% of nursing shifts unfilled due to low reimbursement rates that have not kept up with inflation or the cost of care. Recent rate increases in Massachusetts, where filled shift rates are significantly higher, have only increased these challenges in our state of Connecticut. Connecticut reimbursement rates for our nursing is $59.17 an hour for an RN and $50.06 an hour for LPN. In contrast, Massachusetts weekday rates are now $94.44 an hour for RNs and $65.40 for LPNs. Night and weekend rates are even higher, while Connecticut does not offer these enhanced rates. It's wild. Without significant investment to increase Connecticut Medicaid rates, CSN staffing and access to care problems will only get worse. We ask you to support additional funding in the state budget to increase Medicaid CSN reimbursement rates, including a 10% Medicaid rate increase for fiscal year 2025. In conclusion, we urge the Appropriations Committee to align Medicaid reimbursement rates with the true cost of providing care. This investment is not just about providers, it's about people. It's about protecting access to care for our state's most vulnerable individuals and supporting our nurses and caregivers with higher wages so that they can provide this critical care. Home nursing is not only, I am cut off. I just want to thank you so much for this and just let you know how passionate we are about this as well. Thank you so much.
And thank you for your passionate testimony, ma'am. Next, we have Miss Martha Coville. Martha Coville. Moving forward, Jennifer Granger.
Good afternoon. My name is Jennifer Granger, and I am the President and CEO of United Community and Family Services, hereafter referred to as UCFS Healthcare. Thank you for the opportunity today to provide comments on the human services components of the governor's budget proposal. UCFS Healthcare is a community health center providing medical, dental, and behavioral health services to nearly 17,000 individuals who reside in an expanse of Eastern Connecticut that covers 900 square miles. We operate 5 outpatient clinics and 10 school-based health centers. 55% of our patients are enrolled in the Medicaid program, and that equates to about 9,200 Medicaid patients served every year. Connecticut's health centers provide care collectively to 264,000 Medicaid enrollees. Our commitment to providing care to Medicaid members is strong, but to continue to do so, the state must end the underpayment of Medicaid providers. Functioning under a Medicaid rate structure established 23 years ago without rebasing since that time has resulted in a collective loss to community health centers statewide of $80 million per year. At my health center, we lose $85 for every Medicaid medical visit we complete, or $1.4 million loss per year. We lose $168 on every medical dental visit, or $907,000 per year. In short, UCFS Healthcare is subsidizing the Connecticut Medicaid program to the tune of $2.3 million every year, and it's just not sustainable. We can't compete with large healthcare systems for staff, As our waiting lists grow, our dental practice in Griswold, Connecticut sits idle, and physician positions remain vacant. It's important to know that Connecticut health centers are also paid far less than our counterparts in other nearby states. The recent DSS Medicaid rate study found that on average, Connecticut's community health center rates are 80% of the 3 comparison states of Maine, New York, and New Jersey. That drops to 75% when you add our neighboring states of Massachusetts and Rhode Island to that analysis. I applaud the state's goal to enhance access to primary care, and I can tell you that the most cost-effective way to do so for Medicaid enrollees is to ensure the financial sustainability of our community health center program. Thank you for your consideration and your hard work on behalf of our state, and please feel free to reach out to me if you have any questions. Thank you.
And thank you, Ms. Granger. Up next, we have Dina Tampi. Dina Tampi. Going forward, Alice Forrester.
Hi, everyone. I'm Alice Forrester. Thank you very much to the chairs and the members of the committee. I'm very happy to be here to testify. I'm the CEO of Clifford Beers Community Health Partners, a network of nonprofit organizations focused on the well-being of children, youth, and families across Connecticut, from Norwalk to Madison, New Haven to Bethany. I'm here representing Mid-Fairfield, Clifford Beers Community Care Centers, and Youth Continuum. Together, we serve over 8,000 youth, children, and adults across Connecticut and are fully committed to our communities. We are all together representing about 225 years of service to Connecticut. And we're exhausted. In 1944, the State Division of Child Welfare and Juvenile Court agreed to a rate of $10 per person for diagnostic and treatment services. If that $10 today was valued, it would equal $180.49. I have been working with colleagues, and I can confidently say that a 50-minute session in an outpatient mental health clinic in 2025 costs approximately $210, not much more than that $10 in 1944. And that includes all the back office data and services. But we get reimbursed from DSS about $93. And the DCF outpatient grant maybe covers another $50 for only kids up to 18. And if you can do the math, that's $67 not covered by any income. That is a loss for anyone over 18, $177. Can you see why we're tired? We welcome the legislators' support to increase Medicaid rates for behavioral health and the autism rates by the full amount recommended by the first part of the 2024 Medicaid rate study, which would be a cost of $56.9 million. Nonprofits must be finally funded at true cost. I support the Nonprofit Alliance's call for $264 million increase to the nonprofits in 2026 and another increase of 8% in 27. It has been too long that Connecticut has not lived up to its duty to appropriately fund mental health services. You funded it more in 1944 than you are right now. And if we closed, think about what it would cost the state to deliver these services. I can assure you it would not be $210. Thank you so much for the time, and thank you for all of your very hard work.
Thank you for your testimony, ma'am. Up next, we have Dr. David Santos.
Yes, good evening, members of the Appropriations Committee. I'm David Santos, and I'm the Executive Director of Covenant to Care for Children. And I'm here tonight to ask you to increase funding for vital nonprofit programs like ours. Covenant to Care for Children provides a safety net for abused, neglected, or impoverished children throughout Connecticut by providing essential support in moments that are critical for a child's ability to thrive and a family's ability to stay together. Now in its 38th year, Covenant to Care for Children has provided basic essential goods to over 868,000 children in Connecticut. By basic essential goods, I'm talking about providing a bed for a kid that doesn't have one, a crib, a school uniform, or even a holiday toy for a child who might otherwise go without. Covenant to Care for Children strives to allow kids to be kids in all the positive ways that make for a promising life. Our goods and services are provided to kids that are more likely not to graduate from high school, more likely to face chronic unemployment or underemployment, kids that have a high likelihood of being homeless at some point in their lives without our intervention. We recently received the following note from a social worker regarding goods that Covenant to Care for Children provided to one of her clients. Shannon is grateful for the goods received from Covenant to Care for Children. Her heart swelled with gratitude as the new twin bed with linen, pillow, and blanket was delivered, a crucial piece that made her son's homecoming complete. After all the hard work and dedication she poured into transforming her life, overcoming challenges, and making the necessary changes to reunify with her son, this gesture meant the world to her. The bed, frame, and mattress and other items were items she could not afford, symbolized a fresh start and the comfort of a stable home. This support is a testament to the power of community and resilience, reminding Sharon that she is not alone in her journey and that brighter days are ahead for her and her son. Again, I ask, on behalf of the children, for your support this budget season. Thanks so much.
Thank you for your testimony, Dr. Santos. Next, we have Cecilia Livingston.
Good afternoon, good evening, Chairs Austin and Walker and ranking members. My name is Cecilia Livingston, and I'm the Senior Director of Operations at A&B Home Care Solutions, a motive care service, and a DCP registered homemaker companion agency. I'd like to thank you and the members of this committee for taking the time to hear testimony regarding the critical need for sustainable funding in Connecticut's home care programs. Home care, also known as personal care services, is often overlooked in the Medicaid space. We often hear about facility-based care, such as nursing homes and hospitals, but personal care service agencies play a vital role in the healthcare continuum. I want to be clear, personal care services are non-medical services. Our caregivers enter the homes of your constituents every day to help them with their activities of daily living, ambulation, bathing, toileting, meal prep. We keep these individuals independent in their homes, and we're often the front lines of identifying health long before they become an issue requiring more costly facility-based care. In fact, the Genworth cost of care study shows that keeping individuals in their homes can save the state over $9,000 per month per member. The problem that we face is maintaining a sustainable workforce that will meet the demand of a growing aging population in Connecticut. In 2023, A&B saw a 5% decrease in our caregiving workforce. What's driving this? Our inability to offer competitive wages. We currently receive a reimbursement from the state of $24.32 per hour. This has to cover not only wages, which have been subject to annual minimum wage increases, but other overhead costs associated with the provision of home-based care, which have seen steep increases from inflation over the past decade. Other than a small bump in recent years through ARPA funding, reimbursement rates have been stagnant. In some cases, we're losing caregivers to private industry, such as big box stores. In other cases, we're seeing caregivers leave the state for higher wages in New York, Massachusetts, and Rhode Island that reimburse $12, $13, and $16 more respectively. I recently interviewed a caregiver that was traveling to New York to cover a multi-day shift. She lives north of New Haven, but her wages more than offset the cost of her travel. If we're not able to maintain an adequate caregiving workforce, the unfortunate result will be hindered access to care for thousands of Connecticut residents that rely on it. They'll have to seek more costly facility-based care. We recently had to release an individual who suffered from ALS because we couldn't hire and maintain the caregivers required. The need for sustainable home care funding is critically urgent. Without an increase, we will see further attrition to higher paying neighboring states and private industry. We appreciate your time and thank you.
Thank you for your testimony and for your advocacy, ma'am. Moving forward, Jennifer Johnson. Cyan Blackwell.
Yes.
Hi, Ms. Blackwell. We're ready for your testimony.
Thank you. Madam Chair and members of the committee, my name is Cyan Blackwell, and I reside in New Haven. I'm a law student intern in the Community Lawyering Clinic at Yale Law School. We submit this testimony as a general comment on House Bill 6864, an act concerning the state budget on behalf of our client, Mothers and Others for Justice, a community of activists using their lived experience to advance justice. The governor's proposed budget for human services agencies should include funding to end benefits cliffs in Connecticut. For many low-income workers, wages alone are not enough to provide for their families, and they must rely on public benefit programs to meet their families' needs. However, even small increases in income, for example, from a raise or promotion, can disqualify them from receiving benefits, effectively punishing them for their hard work. This is known as the benefits cliff. Just $1 over the income limit can cause vulnerable families to be pushed over the cliff, lose their benefits, and fall deeper into poverty. According to Connecticut's two-generational initiative, as a family's income climbs from $27,000 to $29,000, their net financial resources drop over 20% due to a loss in benefits. So what can be done about benefits cliffs? The Human Services Committee is considering two bills, House Bill 6099 and 6811, that will create a benefits cliffs pilot program. While the pilot program acknowledges and responds to the harms of benefit cliffs, it does not go far enough. As currently conceived, the program would include only 200 families in the entire state. To fully address the problem of benefits cliffs, the General Assembly should fund the pilot program so that it is available to all families in Connecticut. There are also other ways that the General Assembly can address benefits cliffs. The Housing Committee is currently considering House Bill 6114, which would disregard the income of children up to the age of 26 when determining eligibility for all public assistance programs, for RAP, the Rental Assistance Program. Why not disregard young adults' income for all public assistance programs administered by the Department of Social Services? We are long past the days when people could move out at age 18 and rent their own apartment. The lack of affordable housing has made that a dream rather than a reality for many working families here in Connecticut. Disregarding the income of young adults when determining benefits eligibility will give them an opportunity to get jobs and save for the future without threatening their family's eligibility for essential public benefits. We also know that when foundations and nonprofits provide stipends to families through innovative programs like the Changemaker Fund, they risk driving those families off the benefits cliff. This discourages them from giving to those who need it the most. The stipends received through those programs should be disregarded too. Connecticut has never been in the business of tiptoeing behind other states. When it comes to the social safety net, Connecticut is a leader. Benefits cliffs are not the place to start falling behind. We encourage this committee to invest in the state's workforce and protect people from the edge of the cliff before it's too late and the costly cycle of poverty continues. We urge you to use this budget to address benefits cliffs so that Connecticut can continue to be a leader and meet the needs of its residents. Thank you for your time.
And thank you for your testimony, Ms. Blackwell. Up next, we have Marie Kenny.
Good afternoon, Senators Austin, Lesser, Summers, and Harding, Representatives Walker, Gilchrist, Nuccio, and members of the committee. I'm Marie Kenny with Safe Futures, where we provide life-saving services to victims of domestic violence in the 21 cities and towns of southeastern Connecticut. Services include counseling, support groups, safety planning, shelter and housing options, court-based advocacy, transportation, assistance with securing basic needs and job training, and coordination with local law enforcement, among others. Safe Futures is a member organization of the Connecticut Coalition Against Domestic Violence, CCADV. We thank Governor Lamont for including an additional $1.5 million in the Department of Social Services budget to increase funding to support domestic violence assistance through CCADV. This funding is critical to the infrastructure of the state's domestic violence service system, as Connecticut like all states, continues to face reduced federal funding. We are asking this committee to explicitly state in its budget proposal that $1 million of this funding be used to support Safe Connect, Connecticut's 24/7 statewide domestic violence hotline, and $500,000 be used for domestic violence victim assistance. Connecticut has relied heavily on federal funding available through the Victims of Crime Act, VOCA, to support a variety of victim services. This includes the entire statewide domestic violence hotline, Safe Connect, since its inception in 2019. Unfortunately, federal VOCA funding has decreased significantly in recent years. Dedicating the remaining VOCA funding to community-based services provided across CCADV's membership means that alternative funding must be sought to support Safe Connect, which plays a vital role in the state's overall domestic violence service system by providing a single, coordinated statewide entry point for domestic violence services. Prior to Safe Connect, each individual CCADV member organization was responsible for providing 24/7 hotline coverage, but did not receive any funding to do so. If Safe Connect were to go away, these 24/7 hotline calls would fall back to the coalition members, including Safe Futures. By providing a triage of hotline calls, Safe Connect allows our own advocates to focus on comprehensive and longer-term needs of our clients. Safe Connect relieves us from handling hotline calls that are not appropriate for or do not require the expertise of our advocates, since these calls come in while we are working with clients, some of whom are in crisis. We urge the Appropriations Committee to explicitly state in its budget proposal that $1 million of the additional funding proposed by Governor Lamont for domestic violence assistance be used for Safe Connect. Maintaining Safe Connect is key to a successful survivor-centered, trauma-informed domestic violence system in Connecticut. Thank you for your consideration.
And thank you for your testimony. Before we move forward, as a point of housekeeping, I just wanted to list a few rules for everybody here with us in the committee room and listening at home. First, if you are signed up to testify, you have to accept the invitation to be promoted to panelist. And then once you do so, please do it immediately once you get that notification. 2, if you miss your turn to speak, you unfortunately forfeit your spot and you'll be moved to the end of the list if you want to continue speaking. If you anticipate any kind of issues with your turn, please try to administer either one of my colleagues or preferably our staff administrator in advance. If you do not communicate it to us, we will not be able to guarantee your place in the order, which we must do because we have so many people from all over the state who've come to speak. The speaker numbers, once we assign them, they cannot be swapped, they cannot be changed, substitutions are not permitted, and unfortunately, only folks who have registered ahead of time are allowed to testify. Unregistered testimony cannot be permitted. Panels are prearranged, so if you are coming with a group of people, you do need to work with our administrator ahead of time. The spontaneous formation of panels, unfortunately, cannot be permitted, to be fair to everyone else who signed up ahead of time. And just for one last bit of point of order, everyone is given 3 minutes to testify. Of course, testimony can go a little above or a little below, but we ask that when the timer starts to ring, that you please kindly summarize your testimony. Thank you, everybody, and let's get right back after it. I think right next we have number 155. Nope, number 154, Terrell Williams. Nope. Number 155, Angelica Idrovo.
Dear members of the Appropriations Committee, my name is Angelica Idrovo, and I'm an undocumented immigrant, a resident of the city of New Haven, and I'm also the organizing director with the Connecticut Black and Brown Student Union. I'm here to testify in strong support of HB 6864 and advocate expanding Husky coverage to all immigrants up to the age of 26, regardless of immigration status. My family and I moved to the States when I was 12 years old, and until the age of 18, we relied on the Samaritan Health Center in Danbury, who provided free checkups for uninsured uninsured children. After I turned 18, I lost access to regular healthcare simply because of my undocumented status. Now I'm 28 and I still do not have medical insurance. I cannot afford regular checkups. You have no idea how terrifying it's to be in bed, double the pain, knowing that going to the hospital could leave you with bills that you cannot afford. This happened to me a couple years ago where I was having some serious abdominal pain and I had to force myself to endure pain rather than seek care. Not because I didn't need it, but because I simply knew that I couldn't afford the hospital bills. My parents, who are now close to 60 years old, have spent many years without yearly checkups. They rely on over-the-counter medication to manage their health issues because they too lack of medical insurance. Preventable health conditions go untreated, worsening over time. This is the reality for so many undocumented families in Connecticut. This can change and this must change. Expanding Husky is not about numbers, it's about protecting lives. Now more than ever, Connecticut must step up to protect our immigrant community. So I urge this committee to take two critical actions: expanding Husky coverage to all immigrants up to the age of 26, and to increasing Medicaid reimbursement rates for providers, as this will directly impact the quality of Husky. No one should have to suffer in silence because they cannot afford care. Expanding Husky will mean that young people like myself won't have to choose between their health and their future. It will also mean that families like mine can finally access care that they deserve. Connecticut has the power to lead with compassion and care. Let's make healthcare a reality for all.
Thank you for the bravery of your testimony, Ms. Idrovo. Up next, 156, Tiffany Williams. Tiffany Williams. Moving forward, number 157, Barbara Dune. Ms. Dune, are you with us?
Hello?
Hello, ma'am.
Can you hear?
Are you ready to give your testimony?
Yes, I am.
Well, we're ready to receive it.
Okay. Thank you. My name is Dr. Barbara Dune, and I'm the president of the CAO. Thank you for members of the Appropriation Committee for listening to me today. So I'm testifying in behalf of the Bill HB 6864. And we, as optometrists, we are asking to get fee parity with the ophthalmologists. According to the health and to the DSS, for state and national, optometrists provide 70% of Medicaid services. 90% of optometrists in Connecticut participate in Medicaid. And of the 10% that do not currently participate in Medicaid, 50% said they would if the rates were better. Last year, Medicaid paid $13 million for eye care services in Connecticut. And of that, 130,000 were non-duplicate visits. If you were to increase our fee parity by 10%, it would cost Connecticut State $1.3 million. And with federal matching, that would only be $650,000. The optometrists are currently the #1 primary eye care providers, and they are the most accessible, especially in rural areas, as ophthalmologists tend to reside more in the urban areas. We do the routine care, and we co-manage patients with their primary care providers. We manage diabetes, high blood pressure, manage glaucoma, and diabetic retinopathy. So we feel that providers, that we should be reimbursed based on procedure code and not on licensure. Thank you so much for listening to my presentation today.
And thank you for sticking with us and for the bravery of your testimony, Ms. Dune. Up next, Terrell Williams.
Hello. Thank you. Sorry, I missed my order before. I didn't accept the panelists. I'm Terrell Williams. I'm a home care worker from New Haven. And I've been doing this for over a decade now. I began working in this field to care for my mother when she became ill, and then my brother after that, who both recently passed away. I love doing this job. This is actually the first job that I ever worked and instantly fell in love with. Um, and the relationship that people develop with their care receiver and their care providers are, it becomes a bond of either friendship or love, but it's a bond that affects, it's symbiotic, I guess I'm trying to say. When our consumers are well taken care of and satisfied with their everyday living essentials, it makes us feel good. And when we are well taken care of, it makes them feel good. We've done a lot of good work combining forces with our coworkers and working hand in hand with the legislature over the years to make this a very, very valuable career. But there's still some cracks that we need to fix in the system. Right now, the workforce is doubling year by year. More and more people are becoming care providers and in need of care, and it's projected to grow more as we go forth. So I'm here to ask you to fund the DDS program because these funds provide viable necessity for a great many of people who deserve to live their lives in dignity. Thank you.
Thank you, Mr. Williams. Up next, we have Ms. Rosa Rodriguez.
Yes. Hi, how are you, everyone? Dear members of the committee, my name is Rosa Rodriguez. I am testifying today, and I am a member of Connecticut Worker Center. I want to thank you for the opportunity to testify today on HB 6864, particularly in the relation to the human service budget. I strongly support increasing Husky funding for our immigrant community and respectfully urge the committee to extend coverage through age 26, regardless of immigration status. It is equally important to preserve the gains we've made for children up to the age 15 and pregnant women. Additionally, I ask that you consider increasing reimbursement rates for providers as they directly impact the quality of care under Husky for all our neighbors in Connecticut, immigrants or not. I came to this country many years ago, and I have found that healthcare coverage here is very expensive. Without insurance, I am unable to see a doctor when I am feeling sick. I often avoid going to the doctor out of the fear of overwhelming medical bills. If I had access to insurance, I would be able to get the care I need when I need it. It is essential that we provide health care coverage to all income eligible residents of Connecticut, regardless of immigration status, up at the 20 age of 26. Health coverage is not just about treating illness, it's about providing access to preventive care, which leads to a healthier population, lower uncompensated care costs for hospitals, and reducing overall healthcare expenses for the state. Please support the funding and expansion of Husky programs as outlined in HB 6864. Thank you for your attention to this critical issue. Sincerely, Rosa Rodriguez, Connecticut Worker Center. Thank you so much.
And thank you, Ms. Rodriguez, for your testimony. Up next, we have Mr. Michael Asinas.
Good evening, senators and committee members. Thank you for the opportunity to testify on HB 6864 of the governor's budget. I'm here today to advocate for an increase in $264 million for fiscal year 26 to support vital nonprofit programs, with a specific focus on increasing Medicaid rates for behavioral health services and to ensure the long-term sustainability of community-based services throughout the state of Connecticut. My name is Michael Asinas, and I have spent close to 30 years as a clinical social worker, and I'm currently an associate vice president with Community Health Resources in the Child and Adolescent Division, Child and Family Division, overseeing a multitude of community programs. I have never witnessed such high levels of mental health distress across our communities as I am seeing now. Across Connecticut, families, and especially children, are struggling with rising rates of depression, anxiety, fear, suicidality, and isolation. These trends are particularly concerning for our younger residents who face academic challenges, increased behavioral issues, and a lack of access to critical mental health services that are necessary to support their development. At CHR, we have programs to treat and support some of these families. These programs are crucial to treatment and helping families recover and maintain a positive and healthy lifestyle. Seeing our budget slashed or even fully cut seems to be a continuing trend, only deepening the gap between access for services. It is too often that I see and hear of children and families falling through the cracks of our system as they wait for services and their problems deeply worsen, sometimes to the point of no return. One of the programs that I oversee is an adolescent family in-home intensive program in the Northeast. We received funding for 2 full teams about 1.5 years ago, 2 teams of 4 therapists and 1 clinical supervisor. Shortly thereafter, when we were fully trained and we had clientele, the state cut 4 staff, basically cutting 1 and fully entire team to serve these teenagers. We now have an ongoing wait list in the East of at least 30 families at a time. They can wait up to 3 to 4 and possibly more months for treatment due to lack of services. They often fall off this wait list as their risk factors are high. Where did they go? They often end up taking their children to high-priced emergency services, EDs, which could have been prevented if they were able to get into community services in a timely manner. This is happening to families all over the state. We all have these same stories to tell. In addition, our outpatient clinics are serving children and families with a much higher levels of acuity who should be in programs that are more intense, but the programs are unavailable or have been cut by the state. And I'd like to read for you also a passage from a statement of need for our juvenile justice system that speaks to this as well, that at least 75% of youth in the juvenile justice system experience some form of traumatic victimization, and 93% reporting past exposure to adverse childhood experiences, including child abuse and family community violence and serious illness. Unfortunately, children are often involved in the juvenile justice system because of a lack of community-based treatment options and are detained or placed in juvenile facilities for minor nonviolent offenses. The placement of these youth in the juvenile justice system is part of a growing trend towards the criminalization of the mentally ill. Placing adults as well as children with behavioral health needs in the justice system is as a means of accessing services that are otherwise unavailable or inaccessible in the community. It's a shame. In Connecticut, we have a multitude of healthcare providers that have the expertise and programs to help these families and children through these difficult times. The sad realities is that the inadequate funding, including underfunded Medicaid rates, is severely limiting our ability to deliver these services. As it stands, we simply do not have the resources to hire and retain the qualified staff needed to meet this demand. This is causing dangerous delays in our care for children and families who are desperately waiting for help. These delays are not just numbers. They represent real people, often children whose lives are negatively impacted whose lives are often negatively impacted because they are unable to access the resources they deserve in a timely manner. As these wait times increase, crisis systems are strained, outcomes worsen, and in some cases, programs are forced to close their doors. Without sustainable funding, Connecticut will face a future where our most vulnerable residents, our children and families, suffer from even greater risks. The risks include the higher rates of school dropout, early death, and unemployment, as well as increased burdens on our law enforcement, judicial, and hospital systems. Moreover,
Sir,
the financial
your 3 minutes
costs.
have expired. Could you please
Yeah.
summarize?
Fully funding these behavioral health services for Connecticut children is not just a necessity, it's a wise and imperative investment in our future. Thank you for the opportunity to testify.
And thank you for your testimony, sir. Up next, Ms. Natasha Forrester.
Hello, can you hear me?
Yes, ma'am, and we are ready for your testimony.
Thank you. Good evening, Senator Olston, Representative Walker, and honorable members of the Appropriation Committee.
My name is Natasha Forrester, and I'm from Meriden. I'm a licensed practical nurse with complete care in Meriden, where I've worked for a little over a year now. But I've been in the healthcare field for nearly 14. I'm here today to urge you to increase the funding for nursing homes through the DSS budget. I knew ever since I was a little girl I wanted to be a nurse. Both my mom and dad were nurses and continue till this day to be nurses. They've put in 40 years into the industry. I love caring for people. It was in my blood and in my upbringing. Unfortunately, and my parents will even say the same thing, nursing is not what it used to be decades ago. Gone are the days of the caring, sweet little old lady, and now they're more struggling with behavioral issues, addiction, physical rehabilitation, and they're even bigger than us in many cases, which requires us to use extra tools and hands properly and safely lift them. This is literally backbreaking work. It is not uncommon for a CNA or LPN to injure themselves lifting a resident. With staffing as poor as it is, we rush around all shift providing the best care we can, but we often leave our shifts exhausted and demoralized by the environment we work in. Residents and caregivers deserve better. This is largely tied to wages. Nursing home workers are not paid a living wage, making it harder and harder to find talented caregivers to fill our ranks. Furthermore, the caregivers we do have are exhausted from working multiple jobs just to get by. With more funding for wages, we could raise the wages for caregivers, reducing the financial strain experienced by current staff while helping to recruit much needed additional staff. A lack of funding impacts our homes in other ways too. I come in for my night shift to frequently find we don't have the supplies that we need. We often run out of the proper rash creams for patients, to items simply as proper fitting gloves and soap and even heating pads. There are items that are essential to care for our residents because of this on more than one occasion, I've actually gone out and purchased some supplies myself, and I can say my coworkers have done the same. We're filling the gap left behind when our facility falls short. It happens far too often. We all need help, and there is no help to be found. We are tired and burnt out all across the board. If someone calls out, you may end up being the only nurse for 50 to 60 people. Patient-wise, and that's just unacceptable. And I am embarrassed to say it, but I would never put my own family member in my own facility. Understaffing, supply shortages, and overworked and underpaid staff have dramatically impacted the quality of care residents receive. And with your help, Connecticut can do what is right by residents and caregivers. So please increase the funding in your budgets for nursing homes like mine. Thank you.
Thank you, Ms. Forrester, for your testimony and for your service.
Thank you.
Yes, ma'am. Up next, Ms. Barbara Taylor. Going forward, Ms. Abusa Mendez. Ms. Mendez, are you with us?
Yes.
Yes, ma'am. We're ready for your testimony.
Okay. Mi nombre es Abisua y soy estudiante de Wilbur Cross High School en New Haven. Soy miembro de C4D. Gracias por la oportunidad de testificar sobre HB 6864, una ley relativa al presupuesto del Estado para el bienio que termina el 30 de junio de 2027. Pido al Comité de Aprobación Financiera la elegibilidad Husky para todos los residentes de Connecticut con ingresos elegibles, independientemente de su estatus migratorio hasta los 26 años. A mí me importa porque conozco a muchas personas que necesitan servicios médicos y no pueden pagarlo. La salud es un derecho y no debería ser un privilegio. Cuando la salud se ve como un privilegio, solo aquellos con recursos económicos pueden acceder a servicios de salud de calidad. Esto crea una desigualdad que afecta a las poblaciones más vulnerables, lo que es injusto y perpetúa ciclos de pobreza y enfermedad. Documentos como la Declaración Universal de los Derechos Humanos afirman que todas las personas tienen derecho a un nivel de vida adecuado que incluya la salud y el bienestar. Hace un año conocí a una chica que estudiaba y trabajaba. Ella siempre se esforzó porque quería un mejor futuro, pero un día ella enfermó. Ella enfermó muy gravemente y ella no fue al hospital porque no podía costearlo. La chica estuvo en un peligro muy grave, pero no podía ir al hospital. La enfermedad que la aquejaba no solo robó su energía y sueños, sino que también trajo consigo una carga abrumadora. Poder tener un acceso a un seguro médico puede beneficiar a mi comunidad, ya que muchos de ellos no pueden permitirse poder ir al hospital. La mayoría de las personas indocumentadas no van al médico y prefieren aguantar sus molestias. El seguro médico podría ayudar a mejorar la salud de muchas personas. Yo apoyo a Husky for Immigrants, pido al comité de aprobación que financie la elegibilidad de Husky para todos los residentes de Connecticut, independientemente de su estatus migratorio hasta los 26 años de este año, y que cree un plan para abrir el acceso a todos los inmigrantes de todas las edades. Muchas gracias por su tiempo.
And thank you.
Dear chairs and members of the Appropriation Committee, my name is Abisua, and I am a student at Wilbur Cross High School in New Haven. Thank you for the opportunity to testify on HB 6864, an act concerning the state budget for the biennium ending June 30th, 2027. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 26. I also stand in support of increasing Medicaid reimbursement rates so current Husky recipients can have better access to care. It matters to me because I know many people who need medical services and cannot afford it. Health is a right and should not be a privilege. When health is seen as a privilege, only those with economic resources can access quality health services. This creates inequalities that affect the most vulnerable populations, which is unfair and perpetuates cycles of poverty and disease. Documents such as the Universal Declaration of Human Rights affirm that everyone has the right to adequate standard of living, including health and well-being. A year ago, I met a girl who was studying and working. She always made an effort because she wanted a better future. But one day she got very sick. She became seriously ill and she did not go to the hospital because she couldn't afford it. The girl was in great danger but could not go to the hospital. The illness that affected her body not only stole her energy and dreams, but also brought it with an underwhelming burden. Being able to access health insurance can benefit my community since many of them cannot afford to go to the hospital. The majority of undocumented people do not go to the doctor and prefer to endure the discomfort. Health insurance could help improve the health of many people. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to 26 this year, and create a plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 26. Thank you so much for your time.
Thank you, Ms. Mendez, for your testimony and for the translation of that testimony. Up next, Mr. Andrew Sellinger, followed by Ms. Catherine Verano.
Hello, my name is Andrew Sellinger. I'm from West Hartford, Connecticut, and I wear several hats. One, I am the co-leader of the Fragile X National Fragile X Foundation Connecticut chapter. And for those who don't know what that is, it's a rare disease on the autism spectrum and the only genetic link to autism and the most common cause of intellectual disabilities. I also am on the board of directors of a wonderful small agency in West Hartford called JCL, Jewish Association for Community Living, which is my lifeline. And I'm also involved in the Profound Autism group that in Connecticut, we're starting a chapter. I'm here today to bring light to my son's story. He was a victim of assault at the hands of the people that were supposed to be supporting him. He was in a day program by a DDS qualified provider. And in that day program, he was brought into the bathroom and walked out with two black eyes. It was not reported. And the only way we found out about it was when we called in the evening to find out how he was doing, which we do every day. And we were told, oh, his face is a little red. Why is his face red? Well, he had an incident in a day program. So we went right over to the day program and witnessed the effects of the abuse that he had received that day. And it wasn't the only time. He had, through his 3 years at that agency, which was their go-to to do hands-on restraints at at this just for almost no reason or for minimal reasons. No, not using standard techniques like de-escalation. So I'm bringing light to this because the financial situation, the lack of funding for nonprofits is reaching a dangerous level. It's reaching a dangerous level because, one, the people working in this industry, besides not being paid appropriately, I'm hearing people working 3 shifts in a row. Can you imagine? And I heard it, talking to my providers over the phone, and they're basically so tired they could barely stay awake. That is dangerous. So, I think that we need to look at that hard, and I just would, like to consider, some oversight as well, some additional oversight in terms of restraints. I don't think restraints should be able to be used freely. By just receiving PMT, which is one form of physical management training, doesn't really make you an expert in handling these situations. Just want to also say my son has a condition that has hyperarousal. He can go from a calm state to hyper escalated in a second. A lot of things that do that, something as simple as a video on his iPod. He watches these iPods, he gets over escalated, and if he is not monitored and asked to change this video off his device, he will escalate to the point where he can get aggressive and people can get hurt. He starts unplugging TVs. He has destroyed property. They're very dangerous situations. And I just have to conclude by saying the staff at these agencies are the most wonderful people, and they care so much. When we talk to them and they report some of the positive things, the thrill in their voice and enthusiasm just gives me a lot of hope for the future. But I want to keep them viable because they're my lifeline. Both my children are being placed with this agency, and they both have high significant needs. Thank you very much.
And thank you for your testimony, sir, for your community and for your family. Up next, we have Dr. Robin Matloff. Dr. Matloff, are you with us?
Hi, thank you. Chairperson, members of the Appropriations Committee, my name is Dr. Robin Matloff, and I'm speaking on behalf of the Fairfield County Medical Association to urge increased Medicaid reimbursement funding beyond what is proposed in Governor Lamont's budget. We appreciate the governor acknowledging the urgent need to increase rates by allocating funds in his proposal. However, $20 million in the first year and over $50 million in the second year are unfortunately insufficient, and we respectfully request the Appropriations Committee to further increase funding for rate reimbursement. As a pediatrician, I can tell you firsthand how pediatric care is uniquely impacted by Medicaid underfunding, and it's critical that we prioritize equitable investment in children's health care. Pediatrics is unique. While Medicaid covers more than 1/3 of Connecticut's children, only about 1 in 5 adults rely on Medicaid. My employer, Connecticut Children's, serves as a key safety net with over 56% of its patients relying on Medicaid as compared to just 22.6% of adult patients. That discrepancy means that low Medicaid reimbursement disproportionately affects pediatric providers. It compromises financial sustainability and, most importantly, access to care. Pediatric medicine is inherently more resource intensive. Providers have to stock a wide range of equipment to accommodate children of all sizes. So for example, for myself, I'm a pediatric nephrologist. I specialize in high blood pressure. I have to have 6 different blood pressure cuffs for the patients that I see. Translate that into our surgical centers where we have to take care of premature babies that are maybe 800 grams to all through up to those patients that we see for obesity and bariatric surgery. We need to have equipment, as you can imagine, different sizes, different catheters, training, nurses, medications, and care for all those different sizes and age ranges. Medication doses also require careful weight-based calculations. And additionally, caring for very young children demands greater staffing. So, for example, a nurse in an adult hospital can have 3, 4 more patients. A patient or an infant in our neonatal intensive care unit can only have 1 nurse. So we need about 50% of our inpatient care at Connecticut Children's is for infants under a year old, and 70% are for children under 6. We need adequate child life specialists, nutrition, dietitian, and social work to be able to make sure that we are encompassing all the needs of the children and the families that we see. Pediatric access is in particular for Fairfield County. Our Connecticut Children's Westport Specialty Care Center delivered over 22,000 pediatric visits in fiscal year 24, with 40% of those visits covered by Medicaid. In particularly our high demand pediatric specialties such as cardiology, endocrinology, gastroenterology, orthopedic surgery, pulmonary, and physical therapy. Without reimbursement for those critical services, access is truly at risk. Medicaid must invest equitably in children. Medicaid spending on children is cost-effective, yet chronic underfunding places significant strain on pediatricians. Low reimbursement rates contribute to a growing provider shortage and access challenges, particularly in marginalized communities. To ensure equitable care, the state must implement Medicaid rate parity for pediatric providers by increasing funding to this program. This will help address workplace shortages exacerbated by the financial instability. Children's healthcare is a long-term investment in Connecticut's future.
Could you please kindly summarize your testimony?
Sure. So sustainable Medicaid funding is essential for maintaining access, improving health outcomes, and supporting innovative pediatric care. On behalf of the Board of Trustees of the Fairfield County Medical Association and its nearly 1,000 physician members, I urge the committee to prioritize children by increasing Medicaid reimbursement beyond the governor's proposed budget. And I thank you for your time and your consideration and for having us.
And we thank you for the time of your testimony, Dr. Matloff. Moving forward, I will now be passing chairmanship of the committee to the Honorable Representative Lucy Dapin.
Wow, using the full title. Thank you very much. Thank you to the Honorable Sergeant Representative Delaney. Thank you so much for everyone's testimony. As a reminder, we have 3 minutes to testify. If you do not finish your testimony within those 3 minutes, please be aware that who's ever chairing the committee will let you know. And after a few seconds, if you're not summarizing, then the administrator will mute you so no one else will hear your testimony. Thank you so much for joining this evening. And next we have on our list number 165, Rob Barrel. Rob is due to be remote. All right. Moving on to Jonah Francis, also remote. Jonah Francis, all right.
Hi, am I on?
You are. Go ahead, sir. 3 minutes, please.
Yes, ma'am. Well, again, my name is Jonah Francis. I'm the CEO of Pansy Home Care Service here in West Hartford, a non-medical home care agency, and we've been helping people in our area for well over 12 years. I also serve as the board member for the Alzheimer's Association and the vice chairman of the Home Care Association here in Connecticut. I'm here today to urge lawmakers to increase the Medicaid reimbursement rate for home care agencies, as our current rates are unsustainable. Without the immediate changes, seniors will suffer, caregivers will leave the industry, and home care agencies will collapse under the financial strains. I grew up in senior care. My mother was an immigrant. She started her career as a CNA, and that's a title that she still wears as a badge of honor to this day, despite her many other titles. And as a child, I spent so much time in the hallways of her workplace, known as Pansy's Son, connecting with both caregivers and clients alike. Fast forward to today, I am privileged to be the co-owner and operator of a home care agency alongside my mom. And my experience as the son of a caregiver and an advocate for people within this industry had led me to one Simple truth. Successful care of our seniors is directly aligned with successful care of our caregivers. We create care plans for our seniors, but where's the care plans for our caregivers? Caregivers need fair pay. And since 2015, Connecticut's minimum wage has risen by 72%, but the PCA rate and reimbursement has only grown by 28%, currently just over $24 an hour, while our neighbors in New York and Massachusetts, their reimbursement rates are just about $40 or up to $40. Imagine what they're able to pay their caregivers. How can agencies like mine provide fair pay when Connecticut's reimbursement rates are amongst the lowest in the region? Small minority-owned businesses like myself has been forced to reduce our Medicaid participation. We went from 85% Medicaid reimbursement 5 years ago to just 12% today. This will create a system where clients and caregivers suffer. Caregivers also need support, yet legislative mandates continue to increase the oversight and burdens on agencies, and we see nothing mentioned about caregivers on the self-direct model. This creates a dangerous gap in quality of care. Who will caregivers call when their clients' needs increases beyond their current skill sets? When they're facing difficult behaviors but fear losing a paycheck, who supports them? And who will clients call when a caregivers need a break and they have no one to come to them the next day? The solution is simple. Invest in home care now, or we face crisis of thousands of seniors being left without care. Clients win when caregivers win, and caregivers win when agencies win. So I urge you all to please act before it's too late. Thank you.
Thank you very much, sir, for your testimony. Next on the list, we have Jude Kyle.
Good evening. That's Judy Kyle.
Oh, I'm so sorry, Judy.
It's okay. I saw it on the list that way. Good evening, honorable members of the Appropriations Committee. My name is Judy Kyle, and I live in Norwich. I'm a licensed practical nurse at Harrington Court, where I've worked for the past 27 years. I stand before you today to say that nursing homes in Connecticut are in desperate need of funding, and we need your help. I entered the healthcare field 30 years ago as a CNA, and as I worked as a CNA, I considered my education and a career path that could provide for my family. I found the state of Connecticut offering an LPN program to help fill the nurse shortage in Connecticut. It seemed like a good opportunity and for my household, and at the beginning, it was. Consistency was key for my family as I have a daughter with special needs, and being home by 4 p.m. to take care of her was good for our family. Things have changed drastically in a few short years, and the demand for nursing home beds has grown exponentially. More of our residents require higher levels of care and documentation due to increasing levels of acuity. Many residents are elderly, but also many residents have behavioral episodes due to psychiatric conditions. We also have an increase in the number of residents recovering from addictions and have nowhere else to go. We love these residents and we love caring for them. They deserve the best care, but we struggle to provide them with the care and services that they need. Over the years, I've had the same number of residents, which is 32, but now I'm dealing with significantly less help to manage their care. In addition, we're acting as their wound care team, respiratory team, psychiatric team, and handling other serious diagnoses and issues because of staffing cuts and loss. The extreme workload is cutting into the one-on-one time we have to get to know our patients and their needs. We don't have unit managers, so when I'm trying to provide care for 32 residents, I'm also trying to manage my unit. Some residents can't be assisted by one caregiver, and you need to wait for someone else to be available to help you. We are less and less time to do our jobs. I normally work from 7 a.m. to 3 p.m., but the amount of work I have keeps me busy until 6 p.m. or later almost every single day. I'm skipping my breaks and my lunch to try and stay on top of the care for my residents. Finally, when my shift is done, I'm sitting and waiting for relief that never shows up. Our facility depends often on pool nurses that come from an area agency to fill the gaps when we don't have enough staff. These agencies cost the facility more money than the staff. We can't keep staff in our facility because of the low and unlivable wages we are paid. Caregivers are leaving the field, chasing less stressful jobs with better paying wages. We must pay nursing home caregivers what they deserve if we expect to address the staffing crisis. I'm here before you today on behalf of all nursing home healthcare workers, as well as the residents we love and care for. My co-workers and I will continue to fight for these critical services, and we need your help. Please expand funding for nursing homes so we can finally fix long-term care in Connecticut. Thank you for your time.
Thank you very much, Judy. Next, we have Liz Gustafson. I see you here. There you are. Madam.
Hi, good evening. Thank you, Representative Dathan, and good evening, members of the Appropriations Committee. My name is Liz Gustafson, and I am the Connecticut State Director of Reproductive Equity Now. Thank you so much for the opportunity to testify in the proposed budget this evening. As a state and regional organization, Reproductive Equity Now works in Connecticut and across New England to make equitable access to the full spectrum of reproductive health care a reality for all people. The ability to care for ourselves and provide a better life for our families should not be dependent on immigration status. We are very proud of our state for taking critical steps over the last few years to expand Husky eligibility, which has already had a positive impact, with over 15,000 children enrolled as of July 2024, as well as the enrollment of approximately 1,900 residents in prenatal coverage by those who would not otherwise qualify for coverage based on their immigration status, and approximately 2,000 people similarly enrolled in postpartum coverage as of January 2024. As mentioned, it is imperative that we continue to build on this progress made towards health equity, and we respectfully ask the committee to fund Husky eligibility for all income eligible residents, regardless of immigration status up to age 26, as well as increase the Medicaid reimbursement rate for safety net providers, particularly family planning clinics. As we continue to see threats to the rights of our immigrant neighbors and communities, as well as the ongoing attacks to healthcare access, Connecticut has the responsibility to reaffirm its commitment to health equity by taking action to ensure not only all residents can access the coverage and care that they need, which it also does include ensuring our state's safety net providers, including family planning clinics, can continue showing up for their patients and the communities that they serve. These endless political attacks, coupled with insufficient Medicaid reimbursement rates, while the cost of delivering care continues to rise, threatens to make equitable access to healthcare even further out of reach in our state. For safety net providers, including Planned Parenthood of Southern New England and Hartford GYN Center, this has meant absorbing unsustainable financial burdens in the name of providing comprehensive sexual and reproductive healthcare to everyone, regardless of who they are, how much they make, or their insurance coverage. And without an increase in Medicaid reimbursement rates, patients are at risk of losing access to this essential life-saving primary and reproductive health care. As such, we also respectfully urge the committee to fund an increase in Medicaid reimbursement rates for family planning clinics, because a meaningful investment in the ecosystem of healthcare would not only ensure our state's abortion providers are wholly compensated for the care provided to patients, but would also support the infrastructure that is necessary to provide equitable access to reproductive health care and abortion services for all Connecticut residents. So in closing, Reproductive Equity Now urges the committee and General Assembly to fund Husky eligibility for all residents, regardless of immigration status, up to age 26, as well as invest in our state's reproductive health care providers by increasing Medicaid reimbursement rates for family planning clinics and also abortion services, as they have not been increased or adjusted since 2008. Thank you so much for your time and consideration.
Thank you. Have a good evening, Liz.
Thank you.
Next, we're on Lainey Taylor. She is due to be in person.
Hello.
Apologies.
Hi.
Lainey. Carry on.
Hi, good evening. My name is Dr. Lane Taylor. I'm Chief Medical Officer for the Village for Families and Children, and I want to express great gratitude to this committee as well as the legislature at broad for the creation and development of the urgent crisis centers. Is a request to continue with blended funding for the urgent crisis centers, such that it is able to continue on I'm not only a chief medical officer, but I'm also an individual who actually provides care at these centers. And so I want to take my time to help you understand what this experience is like for families. About 2 years ago, we created an innovative level of care that was striking and was able to be a safe space for families and youth to receive crisis support. Whereas historically, families have had to go to the emergency department for support. This is a place that is a place for emergencies. It's a medical place. It is not a place that allows for healing and for psychiatric crisis services to be delivered in a calm and compassionate way. At the urgent crisis centers, we are able to provide an environment as well as staff that are able to provide everything from medical clearance all the way to emotional support in the course of 3 to 4 hours of care. You're able to walk straight into the urgent crisis centers as opposed to having to wait in a waiting room for triage as you might in the emergency department. I'd like to share a quick example of a youth that had previously been struggling with depression for about 3 years that I personally saw. This child had not told anybody about the degree of depression that she was experiencing and had finally kind of reached out indirectly to someone at school who then sent her to the urgent crisis center. When she arrived, she was reluctant to let us know the depth of her depression, but through the compassionate and kind care of the staff, she was willing to open up and help us understand that she's been struggling immensely for years. We were able to then provide her family with the support and aftercare services. We were also able to help counsel her family in understanding how to support her in this time of need. I just want to point out that she's an example of many youth who actually come in that do not have Medicaid services, and about 50% of our youth that come into the urgent crisis centers in the 3 locations of the community do not have Medicaid. So exclusively payment through Medicaid services, which is not yet billed out as far as how billing can occur, is not sufficient. It will not allow us to serve our kids, all of our Connecticut's youth. So I thank you again for your time, and I thank you so much for the opportunity to be able to create this program and build it out and provide the level of crisis support that has been needed for our Connecticut's youth for many, many decades. Thank you.
Thank you, Dr. Taylor. Next, we have Peter Fusek, who's on line, and apologies if I mispronounce your name, Peter.
Thank you very much, and very close to the right pronunciation, so thank you. And thank you all for your time this evening. My name is Peter Fosek. I'm a resident of New Haven, and I serve as the Secretary-Treasurer of the Connecticut Tenants Union. I'm the proud grandson of immigrants. I'm grateful for the opportunity to testify on House Bill 6864 in the Human Services budget this evening. I'm in favor of increasing Husky funding for our immigrant community and ask the committee to fund coverage through age 26, regardless of immigration status. It's also important to maintain what has been gained for children up to age 15 and for pregnant individuals, and to increase reimbursement rates for providers, which impacts the quality of Husky for all of our neighbors in Connecticut, immigrants or not. We're in the midst of a daunting moment in our national history, one in which we face a crucial choice. Will we concede to the worst and most base of our instincts, or will we stand up for what is right and just, all the more resolutely in the face of encroaching evil? By supporting the increase in Husky funding and expanding the ages of coverage regardless of immigration status, we as a state have the opportunity to do the latter and to thereby situate ourselves on the right side of history. Healthcare is, of course, a matter of life and death. So in simple terms, the question is whether we as a state are in favor of promoting life and ensuring that our people flourish, or if we'd rather take the callous and inhumane approach of watching innocent young people suffer because of where they were born. As we grapple with the decimation of federal healthcare funding, we must also think about the undue burden that would be placed on our already unsustainably strained healthcare infrastructure if Husky access is not expanded to our immigrant community as proposed. If folks don't have access to preventative or acute healthcare, then they become all the more likely to face a severe health emergency that turns what could have been a routine doctor's office visit into a multi-day ICU stay. So for the sake of our immigrant community and the decent and dignified healthcare that they deserve as a human right, and for the sake of our vital healthcare workers and our taxpayers and our healthcare infrastructure, we must fund Husky for all eligible Connecticut residents, regardless of immigration status, up to age 26. We must create a plan towards opening access to immigrants of all ages because healthcare needs don't end after your 26th birthday. Finally, I ask that the committee increase Medicaid reimbursement rates, which, as we've heard from many other folks testifying this evening, is a necessary step to ensure that current recipients can access care and that our vital healthcare workers can receive the compensation and support that they deserve. Thank you all for your time and consideration.
Thank you very much, Peter. Have a good evening. Next, we have Natasha Kurakanko. And apologies, I probably totally messed that one up. I see you online.
Hi, it's okay. Good evening, members of the Appropriations Committee. My name is Natasha Karanko. As a staff member of the Connecticut Citizen Action Group, I am here today representing our thousands of members who believe that healthcare is not a privilege, but a human right. I urge you to invest in expanding Husky coverage through HB 5430 and 5471 to all income eligible individuals up to age 26 and over age 65, regardless of immigration status. When voting on this issue, please ask yourself, will we be a state that protects the dignity and health of all its people, or will we allow birthplace and paperwork to determine who is worthy of care? There is a human cost to political indifference. Right now, 58% of undocumented Connecticut residents remain uninsured because policy has chosen to exclude them. Without coverage, people delay medical care. They wait until a treatable illness becomes an emergency. They avoid doctor's visits out of fear of medical debt. Uncompensated care costs fall on taxpayers, hospitals, and uninsured patients. Expanding Husky would reduce these costs while ensuring more people receive care before reaching a crisis point. Fiscal responsibility and moral clarity can coexist. Opponents will say that this is too expensive, but the numbers prove otherwise. Covering all income eligible individuals up to age 26 would lower the uninsured rate for young immigrants from 68% to 16.3%. The cost, just 3% of our annual Medicaid budget, a fraction of what we already spend on emergency care for the uninsured. We have a budget surplus. We have the economic resources to do this. What we need is the political will. Thank you for your time and consideration.
Thank you very much, Natasha. Next, we have Miche Lung.
Good evening. My name is Michael Lung, and I'm the Vice President of Operations for both Companions and Homemakers and Companions Forever. Our companies currently provide non-medical home care for a total of 815 older adults throughout all of Connecticut. The care provided to every one of these individuals is paid by Medicaid-funded programs. Our business focuses on those who are the most in need of assistance with daily living. While many of our competitors have been forced to pivot away from assisting federal and state-funded programs due to inadequate reimbursement rates, we have taken the opposite approach, but it has come at a cost. The impact that low reimbursement rates have on our workforce is not unique to Connecticut, but we are also feeling residual impacts of contiguous states that have taken action to increase reimbursement. As an example, Massachusetts has increased their reimbursement rates by up to 30% over the last few years, and as a result, we have lost many of our caregivers along the border. We have confirmed that caregivers working across the border are earning $19 to $22 per hour for providing care to individuals in federal and state-funded programs, whereas we are only able to pay $16.35 to $17 for the same services. With the systematic rise of minimum wage each year, our ability to pay our caregivers fairly has quickly diminished. Many applicants who have significant experience refuse to join a workforce where they rarely have an opportunity to make above minimum wage. Some of those who do decide to gain employment with our companies find it difficult to remain dedicated to the older adults they serve when they themselves are struggling to pay their bills. The result is a reduced quality of care, leaving individuals unhappy and at risk. In our industry, quality can only be ensured when the workforce is skilled, happy, and dedicated. Our 950 plus caregivers deserve the opportunity to support their families while providing these essential services. Past increases to Medicaid reimbursement rates have been reactive and for the bare minimum. What we need is a significant systematic approach that providers and caregivers can depend on annually. More specifically, we are asking for a 13% increase over each of the next 2 years, followed by 10% per year ongoing. The alternative is companies such as mine closing their doors and thousands of clients going without the care they depend on. The success of home-based services has been proven time and again. It is time for the state's Medicaid rates to accurately reflect the importance of this service and match the quality of care we are expected to provide. Thank you for your time and consideration.
Thank you very much, Michael. Next, we have Joseph Short.
Yes. Good evening, members of the Appropriations Committee. And thank you for allowing me this opportunity to testify on the proposed Human Services budget. My name is Joseph Short, and I'm here to testify on behalf of the Centers for Independent Living. First off, thank you for ongoing support. But like many of the vital nonprofit agencies testifying here today, our funding remains far behind inflation, and we cannot continue serving the entire state with our current budget. Therefore, I'm requesting that you increase the funding for the Centers for Independent Living by $1 million annually so that we can meet the increased demand and continue serving individuals with disabilities throughout Connecticut. I've been a quadriplegic since 2002, have a master's degree in social work, and have been an independent living advocate for over 10 years. Centers for Independent Living are unique because they're primarily run by qualified individuals with disabilities such as myself, who have both professional and lived experience. The term Centers for Independent Living means a consumer-controlled, community-based, cross-disability, non-residential, private nonprofit agency that's designed and operated by individuals with disabilities and provides an array of independent living services to consumers at no cost. Services include independent living skills training, peer counseling, advocacy, information referrals, benefits advisement, transition from or avoiding unnecessary institutionalizations, youth transition services, and more. The size and the scope of these services are ultimately decided upon by available funding. People want services as soon as possible because they're losing housing, being discharged from a hospital with a new disability, need help navigating the system to get accommodations for their disabled child, or someone wants to change their life situation and try working while keeping a support system. Centers for Independent Living staff are experts at helping individuals gain access to social safety nets and navigate the vast systems that could shape their futures. I want to be able to help these individuals immediately, not put them on waiting lists or turn them away because of funding constraints, while Connecticut's fiscal health is the strongest it's been in a generation. All the staff members at the 5 Centers for Independent Living are currently working at or beyond capacity, and the demand for services continues to increase, yet the funding has stagnated for years. Connecticut's 5 independent living centers are asking for the legislature's support of $1 million increase, which is only an additional $200,000 per center annually. A funding increase would support vital services to individuals with disabilities throughout Connecticut and begin to restore the long-term underfunding of the Centers for Independent Living. Thank you very much for your time and consideration, as well as your ongoing support. Have a great night.
Thank you very much, Joseph. Next, we have Jacqueline Henry. Okay. Jacqueline, if you are an attendee, please promote yourself. If you haven't, we are moving on. Brian. Oh, thank you. Brian Ugari. Brian. All right, moving on. We have number 176, Anna Galakos. She's remote. I don't see her on the list. Gallegos? No. Okay. Next we have Sharon, Capella. I thought I saw her on. Yep, she's right there.
Yep, I'm here. Can you hear me?
Adam. Yes, we do. Thank you.
Oh, good. Okay, thank you. Good evening, Senators Lesser, Austin, Representatives Dathan, Exum, Delaney, Gilchrist, Walker, and Gibson, and Nuccio, and esteemed members of the Appropriations Human Services Subcommittee. Thank you for the opportunity to offer testimony on behalf of the Connecticut Counseling Association in regards to HB number 6864, an act concerning the state budget for the biennium ending June 30th, 2027, and making appropriations thereof, specifically the need to increase Medicaid behavioral health rates. My name is Sharon Rose Capella from West Haven. I'm a member of the Connecticut Counseling Association and a Master of Counseling student at Southern Connecticut State University. Still wrapping up my hours of field experience in my internship. Connecticut Counseling Association is the only professional organization that represents over 4,700 professional counselors, 1,000 professional counselor associates, and hundreds of counseling graduate students here in Connecticut as a branch of the American Counseling Association. Medicaid behavioral health rates for practitioners, including counselors, represent the greatest rate disparity, 44.2% of rates falling below the benchmark compared to 5 other Medicaid states surrounding. Quoting Andrea Barton Reeves, Commissioner of the Department of Social Services of the state of Connecticut, in her cover letter on the Medicaid rate study report for phase 1 in February of 2024, quote, "The rate study revealed the single greatest reason for fee schedule rates for physician, behavioral health, and dental rates is the current approach does not include timelines for rate adjustments to recognize increases or changes in the system, such as inflation, workforce changes, and updates to clinical best practices. Currently, the rate change has often been mandated on an isolated case-by-case basis by legislation and/or funded by specific state budget appropriation. This makes it difficult for providers and the department to track rates and ensure predictability in payment on an ongoing basis," unquote. With lack of rate timeline transparency, lack of adjustment based on Medicare percentages and market adjustments, and adequate reimbursement rates for practitioners, at least comparable to those in the 5 competing Medicaid states, practitioners are placed in a position where their calling to help clients is at odds with their ability to do so. Behavioral health services are preventative care, safeguarding the mental health of the community at large. Increasing Medicaid behavioral health rates would be an investment in that community, with positive ripple effects impacting the future of this state. Thank you for allowing me the opportunity to provide testimony on behalf of my fellow counselors and the many patients we serve across Connecticut. Respectfully, Sharon Rose Capella.
Thank you, Sharon. I appreciate that. Next, we have Curtis Rodowitz. I am so sorry. Rodowitz. I don't see him. He was here earlier. All right. Next, we have Leonella Villajas.
Yep, here. Thank you. Dear chairs and members of the Appropriation Committee, my name is Dr. Leonella Villegas, and I am a pediatric nephrologist or kidney specialist practicing in Hartford. I am also a member of the Connecticut American Academy of Pediatrics Chapter Advocacy Committee, which represents over 600 pediatricians in Connecticut, and the co-leader of the Healthcare Provider Subcommittee in the Husky for Immigrants Coalition. I'm here today to express our strong support for expanding Husky Medicaid to include all Connecticut residents, regardless of immigration status, up to the age of 26. I want to echo what others have shared before me, that without access to adequate insurance and healthcare, immigrant children are at significant risk. As a pediatrician, I've witnessed firsthand the challenges faced by our vulnerable undocumented children, despite the current Medicaid coverage that extends only until the age of 15. These challenges include delayed diagnosis and care, delayed access to subspecialists like me, worse mental and physical health outcomes, and most recently, fear of seeking care due to concerns about ICE and the risk of deportation of themselves or their family members. These delays and gaps in care not only harm the children themselves, but also contribute to a growing healthcare burden, resulting in more emergency room visits, greater strain on resources, and long-term social impacts. Additionally, when care is delayed, children often present to healthcare services when they are sicker, leading to missed school days and families having to take more time off of work. And in the past month, I have noticed a shift in my demeanor of my immigrant families and patients. They are asking more questions and expressing concerns about the future of their care. They worry that their current Medicaid coverage might be taken away, leaving them without access to me or their necessary medications, something that many of us didn't have to consider when we were 13 years old. My older patients are often forced to make painful choices between paying for their annual checkup from a kidney perspective or paying for college housing. Yet, despite these financial pressures, they still come to clinic. They still show up, understanding that kidney disease is a silent killer. Unfortunately, some do not seek care, and I later see them in the emergency room or the ICU setting, where the complications are far more severe with a worse prognosis. Every day, pediatricians work tirelessly to support our patients and prevent harm, rather than simply reacting to illness. Our healthcare system is currently not set up for prevention, but expanding access to care is a crucial step. Let's ensure that all children, regardless of immigration status, are given the opportunities to succeed as healthy adults, because improving care for the next generation will build a healthier community and workforce in Connecticut. We want what's best for our patients, and we hope that you will help us take the next step toward making this vision a reality. Thank you for your time, and I would be happy to answer any questions.
Thank you so much, Doctor. Next, we have Michaela Bosom.
Hi, good evening. Dear Senators and Representatives, my name is Dr. Michaela Bosom, and I am the Director of the Urgent Crisis Center, also referred to as the UCC, at Child and Family Agency of Southeastern Connecticut, located in New London. And I am also a resident of Ledyard, Connecticut. I currently oversee the operation of one of the community-based UCCs. I come before you regarding HB 6864 to request funding for urgent crisis centers in the entire state of Connecticut in the upcoming biennium budget. UCCs provide immediate assessment, stabilization, and connections to ongoing care for children and youth in acute mental health, behavioral health, or substance abuse crisis. We owe Governor Lamont and legislature gratitude for starting the innovative UCCs as part of your response to the behavioral health needs of our young people. The governor's budget provides continued support for UCCs using Medicaid funding. However, we are concerned with sustaining the UCC model with Medicaid rates that do not cover the cost of the clinical services. Additionally, 50% of the UCC clients do not qualify for Medicaid, so Medicaid would not cover the cost of services these individuals receive. I respectfully request the budget to include DCF grant funding totaling $9.4 million, which is necessary for fiscal year 2026 to maintain the state's commitment to the UCCs and the children they serve. This funding mechanism will allow the UCCs to evolve as utilization increases and the viability of other financial supports, including private insurance, are enhanced and incorporated into the program's funding. Since opening, the 3 community-based UCCs have provided just shy of 2,000 episodes of care for children ages 0 to 18 experiencing a behavioral health crisis. These episodes have involved crises to include depression, anxiety, family conflict, disruptive behavior, school avoidance, and risk of harm to self or others, including suicidal ideation. The UCC is a cost-effective alternative to utilization of a local emergency room. 95% of the UCC interactions have resolved with successful treatment completion, discharge with a safety plan in place, and referral to appropriate follow-up. The urgent crisis centers are critical support options for multiple referral sources, including school districts, EMS and first responders, pediatricians, community providers, summer camps, and most importantly, the families of the state of Connecticut. Surrounding schools have shared that the UCCs have been a game changer for their students. Referral sources speak very highly about the work the urgent crisis centers are able to do. The safety plans created at the UCC have been able to be used in various domains and give hope to the youth themselves and the families. By providing our systems-focused approach, we are able to help families fix the foundational cracks within their system and give hope to a healthier tomorrow. I respectfully request designated UCC grant funding to support behavioral health for children and their families. Thank you.
Thank you very much, Michaela. Next, we have Johnny Burke.
Hi, good evening, Senator Lesser, Representative Gilchrist, and distinguished members of the Appropriations Human Services Subcommittee. My name is Johnny Burke. I am the Associate Executive Director for Hospice and Palliative Care at Masonic Home Health and Hospice, a not-for-profit provider of medical home care, hospice, and palliative services. We provide care for approximately 1,200 patients throughout the state of Connecticut. I have dedicated 19 years of my career caring for individuals in need of health care, many whom rely on Medicaid. For the past 3 years, I have been responsible for managing referrals for home care services. The urgency of this matter cannot be overstated. Within the past year alone, 41 states have reported permanent closures of home care providers. As we approach what many refer to as the silver tsunami, the demand for home care services is surging. Yet we are facing an unprecedented labor crisis. Low Medicaid reimbursement rates compounded by insufficient reimbursement from managed care providers are devastating home health organizations' ability to recruit and retain caregivers. This has resulted in longer wait times for patients, and in many cases, it has left us unable to provide the critical care that patients desperately need. The current Medicaid reimbursement rate falls far short of covering the actual costs of providing essential care, making operations unsustainable. For every Medicaid patient we serve, we incur a loss, further preventing us from being able to offer competitive wages to staff. As a result, home health and hospice providers are struggling to retain the skilled workforce required to meet the increasing demand for services. The staffing crisis is accelerating, and it is becoming harder to keep up. At the same time, acute care hospitals with higher pay scales continue to attract our caregivers, further intensifying the shortage. We are at a breaking point. Without immediate and significant increases to Medicaid reimbursement rates, the quality of care for some of Connecticut's most vulnerable populations will be compromised. We cannot continue to provide services under the current funding structure. If we are to meet the healthcare needs of our residents and ensure that they receive the care they deserve, we need funding that reflects the true cost of care delivering these essential services. I urge you to act now, increase Medicaid funding so that home health and hospice providers can sustain their operations, retain skilled caregivers, and ensure that we can continue to serve our communities without sacrificing the quality of care. The time for action is now before we reach a crisis point from which we may never recover. Thank you for your immediate attention in this urgent matter.
Thank you, Johnny, for your testimony. Next, we have Michael Knock. I didn't see him a second ago. Nope. Okay. Michael, calling last. Next, we have Dana Hillman Sabato.
Good evening, members of the Appropriations Committee. My name is Dana Hillman Sabato, and I am a clinician who now supports the implementation of Child First throughout the state of Connecticut. Thank you for this opportunity to share information about the Child First program and your support of community-based organizations serving young children and their families. Child First is an intensive early childhood mental health home visiting program that helps struggling families build strong, nurturing relationships that heal and protect young children from the devastating impacts of trauma, adversity, and chronic stress. With over 200 families awaiting Child First services at this time, including 74 families at one site alone, we are grateful for the ongoing investment in Child First. We were first established here in Connecticut, where we have been operating for over 20 years. Our trauma-informed model is a multi-generational team approach. A mental health professional and care coordinator engage with children and caregivers in their home 1 to 2 times per week for 6 to 12 months. The care coordinator connects families with needed services to help reduce stress and support healthy child development. Child First is unique in that we are a clinical service and we provide in-home psychotherapy to parents and children who are most impacted by trauma and toxic stress. As part of the Connecticut continuum of family support programs, we fill a critical gap in services for families with very young children who have acute needs. Child First is supported by a foundation of data and research that demonstrates the essential need for our service. Additionally, Child First completed a randomized control trial in 2011, and program participants experienced a 64% decrease in maternal depression, a 42% decrease in child aggression and behaviors, 40% reduction in child welfare involvement, and a 68% decrease in child language problems. And we continue to evidence outcomes that reflect that original RCT finding. Research consistently demonstrates the deep impact that toxic stress has on brain development, as well as one's physical and mental health throughout their lifespan. And we appreciate the most significant impact occurs when interventions are provided during the earliest, most critical years of a child's life. I believe Child First is that vital intervention, and I ask for your continued support to maintain the current levels of funding for our program. Thank you.
Thank you very much, Dana. Next, we have Jennifer Chidukovitz. I did live in Poland for a number of months, so I could get the last bit, but the first bit I was a bit nervous about. Thank you.
Representative Dathan, and honorable members, some of my favorite people here tonight, so good to see you all. My name is Jennifer Chidukowicz. I'm a citizen of Cromwell, and I'm the Chief Strategy Officer of SCAD. We have 213 employees living in southeastern Connecticut and serve 5,000 Connecticut citizens a year. An equally important hat that I wear here today is that of a woman in long-term recovery. I'm in my 36th year of recovery, and I was able to attend a long-term treatment program just like SCAD's Lebanon Pines program. Because of that, I'm able to make a difference in many people's lives today, and I'm very grateful for that. Thank you for the opportunity to testify on House Bill 6864, the governor's budget. I'm here to request that you increase funding for vital nonprofit programs like these by $264 million in fiscal year 26. That's the last scripted part I'm going to read. All right. SCAD has previously provided testimony on our staffing shortages, the inability to pay comparable wages, the cost of living expenses related to our predominantly residential programs. Today, I'm going to ask for an increase to the Medicaid behavioral health rates, which fund services provided to our clients and specifically our outpatient behavioral health clinic. Most of SCAD's outpatient clients are insured through Medicaid. The behavioral health rates for non-residential programs are not sustainable. SCAD must subsidize this vital programming to ensure the doors stay open and staff remain fully employed, and let me tell you why. Outpatient clients are a unique demographic, and I'll say they're special. Ones that should be commended for their dedication and devotion to their health, recovery, families, employers, and communities. For example, a community member who seeks outpatient care has made a commitment to their own mental health, to treating and healing their traumas, to end the cycle of addiction in their family, all while maintaining their employment, staying in the home with their children, and remaining a vital member of the community fabric. These clients are doing it. Another perspective to consider is that some clients also might not have the privilege, which goes along with the ability to take 30 to 45 days off of work to seek treatment. They may fear going to treatment to put their children with unstable family members, or an even bigger fear, into the foster care system with no guarantee they will ever get their children back. Without increasing the funding to Medicaid behavioral health rates, SCAD will be unable to sustain outpatient programming subsidizing outpatient programming, which is in the red. This is just one reason we need the state budget to increase Medicaid rates to ensure proper payment for non-residential behavioral health treatment, ensuring the person has mental health parity, privacy, and opportunity to seek and find a recovery pathway that works for them and their families. I can provide clarity on the difference between the rates of residential versus non-residential reimbursement through Medicaid as it relates to the 1115 waiver if you like. You already know there's a shortage of clinical staff available to serve people with mental health and substance use disorder. We're losing clinical staff to other states, telehealth companies, school districts, hospitals, the state, private practice, all because what Medicaid pays for services doesn't allow us to pay those staff competitively. Thank you very much for the opportunity. Please support increasing funding by $264 million. Thank you so much for the opportunity to testify.
Thank you, Jennifer. Next, we have
Dathan. I did email you that information you asked for yesterday. I emailed it.
Oh, awesome. Thank you. Scott Langer.
Hi, I'm Scott Langer. I'm from Willamette, Connecticut. I would like to thank the members of the Appropriations Committee for hearing my testimony. My name is Scott Langer. I lived in a supported house by Horizon since 2016, and since then I had over 50 house staff, and sometimes it gets annoying. I would like to say that this DDS budget hasn't made any progress over the past years, right before the coronavirus started. Horizons is struggling to retain qualified staff to support me in my main activities, such as volunteering at the Bushnell, ballet under the stars in West Hartford, Connecticut, at Elizabeth Park, bowling, and many other activities. In the last 4 years, I have had 4 managers. This has been difficult for me to work with new managers because it takes time. It takes some time to understand how important this is to me, just not them in real life. Due to staff issues, I haven't been able to participate in some community outings like Harvard Symphony Orchestra events in the Belden Theater at the Bushnell. I urge Nahomont and all the legislatures to approve for a increase to nonprofits so that they can pay staff a living wage so I can have more consistency at Horizons for those that support me. I have had too many support coaches from Horizons with me at OWC, causing distractions in the front office. I haven't done any class courses for ECSU either. I'm looking forward to opportunities to play role models in musicals like The Lion King, Moulin Rouge, and other musicals. In order for me to do this, I need qualified staff to support me. I would like ECSU to be reinstated in a new budget for Connecticut because I miss and hanging out with students on Monday nights. I would also like to be part of a Eastern Warrior swim team. I don't want to be at OWC for 77 years because I need to move on. If you have any questions, I'll answer those, and I support House Bill 06864. Thank you.
Thank you, Scott, for your testimony. It was great. Next, we have Mario Dikia. Mario. Oh, there he is. Okay, you have 3 minutes, sir.
Thank you. Good evening, distinguished members of the Appropriations Committee. My name is Mario D'Aquila, and I'm the Chief Operating Officer and co-owner of Assisted Living Services, Inc. I also serve as the chairman of the DSS Medicaid Committee for HCAOA Connecticut, and as a member of the Board of Directors for Connecticut Association for Healthcare at Home. I'm here today to advocate for an increase in Medicaid reimbursement rates for home care providers. Currently, we provide services to well over 400 seniors funded through Medicaid waiver programs, such as the Connecticut Home Care Program for Elders. Our agency provides homemaking, personal care, live-in companion care, adult family living foster care services to seniors throughout the state of Connecticut. We urgently request an increase in Medicaid waiver program reimbursement rates because without an adjustment this year, our agency and many others just may not be able to financially sustain taking on any new Medicaid waiver clients going forward. Just some key considerations to include is on January 1st, 2025, we know Connecticut's minimum wage increased from $15.69 per hour to $16.35 per hour, which was a 4.2% wage increase. Last year, the minimum wage rose from $15 per hour to $15.69 per hour, and that's a 4.6% increase. So with these combined wage increases of nearly 9%, providers have not received any corresponding rate adjustments to offset rising costs. And with that, in 2026, minimum wage is set to increase again in the alignment with the percentage change in federal employment cost index. In addition to that, to these mandated wage increases, last year the state approved the 26% wage increase for the independent personal care attendants, PCAs, under the SEIU contract. And this has created a significant wage disparity between independent PCAs and agency-based caregivers. So our request really is, beginning in June 2025, agency-based providers should receive a 13% increase in Medicaid reimbursement for the next 2 fiscal years, followed by a 10% annual increase in subsequent years. Also, to implement a retroactive 4.2% increase effective to January 1st, 2025, to account for the mandated minimum wage hike at the start of the year. Without these adjustments, our agency and many others may not be able to continue accepting these new clients funded under Medicaid waiver programs. For the past several months, we have been receiving client referrals from access agencies all across the state that struggle to find home care providers due to these low reimbursement rates. However, we're facing the same challenges in staffing these clients. Home care agencies played a critical role in caring for seniors at home during the COVID-19 pandemic. We were there when nursing homes closed, ensuring a safe transition for vulnerable individuals. And today we're asking for this reimbursement increase so that we can continue to be there when seniors need us most. Thank you.
Thank you, Mario. We are just going to go at ease for a minute here while we restart the Zoom. If you do lose your place, which you might. Oh, excuse me. It's just the YouTube. That would have been a real disaster.